A very good morning, healthy and spirited morning to our honorable resource persons for the day, Dr. Ali Irani and Dr. Neeta Bandyopadhyay, respected dignitaries, enthusiastic faculties, and dear participants. Today, on the 18th March 2021, I, Dr. Purvi Kothari, heartily welcome you all to the National E-Conference on Advances in Sports, Exercise, Science, and Pedagogy of Physical Education, organized by Sir K.P. College of Commerce, Surat, which is a NEC accredited A-grade college. It is the pride of Surat, which is affiliated to Veer Narmat, South Gujarat University, and strongly supported by Sarvajanik Education Society. Actually, today we are taking benefit of organizing this session on physical education during the COVID era, where all have understood the importance of emotional, physical, and mental health. And to mention the enthusiasm of the participants, I would like to appreciate that there are exceeding 200 participants who have shown up for this conference. The efforts of few participants who have written research papers are worth commending. We congratulate the energy and effort of all of them. Needless to mention again, 24 selected papers shall be presented sequentially on three parallel tracks. And without taking much more of your time, I would request our principal, Dr. Madhuri Narona, to please come forward for the welcome address. Over to you, Principal Madam.
Thank you very much, Dr. Purvi. Respected Chief Guest and Resource Person for today's National Conference, Dr. Ali Irani, Sports Committee Chairman of Sarvajanik Education Society, CA Mayang Desai, Resource Person Dr. Neeta Bandyopadhyay, Chairperson of Ethical Sessions, Principals, IQAC team, Organizing Secretary Dr. Jignesh Tandil, my colleagues and my dear participants. Good morning, and on behalf of Sir KP College Parivar, I extend a very warm welcome to one and all to today's National E-Conference on Advances in Sports, Exercise Science and Pedagogy of Physical Education. We are all familiar with the
આવે છે ને યુટ્યુબ પર નહીં આવતો પ્રકાશભાઈ ઓનર્સનો એસઆઈબી તો સિલેબસ એ સર હવે છે ને આ ટીચર્સ પાસે જ માંગવો પડશે કેમ કે બદલેલો છે કયા ટીચર્સ હા ટીચર પાસે હા કેમ કે છે ને સર બધા સિલેબસ રિવાઇઝ કર્યા છે અચ્છા એટલે મારી પાસે જૂનો છે એટલે હાલમાં એ લોકો પાસે લઈને જ આપવું વાંધો નહીં સર હા ને યુટ્યુબ પર એવું અવાજ આવે સંજય યાર હવે આને મ્યુટ ક્યાંથી કરું બધાને રિક્વેસ્ટ કરવા કહું તો બીજા માઇક ઓફ કરો એમ કહું કારણ કે આ કોઈકનું ચાલે છે ને એટલે બહુ અવાજ આવે બીજું ચાલુ છે તો બીજાનો જ અવાજ આવ્યા કરે છે. પણ અહીંયાથી જાય તો તારા એના પર તો મેડમનો જ આવવો જોઈએ. હવે કોનો આવતો હશે? સરનો જ આવતો હતો યાર. કોને હેન્ડ ઓવર કરી? અહીંયાથી તો બંધ કરી દીધું બધું. પણ હવે કોને હેન્ડ ઓવર કરે છે મને ખબર જ નહીં પડતી યાર. ચલો.
The sports technique or sports education has gone so AI based that we can reach anyone anywhere. I'm not the expert in this. Dr. Irani and Dr. Bandyopadhyay will be able to give you more light on it. But as we travel a lot to say Australia and US, I see their science and sports as far better than what we are having here. As a sportsman and sports person, I would like all my physical education professors to go in depth of all techniques, all materials available, and all sciences available in exercise and sports, and teach all students whatever you can by not by the traditional method, but by the new methods which is available in the world. Sports for all, health for all is a mantra, and rather than wasting more time, I would love to, invite Dr. Irani and Dr. Bandyopadhyay to throw lights on advance in sports, exercise science, as well as physical education. And I'm sure that you know, by saying that let's pledge health for all. Thank you. Over to you, Dr. Purvi.
Thank you, Mayank sir. We appreciate your vision that you want to see every child on the ground, and we are absolutely very optimistic that after today's session and after the inputs by our resource persons, we will be able to make a big change. Well, a name which needs our hours and hours of introduction is Dr. Ali Irani. I would not like to put it up in small words, so may I request Dr. Smita Khawani to please come forward and introduce the chief guest, the keynote speaker for the day, Dr. Ali Irani, who's addressing us all over from Mumbai. Over to you, Smita, madam.
Thank you, Purvi ma'am. I feel very honored to introduce a distinguished and knowledgeable person, Professor Dr. Ali Irani, as the chief guest for today's conference. Professor Ali Irani is a doctor by profession and a very well-known name to many of us. He was the physiotherapist for the Indian cricket team from 1987 to 1997. With regard to his qualifications, Sir acquired his bachelor's degree from MS University, Baroda. He then moved to Spain to acquire his doctor's degree from NUMS. Currently, he is the head of the Department of Physiotherapy and Sports Medicine and Rehabilitation Center at Nanavati Super Specialty Hospital, Mumbai. He is also the chairperson of the International Affairs Indian Association of Physiotherapists. Besides pursuing his profession, Dr. Ali is closely associated with academics. He is currently the principal of NMIMS University, Mumbai. He proudly holds a double doctorate degree, one in sports medicine and the other in anatomy of body movement and dance, Bombay University. From working as a researcher to presenting several of his works in various national and international conferences, Sir has contributed immensely in the field of research. He has also guided several PhD students. On field too, Dr. Ali has played a very active role. He has conducted various workshops on physiotherapy and played a key role in setting up the Physiotherapy and Rehabilitation Center at Bhuj in Gujarat for earthquake victims. In consideration of his meritorious contributions to the field of physiotherapy, Sir has received several awards, some of which include the Hitra Oration Award in 1994, Lifetime Achievement Award in 2004, Best Citizens of India Award 2011, Best Physiotherapist Award in 2014, just to name a few. Sir, we feel very proud of your outstanding achievements and your noble acts of humanity, and feel very privileged to have you with us today. We warmly welcome you, sir, and look forward to hearing you. So you can now begin your keynote address. Over to you, sir.
Good morning, everybody. My special thanks to the Sarvajanik Education Society, Chairman Kamlesh Yagnik. My thanks to Principal Ms. Martina, Mayank Desai for your kind words, and Dr. Neeta Bandyopadhyay, who is going to be sharing with me the session. And my special thanks to Smita and Purvi with your kind words. Uh, I'm really happy that I'm going to talk on sports. So as it was discussed with Dr. Janvi, to have the base, no sportsman can be a sportsman not having fitness. So I thought I will first take the topic of fitness, which is not only for sports people, it's for all of us. All those who are hearing me, maybe my talk will somewhere help you and correct yourself where you are going wrong. So I'm going to take you through a whole session. Okay, we were born fit. What happens with period of time that we become unfit? Then we look out for how to become fit. As we age and get matured, we want to become fit. We try a lot of things. And then at the end, I will say what is the right way of becoming fit. I'm open, and whenever you tell me, I'll start my presentation.
Yeah.
Sir, please, you can start your presentation.
Yeah. Am I visible and audible?
Yes.
Yes, sir.
Give me a minute. I'm coming. Which one? Okay, I'm going to come to the sports. Hopefully, after this talk, we'll be well prepared to talk about the sports fitness. So today I'm not going to talk about this super fitness. We call it super fitness, where you are able to do anything, any movement, any flexibility. To achieve this fitness, we have to have the basic fitness, which most of the Indians, I would say rather 80% of the Indians don't have it. Most of us have problems like, as we age, we have problem like blood pressure, diabetes, neck problem, shoulder problem, back problem, knee problem, and one of the cause is having extra weight. So today I'm going to tell you all what should be the exact weight that we should be carrying. So let us define, what does World Health Organization WHO say about the right weight. So whatever your weight has to be, when you have 10% more than that weight, not to worry, I'll tell you what should be your weight also in a simple formula. So if you are excess by 10% of the weight required by your body, you fall under the category of obesity or excess weight. So what should be the weight? Very simple. Take your height in centimeters and minus by 100. Are you all seeing the slides changing? Can somebody tell me? I am going through my presentation.
No, sir.
No?
The slides are not changing.
Oh, let me come back. Because I've gone 4 slides. It's constant. 1 second. Let me just reset it. Just give me a minute.
Yes, sir. We can now see.
Yeah. Uh, It was not changing. I'll just start again. Is it changing now?
Yes, sir, perfectly.
Yes.
Fine,
Yes.
fine. Sorry. So today's topic is coming to sports before becoming a sportsman or being super fit like this. This is called super fitness. To achieve this, we require the basic fitness. So I'm going to talk on the basic fitness, but you, me, all of us need it to become a sportsman or to become a super fit person. So, what does WHO say about fitness? We'll come to that. So, why we are going to talk on fitness is 80% of Indians have one of this problem or have all of this problem. So, talking about blood pressure as you age after 30, nowadays it does come below 30 also. Then most of our half of the Indians go into diabetes, high sugar. Then more than 85% have neck problem. Then with IT coming in and lot of corporates coming in, we have the shoulder problem, the back problem, knee problem, and one of the cause. I'm just talking about one of the cause. Rest of the cause will come as I'm talking on it. One of the cause is excess weight. So your question would be, what should be our exact weight? So first, let us see, what does WHO say? World Health Organization says if you have 10% more than your normal weight, whatever your weight has to be there. I will tell you the formula in the next slide. If you excess by 10%, suppose you have to be 60 kgs and you become 66, so you fall under category of being obese or excess weight. So what is the right formula? Please take your height in centimeters and minus by 100. That should be your weight for males, because we want the females to look better.
Sir, we cannot hear you.
Sorry, am I audible?
Yes. Yes, sir.
Sorry, am I audible now?
Yes, sir. Perfectly.
Yes, you are audible.
Am I audible?
Yes,
Yes,
sir.
sir.
Sir cannot hear
Suraj.
us. Uh, sir cannot hear us.
Fine. Am I audible and visible?
So you're audible, you're visible, but your presentation is not to be.
Hello, am I audible?
Yes.
Sorry, am
Am
I
I
visible
visible now?
now?
Yes, you are visible, you're
Sorry,
audible, sir.
sorry, my battery.
Please unmute yourself, sir. Dr. Irani, please unmute yourself. Now you are audible, sir.
Fine. Am I audible now?
Yes.
Just let me start my presentation. Okay, we were talking about what should be the normal weight. Take your height in centimeters, minus by 100 is for men, and if you minus by 105 for females, because we want them to look better. So very simple. If you're 160 centimeters and if you are a male, you should be 60 kgs. The day you become 66, you are becoming obese. And if you are suppose 175 centimeter, if you are a male, it is minus 100, you can be up to 75 kgs. But if you are a female, you have to be only 70 kgs, minus 105. Uh, Once you have taken your weight in centimeters, just minus with 100 or 105 as per your whether you're male or female. And now some of the females are underweight. So if you are more than 10% below the weight required, you are supposed to be 60 kgs, but you are 54 kgs, you are 52 kgs. So you fall under the category of being underweight. So just please within that 10% of whether if you are whatever weight you have to be, you can play 10% up and down to be on a normal weight. We have a unit called, I'm sure your physical therapy unit must be having a unit which we see the fat content. So sometimes a person may look slim, weight also is perfect, but the fat content will be more. We are looking at anywhere between 12% to 20% of fat. Females can go up to 22% of fat. But survey shows most of the Indians are more than 30% fat. And still the world called us a malnutrited country. They don't come and look at our fat content. Especially from all the states in our country, Gujarat is known to be the most unfit state because everybody's fat content or majority of the fat content of Gujaratis are more than 32% because of our eating habit. We want a puri rather than a fulka, and even if it is a fulka, we want a lot of ghee on it, and we have a lot of fried foods like samosas, pakoras, bhajiyas, so puris, and lot of sweets. That makes us into individual that we are having excess sweets, so excess calories. I'll be coming to the calories, how to calculate and what to do in my later on slide. So with this body fat analysis, we see a fat content of a person. Please be sure you should be around 20% fat. Only marathon runners have less than 10% because they have to be more than 12%. Because they run for long hours, they run when they start running, they run for 2 hours at a time. So within 45 minutes, the carbohydrates gets over. Body goes. Carbohydrate is the fuel of the body. So that the body takes the carbohydrate from the fat. So the fat starts burning. Right? In a very simple way, if I have to say, you will say, I walk half an hour every day. I would say don't walk half an hour every day. Walk alternate days, but 1 hour 15 minutes. So in each time you walk more, you will burn the fat. After 45 minutes, your body will start burning the fat. So if you walk half an hour a day and five times in a day also. Say I walk in the morning, I walk in the evening, I walk at night also, that because of that being half an hour or 20 minutes, it's of no use. Australians will run once a week, Saturday or Sunday, but they run for 3 hours. So the first 1 hour they burn the carbohydrate, the rest 2 hours they are burning the fat. So we have to understand that when we walk every day, we say we are exercising every day and we are not getting fit. The reason is this. So it's much better if you are doing anything cross 1 hour. So after 1 hour, the body starts burning the fat. So if you are walking for 45 minutes, you are just touching the fat and then you stop. So let us find out the elevation of being unfit. So it doesn't happen overnight. It happens with time because it is gradually every day you are having excess calories, and I will come to it how many calories makes a kg of weight. Look at these two best friends, how they were going to school. Now both have become on high ranking police officers, but they cannot hug each other. The reason being their BMI has gone haywire. The BMI, basic metabolic index, has gone higher than 27. The normal is between 18 and 22, right? So this is one of the reasons. The formula is height in kgs versus height square. That's how we derive what is your BMI. Now, how it starts? I always feel it starts with overeating at home. Especially the male feels that if they don't finish what is kept on the table, it is put in the tiffin the next day. So they don't want to have a food of one day earlier. So they try to finish whatever is kept in front of them. Especially when you go to a restaurant or hotel. So the person who's paying feels he has to finish it. So in short, we overeat. Second, the parties. We have to understand when you go for a party, including wedding, wherever you go for a party, what is served. It's a lot of nuts, especially cashew nut, fried and salty. Please, next time when you pick up a cashew nut, understand each cashew nut is 16 calories. To burn that 16 calorie, you have to walk 100 steps or 100 meters. So each time, and when you start picking up cashew nut, you don't count. You may go up to 100, also. Right? So you keep eating because it is tasty. Second thing, what is served in parties are fried foods, pakoras, spring rolls, samosas, bhajiyas, French fries. So these are the things served on parties. These are a really a very high calorie food that you are taking, not understanding. And of course, in Mumbai and big cities, there are drinks also with it. So just to show you what a drink can do, this was clicked at West Indies. So we saw a drunken person talking to a statue for almost more than an hour. He was talking because all he needed, he had to just pour out, and there was somebody listening to him. Right. So one of the reasons what drinks could do is this, and they say that when you are drunk, you tell the truth. So, just a friendly advice to all, when you drink, and especially when you join a job, there is a party in the evening. If it is kept by your office, remember the party is kept so that you start drinking and then start talking the truth. Right. So, most of the people that corporates, when they keep parties and there is drink, it is only to understand you more because that's the time that you are telling the truth. Second reason is going to the fridge in between the meals. So please understand, what do we eat when we go to the fridge? We don't go to pick up anything from the down shelf. See the shelf down full of vegetables? You will not pick anything from there. We are looking for chocolates, ice cream, sweets, right? Some soft drink or some milkshake. These are all high calorie. To have it between the meal, that is one of the reason. And if you make a habit of it, then you are going to be. So if you are going to have it, it's high calories. So if in short I want to explain your calorie, please understand, if you are carrying 1,000 rupees a day to go to college or go to work, and you spend only 500, 600 rupees per day, end of the month you have saved something. It is exactly the same. We are eating suppose 3,000 calorie a day. Our each meal is 1,000 calorie minimum. So if you are having 3,000 calorie a day and you are burning only 2,000, so that 1,000 extra calories that you are having every day, when it becomes 7,000 calorie, it is 1 kg. So you can put on even 1 kg every week if you are going to eat 1,000 calorie extra every day. We will come in details about it in the later on slides. Now, what happens with all these calories? These calories contain something called cholesterol. Anything that is fat is converted into cholesterol. And they are the enemy number one of the toughest organ in the body. The toughest organ in the body is the heart, because you are asleep, working non-stop, which is the heart. It's like a pump. It has to keep pumping the blood all over the body. It pumps blood to the brain and right to your big toe or under your feet. It has to keep pumping. Now, this heart was made for a particular kg. As I gave you the example, you're 160 centimeter, you had to be 60 kgs. Now, if this heart was made to pump 60 kgs, but suddenly when you become 80 kgs, it takes a toll. It has to work more. It has to pump more. So if it is to pump more, then definitely it's also soon earlier. It's like a pump. You are staying on second floor. You had a pump to pump water on the second floor, but suddenly you went on the fourth floor in the next building. When you change your house, you took your pump with you. Now the same pump which was sending to second floor cannot send water to the fourth floor, because the horsepower of that pump was to send water to the second floor. So please let us understand, the work of heart is to, it is to send blood all over the body, but for a particular weight. It's like a nano car. Nano car, four people going on a straight road, it will move very well. But nano car, four people trying to go uphill to Lonavala, it will be very difficult because it takes a toll. The power was not so much to take four people on a uphill, but you can take it on a straight road. So please understand your heart better. Now, when the cholesterol increases, heart has a lot of stress on it. What happens? Finally, it leads to we going for angioplasty, angiography. Then they say there is a block, so you go for angioplasty or bypass surgery. Second place where the excess weight harasses us is the knee joint. Please understand, this is a normal knee joint. 90% of your body weight comes on the knee joint. So be kind to your knee. Again, same formula, height in centimeters, minus 100 or minus 105 should be your weight. If it is excess, the excess weight also comes on the knee, 90% of your body weight. Suppose you are 60 kgs, almost more than 50 kg will come only on your knee joint. So as it comes on the knee joint, you will see a cushion between the knee joint, which we call it gadla. Now this gadla gets worn out, this meniscus gets worn out, it's a cushion with excess weight, because for walking, for sitting, for getting up, whatever, for running, whatever we do, this joint works the most. You may be walking, running, doing everything, but your arms could be still, right? Your spine could be still. They are not working that much. The amount your ankle and your knee works. So I always say that 90% of the body weight comes on the knee joint, 95% comes on the ankle joint. The other 5% comes from the tibia bone, which comes on the ankle. What happens with excess weight and wearing out? See, this is how your knee will look. Just to give you a glance of it earlier, this is a normal knee joint, but when it wears out, We call it osteoarthritic knee. This is what it is. See, the cushion has worn out. The bone is rubbing the bone. The what you are seeing, the ACL, the band in between the X band, anterior cruciate ligament, posterior cruciate ligament. But meniscus is gone, worn out. Now, it's very important that any knee problem that we see, we ask them to reduce weight if they are overweight. Because if you reduce 1 kg, you lose 1 kg, you are offloading 4 kgs from your knee. So all my knee patients, first thing I want them when I check their height in centimeters and weight, we ask them to reduce weight. So as soon as they reduce 3 kgs or 5 kgs, they feel much better, right? So why? Because you have offloaded 4 times more weight from the knee joint. So in short, if you have to measure yourself how fit you are, I always say you should have a camera, or you should have a kamar and not a camera. So please, you have to gauge if you are never too late to start. Other signs for the students, youngsters to know that they are unfit. We don't have to go to a big specialist or doctors. I will tell you signs. You don't feel like getting up in the morning is a sign that you are unfit. You are irritable with your best friends also. You are irritable, right? You are unfit. You yawn between your class work. The teacher is talking and you want to yawn. You are unfit. These are the simple signs. Or you feel sleepy between your class or when you want to rest. And you find yourself breathless climbing 4 stories. My advice would be as far as possible, don't take elevators or lift. As far as possible, climb steps. It burns maximum calories. I'll come to it when I'm talking on the slide on calories. Walking, going upstairs, going uphill is one of the best exercise. So make it a habit. If your college has 4 stories, 3 stories, 6 stories, gradually start climbing step. If you're staying on seventh floor or sixth floor, start practicing. Take take the lift one floor below. If you're on seventh floor, first take the lift up to sixth floor and walk 1 floor. After a week, take the lift on the fifth floor and walk 2 floors. Gradually walk all the seventh floor once a day. But end of the month, you have burned a lot of calories, and that will save your extra calories, which is going to become into kgs or excess weight. So Benjamin said, by failing to prepare, you are preparing to fail. So I hope by seeing by the end of the lecture, you will try to find out, yes, where all you have to correct yourself and where all you have to see that you are changing your lifestyle. So I need to define fitness. Please, fitness is an ability of a person to live a healthy and well balanced life, which involves physical, social, as well as emotional aspect of life. Indians are the worst in emotional. I would not talk about physical and social. Social, they are very good. They socialize. Physical, some are bothered about the physical fitness, some are not. But emotional, especially the females, they have ready-made tears just below the eyelids. You tell them something, if they feel bad, and the tears comes out. So we need to prepare ourselves for emotional fitness also. So we divide the fitness into two parts. So today I'm going to talk only on health related component, which involves cardiovascular endurance, muscular flexibility, and the right body composition. What do I mean by right body composition? Your BP is right, your sugar is right, vitamin D3, vitamin B12. If time permits, I want to talk on that more. All the Indians, more than 50% of the Indians have less of vitamin D3 and B12. And that is one of the main reason we said અહીંયા પણ દુખે છે, ત્યાં પણ દુખે છે, આ પણ દુખે છે. This is the reason. If we check whenever you go for the blood test, it does not come in normal blood test. In whenever you're doing a blood test, please check your vitamin D3, B12, and magnesium. All play an important role in our body composition. Then coming to the next skill related component, I am not going to talk today. If you have whatever is on the left, health related component, then only you can play sports, then you can only you could be super fit, because we add agility, balance, coordination, and speed to become a sportsman. I believe that sports is medicine. When Mayank was talking, he was talking, okay, chalo, we have to, it's going to be health for all. But yes, one of the way to health for all is sports. I call sports is medicine. Don't play to play for your country. Don't play that you will be playing for your Gujarat state or the country, play, get some game, play game to be fit, play game to remain healthy. Again, in simple word, 5S of fitness is stamina, strength, speed, skill, and spirit. We are very bad at the spirit, psychological and emotional well-being. We are Indians are bad at it, even our sportsmen. Nothing is impossible. I believe that impossible also means I am possible. 280 kgs lost in 1.5 years. This is how the result looks. So I believe that impossible also means I am possible. But we look for shortcuts. Is there any medicine that we can take and we can get slim? We want to cure arthritis by some tablet or cream. We want to become a beauty queen by applying some cream or taking some powder, right? So all this we look is good advertisement, and we follow the advertisements. Then in between, sauna came. Everybody wanted to go to sauna that they will reduce weight. Yes, you reduce weight with one session of sauna, but understand you are only losing your body fluid. After 20 minutes or half an hour of sauna, when you step out, you want to drink a liter of Coke, Pepsi, water, whatever you get, because you have lost the body fluid. Thirst is a signal that the body requires fluid. You will see people sitting in sauna with bottle of water because as they are perspiring, they want to keep sipping it. They don't want to get dehydrated. So that's what usually when it came to Mumbai around 25 years back, people were weighed and sent into sauna. They came out, they weighed, so they were 500 ml less, 500 grams less. So they were told, see, we have reduced half a kg today. You come tomorrow, again we will reduce more. But next day when the person came, he was other than the normal weight, he was half a kg, 1 kg more because he had drank extra water. So it only reduces your body fluid. Then came the aerobic. We were very happy. As soon as the aerobic classes started, our patience increased. Aerobic has to done step by step on a wooden flooring. But most of the aerobic classes are ceramic flooring. They bang their knee, they bang their ankle there at a lot of hurt at the knee at the back level. And our patients in physiotherapy increased, all those who were going to aerobic classes. Then came the yoga. I want to make people understand we have got spiritual yoga, we have got breathing yoga, and we have got the therapeutic yoga. Please, we have the breathing, we have the spiritual, we have the therapeutic. See which one you are doing. Just don't on your television and do whatever is being done there. You have to be gradual. You have to follow which one you are doing. Whether you are doing the breathing yoga, you are doing the therapeutic yoga. Decide and be gradual at it. And then came the health farms. Everybody wanted to go to health farm to reduce weight. Now, usually nobody wanted to go alone, so they went with families, they went with friends. Yes, they stayed for 1 week, 10 days, and they used to reduce weight because you are under their control. They give you limited sabzi, they give you limited chapatis, no ghee, or if they give you, they compensate with other things with it. They make you walk, and in 8, 10 days, you have reduced 2 kgs, you have reduced 3 kgs, very happy. But when you leave the health farm, you are just looking for the first restaurant to go and eat whatever you want there. So within a week or 10 days, all the weight you lost comes back. So it only confuses a person. Yes, everybody wants to get fit, but what to do? Should I go for aerobic? Should I go to the slimming center? Is there any pills available? Should I do yoga? These are the different things we think about. Yes, I want to get fit, but how? So my answer is success is very demanding. It's not going to be easy, but we have to give it a start. What happened? In 1990, the televisions were fat, people were slim. By 2021, in 30 years, the television became slim and people became fat. See the obvious, because remote control. You refused to even get up to change the channel what you wanted. So you wanted to do it on remote. Nowadays, even your fan, your ceiling fan has a remote. You can change the speed of the fan or off it or on it by remote. So our activities have reduced. We refuse to walk. Bells have come. You want to ring a bell, somebody to get you water. You want to scream, get me water, get me tea. You are refusing to get up. The more you are going to sit on your chair, the more you are going to sit on a relaxed position on your sofa and watch TV, it's going to be bad. So I go to Hinjewadi in Pune to talk to the corporates. So those who are sit for 8, 10, or 12 hours on the laptop or on the in front of the computer, I ask them to sit on the physio ball. Please try that. So your kids want to play on computers, tell them you are allowed to be on computer if you sit on the ball. So when you're sitting on the ball, a lot of core muscles are getting strengthened. A lot of your core muscle gets strengthened by it. Learn to say no, very difficult in an Indian culture. You go to somebody's house, they will get you. See, the tea also will have more sugar, right? Double sugar in the tea. You refuse to take, અરે તમે પહેલી વાર આવો છો એમ કેમ કરો છો લેવો મિઠાઈ તો લેવાનું જ છે ચાય તો લેવાનું જ છે. So they force you. But if you really want to start, learn to say no. We need to learn. Yeah, I just had, thank you, or my sugar is high, my weight is more, I'm not supposed to, my doctor told me. Blame it on the doctor. I'm not supposed to take, I have to take things at a fixed time. If you learn to say no, that's the start of getting fit. See, look at the ants. They are passing a lollipop, but they decided not to have it. So the ants can, why can't you? We need to know how to say no, when and where. We should be committed to a strict diet. Please, all of you all know, as by the time it ends, you will know how many calories you are supposed to eat. I will always say, you tell me how many calories you burn. I will only give you an extra of 1,200 calorie for your people who are having a sedentary life. Look at this guy. I'm taking this petrol pump only for one reason. You must be having a two-wheeler or a four-wheeler. You go and put petrol in it. You come out on the road and you see another petrol pump. Do you go in again? No. You wait because your car or your scooter will show that the petrol is getting over. Especially in scooters, even if it is over, there's a reserve compartment. So you can reach another 40 kilometers, you can reach a petrol pump. Car will show, the meter will show, then it comes in red, and some of the cars nowadays has a buzzer. It bleeps that your petrol is getting over. Please, body also says the same. When you have eaten at home and gone out and you see food again, it does not mean you have to eat again. Right? Every time you see food, it does not mean you have to eat. So I come to the calories, 7,000 calories, 1 kg. In a simple way, I have to tell you how you can eat 7,000 calorie. Two paratha breakfast, buffet lunch at a wedding, buffet lunch with sweets and a kulfi at the end, and again buffet dinner with sweets and a kulfi or an ice cream at the end can give you 7,000 calorie, and you may put on 1 kg that day. Please understand, anything that you eat are divided into three things. They have protein, they have fat, and they have carbohydrate. So 1 gram of carbohydrate is only 4 calorie. 1 gram of protein is also 4 calories. So whether you have carbohydrate or protein, it is same. But when you have 1 gram of fat, that is 2.5 times more, 9 calories. So protein will come from all, for a vegetarian, all dals, all pulses as protein. And carbs comes from rice and wheat, roti, chawal, idli, whatever you're going to have, noodles, they are all high carbs. Now fat comes from three main sources, which is butter, oil, and ghee. There is no difference. See, 1 gram of ghee is 9 calorie, 1 gram of oil is 9 calorie, 1 gram of butter is almost 7.5 calorie because rest is water. All butters have some content of water. So when you put it on a frying pan, it makes a sizzling sound. That is because of the water. I find no difference between butter, oil, or ghee, calorie wise. I'm talking about the calories. So when you say that I make my eggs or I make my French fry only in butter for my child, it is same calorie. Some say I have everything in ghee, same calorie. And whether you use oil, it's going to be same. How much you burn is important. How you spend is important, right? So I hope you are clear. 7,000 calories, 1 kg. You can put 1 kg if you go for a good wedding, breakfast, lunch, and dinner. 1 kg up. Now to burn 7,000 calorie, you have to run uphill for 2.5 hours, not plain road. You have to run uphill. If it's going to be plain road, it's not going to be 2.5, maybe it's going to be 4 hours. Right? If you run uphill 2.5 hours, you have burned 7,000 calories. Two type of fats we are talking about, which we can see visible are ghee, butter, oil, cheese, what we add in our cooking. Non-visibles are present in raw food, pulses, cereal. And please, those who are non-veg, every non-veg has fat part of it. Whether we have chicken, mutton, or fish, the part of it is fat because it is with the animal fat. Our enemies, very simple. You see, burgers, pizzas, samosas, fried food, kulfis, ice cream. So, in short, I say anything that is tasty is high in calorie. So, please understand if it is tasty, please remember it's high in calorie. If it is not tasty, it's not high in calorie. This is the biggest example I can give you. Boiled potato 100 grams, it's 100 calorie. Again, 100 grams of fried potatoes. It is 380 grams. Sorry, 380 calories. Boiled potato 100 calorie. 100 grams 100 calorie. Fried potatoes 100 grams 380 calorie. So 280 calorie comes from the ghee, oil or butter that you are having. Okay, now why we are talking about so much about calories? So that when you understand, if you reduce your blood cholesterol by 10%, you reduce the risk of your heart attack by 50%. So next time anybody who goes and does the cholesterol check, or for your parents when you do it, so if it is 200, the target has to be, it has to become 180. So next plan has to be their cholesterol has to come to 180. So reduce the fat content. So if you reduce that year, the fat content by 10%, definitely you have saved them from getting heart attack or heart problems by 50%. Our friends, we don't like them. It's vegetable and fruits. Please, those who are vegetarian, please have seasonal vegetables, have seasonal fruits. Every vegetable, every fruit have different minerals and different of it a day. Any amount of mango given to you, you can have it because it is tasty. It's going to be high in calorie. Rest of the fruits, I put them into 100 calorie plus or minus. Coming to eatables, a boiled egg, just boil an egg 50 calorie, but fry the egg, make it a omelette or fried egg or burji, it goes up to 250 calorie. So 200 calories or 180 calorie comes only from the oil, ghee or butter. Now, always people say, I have kulfi, I don't have ice cream. But please understand, 150 gram of ice cream is 380 calories. But 100 grams of kulfi is 750 calories. Because it takes 4 liters of milk to make 1 kg or 1 liter of kulfi. Look at the two cakes. Plain cake 50 gram is 150 calorie. You put chocolate, you cannot have it. You want a chocolate cake. So that 100 calorie comes only from the chocolate. It becomes break up what we have every morning, that is milk or tea. Milk 100 ml 60 calories. You add it into tea, it becomes 100 calories. From 60 calorie to 100. So what happens? It comes from the sugar. 2 teaspoon of sugar, 40 calories. Or some people say I only have honey. Honey 1 teaspoon is 48 calorie, more than sugar, double the sugar, but it has medicinal value with it. So I'm not against, if you can take honey, it's much better than sugar. The calorie is high, but it has medicinal value. Now have a tea without milk. So it's only the sugar calories. Water has no calories. Tea itself has no calorie. So all the calorie comes only from the sugar. So now if you have tea without sugar and without milk, it is 0 calorie. Any soft drink is 200 calories. Curd, because just milk, bacteria is added, it becomes curd. So 60 calorie milk becomes 60 calorie of curd. It is same. Milkshake without anything, without any ice cream is 250 calorie. Now, if you add ice cream to it, it can go up to 450 calories. So, milkshake is high in calorie because of the ice cream and because of the milk that is there inside. All pulses are high in protein, any of the dal. So I advise all vegetarians, one of your meal has to be dal. Any pulses should be part of your food because your protein will come from the pulses. It's an indirect protein, but you get. One vati of dal, 30 grams of dal, one vati of dal is 100 calorie, rich in protein, iron, and fiber. Just to tell you how quick, when you have a water, it hardly takes anything. 0 minutes may it passes your duodenum. But when you have fruits, it takes 20 minutes. And if you cook something, any vegetable you cook, it takes 30 minutes to pass. So if I'm again saying if it's vegetable, it's going to be 30 minutes. But if it is fish, it takes 60 minutes. That is 1 hour. A chicken, potato, and milk products really takes 1.5 hours to 2 hours. So if you're having cheese, paneer, cheese that you are making, or anything from milk, it takes almost 2 hours to leave your duodenum. Even chicken takes 2 hours for digestion. So beef, meat, nuts, any nuts, cashew nuts, kharasing, whatever you are having, badam, it takes almost 3 hours to leave the duodenum. It requires more time to pass. So roughly, I'm just saying because of the COVID going on, we should hydrate ourselves well. A lot of vitamin C. So what we should have daily, any of the food. I'm not saying have all. Whatever is available at your place, easily available. You can make apple juice. You can make any of the juice: carrot, orange, apple, beetroot. Then you can have cucumber. Cucumber is very good now. Even the summers are coming. So all this, most of them have vitamin C. It's going to be very good for your health. What cleans your liver, because we have fatty liver, most of us. SGPT, SGOT goes high. So these are the fruits and vegetables that can help. And what are all the antibiotics are in your kitchen. So whether it's going to be turmeric, whether it's going to be ginger, whether it's going to be onion, all this have, or even honey, they are all very powerful antibiotics. So yes, copper glasses, again, new study says makes the water alkaline, kills bacteria, it helps us. And after getting up, the first thing to have is water. It's going to be very useful. Even before meal, don't have after your meal water. Wait for 45 minutes and 1 hour. Even before shower, water helps. Because most of the attacks that we are getting, we should reduce our body temperature and then go into shower. And always before going to bed, also have a glass of water. Lemon water, again, vitamin C. It helps a lot. It has been proven. Again, those who, the females who are there, they want the glowing skin. These are the things that will glow the skin, whether it is strawberries, watermelon. See, watermelon is very cheap but very good for skin. And here I hope these are the painkillers, just roughly telling you about what is available in the kitchen. But we should be committed to exercise. All of us should burn some calorie, at least 400, 500 calorie per day to go for a walk or do some activities. Again, the benefits have been shown. Just to walk 30 minutes. 30 minutes will keep you healthy if you are at the right weight. But if you have excess weight, please, you have to increase your walking so you burn more calories. Exercise can begin at home, whether you do some exercises at home, that will also help. Bombay has nice beaches, so people go for their own reason. We should run to lose. Swami Vivekananda said, "You will be nearer to heaven through football than through the study of Gita. You will understand Gita better with your bicep muscles a little stronger." So even that era, we spoke about exercises and how important it was to remain fit by doing some exercises. So whether you are going to run on your ground outside your colony or outside your building, whether you run on a machine or run on a beach, whether you run on a colony, around your own colony. Right? Please, my advice to females, any exercise, any amount of weight training you do, you will never, never look like a male. There's a wrong myth. The girls don't go to gym thinking that they will look like boys. No. On your left, what you are seeing is Madhu Sapre, our Miss World runner-up, right? So this was start. She was hardly 15 years old when I started training her in Mumbai on SRP ground. She used to run outside her colony and we used to make her do. And then I brought her into weight training. Her mother was scolding me. "Okay, my daughter will look like a male. Who will marry her?" Because she used to go home and say, "I lifted 160 kgs today." Then again, after a week, "I lifted 180 kgs today." So the mother used to panic because the amount of weight she was lifting. She thought she will start looking like a male. Classical dancing is one of the best method. And in our Indian culture, Indian tradition, we have classical dancing everywhere in India. Please send your children to classical dances. My first PhD from Bombay University was on classical dancers. I used classical dancers on deaf and dumb kids, and we saw the result. The expression increased, became better only with dance therapy. But we prefer such dances going for a disco to burn calories, and this is what we see. But yes, definitely, this I will call dancing because there is some movement happening there, and that is burning the calories. Maximum calories burned is climbing steps. See, you burn 2500 calorie per hour. Please, I don't want every day to walk 1 hour up steps. Gradual. You just your daily routine, if you're walking up even 15 minutes a day, you're climbing steps. By the end of the month, it becomes 2500 calorie. It becomes 1 hour, right? Or every week, some people walk 1 hour in a week, and some people may do it in 15 days, some will do it in a month, but start climbing steps. So man's health is known by what he takes, 2 steps at a time. Otherwise, he will have to take 2 pills at a time. We all, whatever we do, you can never say I don't burn calories because you're breathing. Your breathing may take 84 calories per day. So whether we blink, whether we breathe, every step that we take, even our heartbeats, they are burning calories. We need to strengthen them. Only thing what we require is to strengthen our muscles. That's Madhu Sapre again after gymming. Right? They were the same gym that's Vinod Kamli and Sachin with Madhu. We had put them on weight training. And after this weight training, she went to become the Miss World runner up. So please, burning or doing gymming will never, never make you look. What you see the weightlifters and the wrestlers, women wrestlers, which look, uh, very bulky because they are on hormones. They take male hormones so that they can lift more weight. They have not got it normally. In a normal sense, if you are doing any activities, a woman will never look like a male. That's a normal, very Gautan gym, very simple gym where most of my Maharashtra state and national sportsmen were trained here. So for me, it's important not where you train, what you train. Which exercise you do is important, not where you do. Whether it's a 5-star hotel, 7-star hotel, a big gym, centrally AC gym, you have your own personal coach. No, 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 no. You may go to a simple place. You may do exercise at home also. What you do is important, not where you do. So I say that sports is medicine. Why? Because sports enhances physical, social, and emotional well-being. Sportsman spirit comes to you, so you don't mind losing. Whoever plays better wins, right? It involves your physical, social, as well as your emotional aspect of life. So sports play something outside your colony, in your college. A lot of sports has to come at your college level. Whether you play football or soccer, whether you play tennis or whether it's going to be badminton, any game that you play. And please, on this slide, I can say today there is no difference between a male and female sportsman. Both can earn the same amount. I say the very important, most of the hostels or colleges that I go, I ask them to put a net of basketball outside the hostel. So at least the student who are staying in hostel can try to at least have five, net five of the ball. Just put the ball 5 times in the net properly. It's a good exercise because you stretch. Basketball requires a lot of stretching. It's one of the best exercise which you can do and not move out to ground, and you know don't need big grounds. Now, idea is how much to exercise. Safe zone during exercise. We all exercise. How much to exercise? Again, the formula is very simple, right? It should be 220 minus your age. To be safer, if CRP, nobody is around, hospital is not around, 200 minus your age. Suppose all of you are around between 35 and 40. So you can exercise till your pulse comes to 160. So now please try to understand why people, sportsmen, fall on the ground and die. The reason of death is increased. The pulse has increased more than 200 minus the age. Suppose they're 20 years old also. If the pulse rate goes to 200 or 210, they may fall dead. So how much to exercise? You have to keep checking after 1 hour, after half an hour, your sportsman that you are training, what is the pulse rate? And for those who are treating patients, especially patients which are paralyzed, their age is 60. So 200 minus 60 is 140. So when they are exercising, see that the pulse rate does not cross more than 140. They fall under into a danger zone. So anything 200 minus your age, your pulse can go. You can take the pulse at your wrist level also, or you can take it at your neck level also. So 200 minus the age, that much you can take your pulse. More than that, you are in danger zone. I'll talk about how we burn calories. I showed you all how you put on weight, how you'll burn it. So using mobile is the best one. You burn 50 calories per hour, right? So this is talking, only talking on mobile. But I see people walk and talk. The action is going on and talk. Then it is much more. It may be going to 100 calorie per hour also. But even 10 hours a day, we don't have any problem talking on mobile, right? So you can burn 500 calorie easily only talking on mobile. Gardening, we have forgotten, but it is 250 calorie if you do. Eating, yes, we don't mind, and we do it 3-4 times a day. You burn 50 calories per hour, but we don't wait for 1 hour. In 15 minutes, 10 minutes, we are eating fast and we want to run. Driving car is 50 calorie. Dusting furniture, we have forgotten what it is. Dressing, undressing, yes, for females, they do number of times they have to remove wear because they are not happy with wearing one dress. They keep changing, sending. Nowadays, they click photograph, send it to the friend. This okay, I'm going for a party. Is this okay? I'm going for a wedding. This is okay, I'm going to the college. And they send to the friend, what are you wearing? So that they don't be the same dress. Tell me what you are wearing. So all this increases the calories burning. Brushing the teeth, hair 100 calories per hour if you're doing it for 1 hour. Bed making, changing, cleaning your own room 300 calories, but we don't do it. We allow it for something else. Bathing is 100 calorie per hour. I like the best one in this card playing. Card playing was 50 calorie per hour because people used to bend forward and pick up the card. But now, last when I went to a kitty party, I saw everybody having a stick. They bring the card in front of them with the stick and then they pick up. Try to reduce the calorie by half. So 50 calorie became 25 calorie. Reading is 25 calorie. Preparing food is 100 calorie. Clearing the floor we never do. If we do, it's 200 calorie. And ironing, which we give it to Istriwala, is also 100 calorie per hour. The games, there's something called walking leisurely. I call it gossip walking. You ask your friend, chalo today aaj chalte hain, and you start walking. So you walk, you are gossiping about somebody and going, and finally you see a juice shop or an ice cream shop. So in an hour you have burned 200 calories, but you take an ice cream which will be more than 350 calories. So you are not going to reduce. You are going to increase your weight. Walking should be brisk walking, which should be 1 meter every time you walk the distance. There should be a meter each step is 500 calories. Or walk uphill, at least it will be 2,500 calories. Swimming 600 calorie, badminton single and double. It depends. Basketball many are paying, so it's 500. It's 550 calorie. Football, depending, the goalkeeper does not burn 650 calorie. The person at the back also does not burn. Only the person who are playing in front. The forwards burn 650 calorie per hour. Dancing, I said it is 500 calorie. Playing golf because somebody carries your caddy, you sit on a vehicle and run after the ball, it's just 250 calorie. In short, I made a pyramid for healthy living. If this pyramid is in the kitchen, if this pyramid is in the canteen, then it will keep reminding us every day. You have to do more activities, cereal, vegetable and fruits, nuts, non-veg, milk, and the minimum should be milk products like ice cream, cheese, sweets should be minimum. This is what the pyramid shows. But today, why we are unfit? Why Indians are unfit? Because the pyramid has changed. So for an Indian, exercise is outside the pyramid. We don't have. Maximum we had is cake, cheese, sweets, ice cream. All these are the things we want, right? Dairy products. Then comes non-veg, then we want nuts, then we want vegetable and fruits and cereals. So see the order and exercise out. This is one of the main reasons why we have become unfit. But if anybody runs over a hurdle, if you can cross a hurdle, I will label you fit. because you cannot, it requires speed, coordination, and flexibility. So you cannot run over a hurdle so easily. A few slides more, please give me time because breathing is very important. We all breathe. We have seen 3,200 patients in Nanavati Hospital, COVID patient, corona positive. Most of them had the lung capacity of 1 liter. So lung can take 5 liter. And why we breathe today, I want to tell you all. We breathe only for that oxygen, 20.78% to be exact. We breathe, air goes down, and impure blood comes at the base of the lung. So every time you breathe, the oxygen is taken by the impure blood. It becomes pure, goes to the heart sends it all over your body. So more deeper you breathe, especially the morning breath, more deeper you breathe, more oxygen the blood does, the blood quality becomes better and heart pumps it all over. But if your lung is a capacity of just 1 liter, so it takes less oxygen. But if your lung has a capacity of 4 liters, it will take more oxygen. Right? So all the COVID patients were 1 liter. So that's why sportsmen which are all 3.5 liter plus, they don't get COVID. Right? And please, there is no replacement of breathing. No fruit, food, minerals, liquid, injection, capsules, whatever you talk about will not give you oxygen. Oxygen can come to your blood only through breathing. Maximum vital capacity is 4.5 to 5 liters. Only marathon runners, sportsmen, footballers, cricketers, fast bowlers, they have 4 liters plus. Right? Rest of the Indian people are 2 liters, especially females are less than 1.5 liter. So do the breathing yoga, the pranayam which has to do with breathing. Please start practicing. In Bombay, so you have to pay 50 rupees per month if you have to breathe fresh air. So before it comes to your area, start doing deep breathing. This is a spirometer. We measure the lung capacity through this spirometer, and we find out whether your lung capacity is 1 liter or 1.5 liter or 2 liters. Just a slide to tell you all, when you do exercise, what happens? The slide is of the same person, left and right. The left one, no doing any exercise, nothing. But once a person start doing exercises, see the lung capacity increases, see the muscle. So muscle does not come with food. You have your our muscles are fibers. It's as thin as a hair. When you do resistance exercises, the blood flow inside increases. So more the blood flow increases inside, thicker you will find the fiber. So multiple of thick fibers makes your muscle look big. So muscle doesn't come from our muscle doesn't come from eating, right? So when you're doing exercise, the girth measurement of each fiber increases, the thickness of the muscle increases. So number of thicknesses makes it the bulk of muscle, and but eventually your lung capacity also increases. Just a slide to know if you all didn't know, the shape of a ear, the ear shape is like baby in the fetus of the mother. The head is down. So all the points are also put accordingly. Why the female wears a earring? See the point there, it is exactly on the eye. So the eye point was supposed to be punctured by the jeweler. So the females have beautiful eyes. But little above that point is a tongue point. So most of the time these jewelers do a mistake. They punch or they make a hole on the point above the eye. So instead of beautiful eyes, the tongue works. But we have all the points. Just earlier when I was in school, when we were naughty, the teacher is to squeeze our ears, right? So I feel that time they knew the reason. So all our points were stimulated. But now today in school, if you try to do anything to the student, even hold them by the ears, they will complain, police will come and you can be arrested. But in short, maybe that era was to stimulate all the points. There was a nice study done, 48 people who had suffered from heart attack. So 24 were put on seeing Saas Bhi Kabhi Bhauti, and other 24 were put on comedy shows. By the end of the year, all those who were seeing Saas Bhi Kabhi Bhauti, they got an attack again. So please select your friends. When you meet your friend, if you are happy and you don't get, depressed seeing them or meeting them, it depends how you select your friends. And if your friend tells you the same story every day, he or she needs help, and the help is from a psychiatrist because she's going in depression. You cannot tell the story, same story every day. So meet friends which makes you happy, talk to people which motivate you and make you feel a lot of laughs. So in short, I say let us laugh together and not laugh at each other. I've opened to questions now. I hope I'm still audible.
Yes, you're audible, sir.
I'm open to questions.
Yes, from the participants. Anybody who has questions? Sir, I think you have explained it so wonderfully in such a relatable manner. Some talks which brought smiles, especially on women participants, I could say. And it was motivating also. And nobody is asking a question. Sir, I would just like to ask that how many calories do we burn while we deliver a lecture for an hour?
It's going to be whether you are sitting or you walk around or you ride around. But
Walk
yeah,
around.
200 to 300 calorie per hour. And how loud you speak. All that counts in the burning of calories.
I think it was a power packed, very wonderful presentation. A special note that you have made that in Gujarat we are the most unfit, and that is why I think everybody today is going to jump on the weighing scale and measure them. कि कमर है कि कमरा है. Everybody is going to find out whether they are physically fit with all the 5 S's of fitness that you have said. You're going to be very choosy about the choice of their exercise, whether it's going to be sauna or aerobics, yoga, whether they're going to go to a health farm. So we are very thankful to you that you have covered every aspect, right from weight loss to body fat analysis, from the role of the heart to the pressure that we can give on our knee and we can remain healthy. On a very scientific note also, sir, you have covered all the issues, the health related components, that is the cardiovascular endurance, muscular flexibility and body composition. So once again, it was indeed a very power packed, a very insightful, and a subject which everybody could relate to. And I am very sure that everybody has gained a lot. And I can say that so confidently from the smiles of the women, especially because women in India do need to look good, right from fit to fat to skin to smile. And everybody is going to make the most from your note. Thank you so much, sir. It is a pleasure. It was a pleasure listening to you, and everybody has gained from your session. Thank you once again, sir.
Thank you. And once again, thanks Sarvajanik Education Society, KP College of Commerce. I thank Chairman Kamlesh Yagnik, the Principal Ms. Martina, Mayank, Dr. Nita Bandopaya. I hope she will be talking now. And I'm thankful to Smita and Purvi for their kind words and introducing us. If I have any question to answer, otherwise, please excuse me. I have a lot of patients waiting for me, and I would go and see them. They have been waiting for an hour. Anything I'm still
Thank
open. If
you.
you have questions, I will answer all. I don't want to leave anybody uh, not going with doubts. I want to clear the doubts before I go.
So your style was so lucid, simple, and easy to understand. I think everybody is quite happy with your presentation. Many of our doubts have been cleared, sir, and I'm really grateful to you for really giving your time to us today. It will
Thank you,
help
Dr.
us immensely.
Thank you, Dr. Martin. I'm from Sanjan, very close to you all.
Oh, very close to Surat. Very close to
Hopefully
Surat.
someday I'll come to the campus and we can
Definitely, sir. Please,
demonstrate
you're
our
welcome
skills.
anytime. Anytime. We would be really happy to host you.
Thank you,
Thank you
ma'am.
so much,
Thank
sir.
you.
Thank
Thank
you.
you. God bless. All the best.
Thank you so much, sir.
Thank you, Dr. Ali.
Thank you.
Thank you.
And now it's time to move ahead and listen to the insights from our second resource person for the day, Dr. Neeta Bandopadhyay. She will connect with us all the way from Calcutta. I request CACS Mr. Abhishek Gandhi to please introduce our speaker, our resource person for the second session. Over to you, Abhishek sir.
Thank you, Purvi ma'am. After such a wonderful session conducted by Dr. Ali sir over here, Ali Rani sir, it is indeed a pleasure and my privilege to welcome such an esteemed and honored personality who hails from the eastern part of our country, that is West Bengal. Yes, indeed, I'm talking about Dr. Neeta Bandopadhyay. So, firstly, on behalf of Sarvajanic Education Society and Sir KP College of Commerce, an institution from Surat, I heartily welcome you, ma'am, for an educational institution as such as ours, which is located on the western part of the country, to have someone as a resource person from the eastern part of the country truly represents the spirit of this conference being at national level. When I firstly received the details from Dr. Jignesh Tandil sir about you, looking at merely the volume and the level of achievements, it would truly take a session in itself, I would say, to give a complete description. And so, how I would be able to present it in a nutshell was itself a challenge for me. But to begin up, I'll just start off with the things. Firstly, the designation. Ma'am was former head and director, Department of Physical Education at University of Kalyani. As far as the academic qualification goes, she has the degrees of BSc in Biology, Bachelor in Physical Education, holding first class first in the Calcutta University. Thereafter, Masters of Physical Education, again first class first in the Kalyani University. Then qualifications as an academic field in the form of NET degrees, PhD, along with coaching diploma in basketball from NSSI Calcutta. Sports achievement, she has participated in National Basketball Championship at all levels and has been a coach, sixth strength of West Bengal state team. She has visited several countries all around the globe. To list a few of them includes Bangladesh, Malaysia, Singapore, Sri Lanka, Vietnam. Along with the visits, of course, corresponding are the awards which she has received. To cite out few of them are first position in Masters in Faculty of Education, Kalyani University, 2002, along with the Bright Academician Award recently in 2015, then Best Citizen Award in the year 2017. As far as the teaching and the research experience goes, she holds 14 years of rich experience in Department of Physical Education, also 4 years experience in the Center for Women Studies in the same Kalyani University. She has guided PhD students, 10 PhD students and 2 MPhil students also. Academic development, as far as it's concerned, she has already published several articles in the journals, in the conference proceedings, also published a book, thereafter presented papers in all at all levels, national, international, and has been a speaker at several forums, and along with that, also been a chairperson in several other occasions. The academic achievements, the recent academic achievements, should I say, from 2018 to 20 listed ones. She has been head of department from November 2018 at the University of Kalyani, Director of Sports, Chairman at Board of Studies, the course directors, the member of several committees at the university level of her. Along with it, she has been also the member of the well-known IFP EDSSSI, then WPCIPE, AIU Observer, that is at New Delhi for North Zone and Interzone chess competitions, the Joint Secretary and the Secretary also. She has been a member of Cricket Association of Bengal. So to have with us such an eminent personality is truly a blessing for us in this particular national conference, or should I say e-seminar, e-conference. Now, as I aptly said at the beginning, just to have a couple of minutes for introduction of such a magnanimous personality is in itself a challenge for me. But however, indeed, proceeding further, now I would request our resource person, Dr. Neeta ma'am, to share her valuable insights, knowledge, and the experience with our wonderful audience who have connected with us from right from the stretch of Jammu and Kashmir till the southern tip of the country. Ma'am, this virtual stage now is entirely yours. Thank you. Over to you, Neeta ma'am.
Thank you very much. At the very outset, I must express I don't have good network. There is a problem network. In between I may lose connection. So please bear with me. And respected Dr. Martina Mayank Desai, Dr. G, and today's guest and keynote speaker, Dr. Ali Irani, Purvi Kothari and Abhishek Gandhi, and my dear colleagues, Dr. Jahanvi Ichari, Mohan Singh, and other distinguished delegates and learned participants. Today I'm going to talk on, actually I'm not getting connection in my laptop. I can share from a mobile phone, or I can show the, like this way I can show, no? Is
No
it
issues,
visible?
ma'am. No issues,
Huh?
ma'am. Even if you connect from mobile phone, it's fine enough.
Okay, then I go like this way, yeah. Because I'm not getting connection in my laptop. Okay. So I think it's visible, no? It's nearly visible.
Yes.
Okay, okay. Uh, so today I'm going to talk on topic need of physical education or physical literacy in 21st century.
एकदम डार्क થઈ ગયું છે.
Okay, okay. Uh, Actually, the 21st century witnessed the huge and rapid changes in technology, in communication, and in information. Uh, Technology is the application of scientific knowledge for practical purposes. Technology is the making use and knowledge of tools, machine techniques, craft, and system of organization to solve problems. Here are some facts about technological growth. The 40% of the total world population has access to the internet. 90% of the world's data was gathered within the past 2 years alone. 5 billion people in the world have access to the internet.
Madam, can you, you are not visible, and your screen has gone dark. Can you hear me, Dr. Nita?
Hello?
Hello. Can you hear me, Dr. Nita?
I think Dr. Nita has lost connection.
No, she's very much. Dr. Nita, can you hear us? Participants, just bear with us till Dr. Nita rejoins again.
She has network issue. She is joining in 2 minutes.
No problem.
Yeah, thank you.
Yeah, she's rejoining.
Dr. Neeta, you are there. Please unmute yourself.
Yes, Dr. Neeta, please unmute yourself.
Dr. Neeta, please unmute yourself.
Dr. Nita, please unmute yourself. Hmm? Hmm.
So, dear participants in the conference here, as much as we try to connect virtually, technical clinches ought to come. So Dr. Neeta has just put in a word that she will be joining at 1:30. There are network issues. So we would like to proceed ahead. वैसे भी बड़े बड़े देशों में ऐसी छोटी छोटी बातें होती रहती है छोटी बातें होती रहती है So as Neeta ma'am has promised to join in at 1:30, we would just like to conclude the session or conclude with certain words of gratitude. I request the sports sir, the Iron Man of our college, Dr. Jignesh Tandel sir, to please come ahead and propose words of gratitude. Over to you, Tandel sir.
A very good afternoon to all. Can you hear it? On behalf of IQSC and Department of Physical Education of Sir KP College of Commerce, I, Dr. Jignesh Tandon, is here before you to present a vote of thanks. I would like to thank our Honorable Chairman, Kamlesh Yagnik sir, and Sports Chairman, Mayank Desai sir, of Sarvajanik Education Society for his esteemed presence and unclouded support in making this event a success. I would also like to thank today's chief guest and keynote speaker, Professor Dr. Ali Irani sir, for his very informative and enlightening session. We are grateful for the time and effort you took to share your thoughts and experience with us. Also, a big thanks you to our resource person, Dr. Nita Bandyopadhyay, for her contribution. I would also like to thank our principal, Dr. Martina Narohna, for her motivations and support in organizing this national e-conference. I would also like to thank you to all hosts of this session, Dr. Purvi Kothari ma'am, Dr. Smita Khawani, and CACS Abhishek Gandhi for smooth functioning of the session. I also thank Mr. Prakash Patel for technical support. Lastly, thank you all for your valuable times and presence. Thank you. Okay. Session 2, coordinated Dr. Over to Tanvi Darbara.
We now conclude the first session, and I would like to hand over the second session.
Tanvi Darbara, Dr. Tanvi Darbara.
Dr. Tanvi, the second
Yeah,
session is in your charge. Are you there? Yes, Dr. Tanvi.
yes. Thank you so much, Purvi ma'am.
Thank you. Thank you so much.
Good afternoon, everyone. I believe that excellence is never an accident. It's always the result of high intention, sincere effort, and intelligent implementation. With this faith, I heartily welcome all of you for presentation session of the National E-Conference on Advances in Sports, Exercise Science, and Pedagogy of Physical Education. I also welcome eminent academician who has consented to chair and co-chair the technical session of this e-conference. Dr. R. Ram Mohan Singh, Assistant Professor, Department of Physical Education, Pondicherry University, Pondicherry. Dr. Hasmukh H. Patel, Associate Professor, CP Degree College of Physical Education, Rajpipla. Dr. Vikas Prajapati, Assistant Director, Physical Education, MS University, Baroda. Dr. Bhavesh Devta, Associate Professor, VS Patel College of Arts and Science, Bilimura. Dr. Jaimal Nayak, Assistant Professor, MRD Arts and EELK Commerce College, Chikli. Last but not the least, Young and Dynamic Assistant Director, Physical Education Department, Oro University, Surat, Dr. Janvi Ichapuria. As we all know, the sea of knowledge knows no boundaries. This is an era where the academicians, research scholars, and professionals must upgrade themselves with the least development and innovation of their field. So, to provide a platform to all of them, this National E-Conference has been organized, which will cover all important developments and innovation in this physical education field. I'm glad to state that we have received more than 42 papers and around 160 registration form faraway colleges, not only from Gujarat, but also from various parts of country. Last but not the least, I hope that this conference will provide a decent platform for elevating knowledge and enriching educational experience among the researchers and academicians. Your blissful presence and intellectual researches will indeed become a source of unparalleled experience in high quality education to remember for a long time. Once again, I welcome you all and hope that the deliberation of this conference will be useful and enriching. Now, I would like to request Dr. Jignesh Tande to give guideline for the paper presentation. Over to you, Dr. Jignesh.
Thank you, ma'am. Uh, Guidelines for the paper presentation. All those selected papers are divided in three different tracks and we have set schedule already. So make sure you join your session on the time. The paper presentation session will be take care under the chairperson and co-chairperson supervision. All the participants will get 8 minutes for paper presentation. After 6 minutes, we will remind you and 2 minutes for the questions and answers. Those who will be presenting the PPT, please make sure your good internet connection to avoid the technical issues. All the participants have a submit feedback form which will be sure by during the verification session to get the certificate. All the participation are request to must himself when or other person is presenting. In case of any issue, you can drop message in chat box. With this, would like to wish all the participation all the very best for this technical session. Thank you. Over to Dr. Tanu.
Now we are not taking much time. We are foreign to present the presentation part without taking much time. We have very energetic and young personalities with us for chairing the session, the first track in the National E-Conference on Advances in Sports, Exercise Science and Pedagogy of Physical Education. It's my privilege to introduce Dr. R. Ram Mohan Singh. He is an assistant professor in Department of Physical Education and Sports, Pondicherry University. He is having more than 20 years experience in the field of physical education. He has to his credit BCom, MPS, MPA, PhD, diploma in coaching in cricket with gold medal, level 1 cricket coach and diploma in Special Olympic and yoga. He has received UGC Research Award in the year 2016-17. Also is guided to 7 PhD scholars and 3 MPhil scholars. Dr. Ram has published 30 papers, attended 40 conferences and seminars, and organized 3 workshops. He has also published 4 books on health and physical education. Also, he has participated in various national and university level games like cricket and athletics. With him, I also would like to introduce co-chair Dr. Janvi Chapuria. She is presently working as Assistant Director of Physical Education at Yoru University and has a teaching experience of 14 years. She has to her credit BP with gold medal, MP, MPhil, DBAD in yoga, and PhD. She has qualified the GSET examination also. Dr. Janvi is an active member of the district level rowing, canoe, kayaking, cycling, and yoga association. She has achieved a scholarship for national level women's competition in 2006 and 7. She has participated in various national and university level games like gymnastics, yoga, kho and volleyball from 1995 to 2005. She has officiating experience in state and national level athletics, gymnastics, and swimming competition. She has attended as an official in the National and Open World Championship of Yoga in 2008. Commonwealth Table Tennis Championship, and International Gymnastic Championship. She has presented many research papers in area of yoga, stress, and pranayam at many national and international conferences. Alone, we can do so little, but together we can do so much. With this thought, I heartily welcome Dr. R. Ram Mohan Singh sir and Dr. Janvi Chapuria. Welcome, ma'am. Welcome, sir. Now,
Thank
we
you.
would request chair and co-chair to take the session ahead. Uh, we will start with the presentation. I request Janvi ma'am and Ram Mohan sir to take the charge of this track.
Thank you very much. Uh, since
Welcome, sir.
morning, we have been enlightened to some great information which we need to adopt in our regular everyday life. So until we commit ourselves to have a proper lifestyle, so we are going to keep inviting problems as it comes. So I would like to thank the organizing committee for this conference, for finding me suitable uh, and giving me this charge of acting as.
Dr. Sagar, please mute yourself. Sagar Desai, please mute yourself.
It's indeed a great pleasure for me to get involved in this conference and chairing this session. I would like to also welcome and thank Dr. Janavi for being such a great friend, and we are always being in support of each other. And may physical education thrive and get its rightful place in India. So that's our common goal. I'd like to welcome Janvi to say a few words, please.
Thank you, Dr. Ram Mohan. Many congratulations to Dr. Jignesh Tande and all the team members for getting a wonderful responses across from India. As I can see, many national and international participants in the chat box. And Nothing, not taking much time. Wish you all the best. All the participants, please present your paper. And if you need any help, feel free to contact us. So now, Dr. Ram, shall we start with the first presenter?
Yeah, we can just call out the first presenter with the title. If he is available, they can. I see Vikas is there already. Dr. Vikas is
Yeah.
there. So we can just call out the title and ask him to start the presentation.
So his title is Statistical Application Software Open Source Availability, and the authors are Dr. Vikas Prajapati, Dr. Akansha Prajapati, and Dr. Jitendra Pratik. Over to you, Dr. Vikas.
Thank you, ma'am. Uh, very good afternoon to respected chairperson, Dr. Ram, co-chairperson, Dr. Janvi, the organizing secretary, Dr. Jignesh. Uh, I hope uh, um, uh,
Mr. Manish, please mute yourself. Manish Bhutani.
I hope my screen is visible with you. My presentation is visible with you.
Yeah, presentation is visible. If it is possible to make it full screen, kindly do it.
Okay, good afternoon, everyone. Respected chairperson, co-chairperson, organizing secretary, patron of the college, respected field mates. It's the proud privilege to present the conceptual paper on the statistical application software that is open source availability with co-author Dr. Akanksha Prajapati and Dr. Jitendra Patel. So, friends, talk about the data analysis software using statistical analysis. Just a data analysis is a process of organizing, analyzing, and interpreting the data generated in any research work. So, uh, a great deal of information hidden in the data on the different aspect can be extracted through data analysis. Uh, 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 and statistical method that we are going to use for our research output to finding out the research problem solutions. The sports scientists and the sports educationist, physical educationist use so many statistical methods, statistical software to analyze the data, and these data then help them a lot in making a decision regarding their solution towards the problem of the research. So to understand the 7 points why we the statistics are why it is important, it is to understand the literature. It helps. I'm sorry for the some technical inconvenience. Uh, we were discussing about the importance of statistic to understand the literature, to fabricate the research problem, to develop a scientific temper, to understand what data wants to say, to assess the authenticity of research findings, and to come out with some logical findings of the research problem. Uh, to develop an index on the various characteristics and performances, yes, it helps us to analyze the performance and helps us to develop these norms as well as the final output is to conduct the research. Uh, Okay, why we use a software? Software is fast and easy to interpret the data and prevent us to making any false assumptions that may occurs due to manual calculation. So some are the list of the statistical software that available. Everyone aware about the SPSS,
Uh,
statistical package for
Dr.
social
Vikas, one
science.
second.
Now it's I.
Yeah,
Yeah.
okay, fine. He has muted. Kothari has muted. Fine, carry on now.
Yeah. Thank you, sir. Uh, IBM take over the SPSS, Microsoft Excel, R, MATLAB, SAS, Minitab, Excel Stat, Stata. These are the some are the most useful software that are paid version and heavily charged for uh, their subscriptions. So my intention to present this paper is to just have some open access free software that is equal to the paid version and equal to the some are the most used software that allows us to have some this open access free software allow us to use a legal way. This is the first is a PSPP. It is a just a short form. It's a PSPP has a no any uh, mm, abbreviations. But I downloaded some version of the this is the I hope you can see my entire screen.
No, we are not able to see the presentation. We are able to see your video.
Okay, now
Yeah, now we can see.
it's a PSPP. It's just a compare in comparison to IBM SPSS. It is the same version of the SPSS, and it has the same all the features that IBM SPSS have. Okay, so those who are familiar with the SPSS, it is the same data view window as well as the variable view, and all the analyzing techniques that are uh, uh, available with the PSPP, and it is the same that as we perform in SPSS. But the thing is that this software is the legal software and it is a free. You can utilize at anywhere, and the output that come out it's also the same as IBM SPSS. Uh, this is the what the output is all about the frequencies, descriptive statistics that we had we all usually see in SPSS. The same the output images in a PSPP. Yeah. So my next it's a JASP. It's a Jeffrey's Amazing Statistical Program that is also the equivalent to the SPSS and the Excel. So most of the uh, free programs for the statistical software. These are PSPP and JSP. So Jamovi is the next one, free access software. I have one output for the Jamovi, and it is the same thing. it's not as same as SPSS or PSPP, but the statistical methods to be calculated are mentioned on above headings, and uh, we can also have some files to open or to save, and if we wanted to calculate uh, the, uh, the statistic, it is the same way. On the same window, we can get the output on the same window. So this is on my right side. It's a output window for this JASP. Uh, the SOFA statistic open for all software. It is also the open software, and it has also the same features that we have in Excel, that we have in PSPP. Uh, the last one is a Devel. I had one file typed. It is a free version of a devel for the non-commercial use, and you can see that when we enter the data, we got the all the summaries over summary just below the data in the single window. So whatever we wanted to calculate, we can get this idea of our data and our statistical application results. So, friends, just it was I just try to make it attempt to have some of the free software that are available and equally effective for the calculation of any statistical methods. Uh, Again, some question is which one is the best. It's again depend on the individual and how you understand the problem and how you select the test. So all the features, there are some are more same, but the open access free software like JASP, PSPP, SOFA, Jamovi, Devel, they are highly effective in calculating the statistical methods. Some more open access software is R and SAS, but unfortunately R is a very based on the coding capability of an individual who uses it. So I do not take it in our open access freeware software in this presentation. This is the reference that I had taken to prepare this conceptual paper. So thank you.
Thank you very much, Dr. Vikas. That was a very nice effort from your side to present the corresponding free statistical softwares that were available for use. Now, the presentation is open for questions from the audience. If there is any question, you may please put it in the chat box or unmute yourself and ask. Any questions?
Participants can write their question in chat box also. So I also can ask the question.
Yeah, yeah. Please, you're welcome. So, Dr. Vikas, till we get a question, can we know, see, now we have presented the statistical free softwares. So, if each and every software, you can say for what it can be used, especially with regard to physical education, this software can give you on the researches pertaining to comparison of groups. Like that, if you give some information, what it be useful?
Yeah, almost every software that I had taken in a open access freeware software, PSPP, JSA, Jamovi, SOFA, and Devel, they all are all help them to data analyze just like descriptive, exploratory, and conformative data analysis. So mostly we have seen the so many statistical methods, just like it's a compulsory to have a descriptive analysis of your data. So it's a general way. Even we can have it in Excel too. But the data is just to compare the means, or maybe a factor analysis that also available for available in these free open access softwares. Basically, my idea was, since I was in a master degree, I had heard a lot of about the SPSS. In this age we get unfortunately we get it cracked version of so many softwares, but it is not a legal. Somewhere I thought that let's have some search on the free software that is equivalent to the SPSS, equivalent to the Excel, and I found this 3 4 software are effectively working for this the data analysis.
Okay, thank you. Any questions we have, ma'am?
First of all, congratulations, Dr. Vikas. It was indeed a very new concept, and I hope that all the research scholar will get benefits out of it. I just have a one question that have you checked the authenticity of the software and if any research scholars are using this softwares, will they get all the adequate data or how it will work?
Ma'am, just the addition to the Ramsar's this some features are PSPP has 1 million data to you can analyze. This is a limitations in SPSS. PSPP, it's a gnu.org. It's a specialized software. If I share it my screen again on the last stage, last page, I had explained the gnu.org, where these software are made by the experts of a statistic, experts of the psychological the studies, and this all are done just because of making that if you don't have money, you cannot purchase a good software. It is to avoid this situation, this software. And this is not a PSPB or Damovi. It is not a just like a come up in a last decade. It's a gnu.org is the largest software, free open access software library. You can go and download any software which are equivalent to your software, which is free.
Wonderful, wonderful. Any other question? I think there is no question. Can we move for the next author,
Yes,
Dr.
ma'am.
Ram?
Yes, ma'am.
Yeah, yeah.
Thank you, sir.
Thank you,
Thank you,
Dr.
ma'am.
Vikas.
Thank you.
Yeah. Second person presenter is also join us, Dr. Raghavendra Basireddy. You are there, sir?
Yeah, ma'am.
Yeah. Sir, please start your presentation.
Yes, ma'am.
Poor connectivity.
Dr. Tanvi, there is a query from few participants that they are not able to find the chat box. So if you can help them.
Yeah. Participants can see the right side top three symbols are there. In second one is a chat box. So anyone is having any query, they can write in the chat box.
Madam, madam, visible, ma'am. I clicked it.
Not yet, sir.
No, we are able to see only you, sir. Your PPT is not yet visible. Use present now option. You have to open the file first and then use present now option. Yeah.
Yes.
No.
Open,
Still
but
we are seeing your video.
present now.
I think Reddy sir is having network issue.
Hello, hello.
Hello.
Yes, sir.
So present now is disabled. Is not make it never.
It is working, sir.
Your voice is
Yes.
not clear,
Now
sir.
your
Your voice is
yes,
not clear.
yes.
Yeah. Yeah.
Now
Okay.
your presentation is visible, sir.
Still we have to see only your icon. Have you opened your file, sir? PPT. Open your PPT.
Do you have an experimental paper or it's a research article, Dr. Raghavendra Reddy?
Thematic paper.
It's experimental.
Hello.
Hello.
Second.
Dr.
Uh,
Raghavendra, you please take time to settle down. Dr. Tanvi,
can
can
we
you
move?
announce the
Yes.
third person name?
Yes. Sahil Sharma is he is available?
Yes, ma'am.
Yeah. Can we start with your presentation?
Yes, yes, ma'am.
Yeah.
Raghavendra Reddy has to stop presentation.
Hello, good
Mr.
afternoon,
Sahil.
all of you.
Yeah.
Yes,
You
yes, ma'am.
start your presentation
Yeah.
and also share your presentation.
Ma'am, my
What?
presentation is oral presentation.
Okay.
Oral.
No, but
Then sir,
Yes,
please
ma'am.
on your video. Yeah. Continue, sir.
Yes, ma'am. Today's my topic is about nutrition, a key factor in sports and general fitness. As we know, as physical activity is essential for physical, mental, and social development of an individual. Similarly, good nutrition is also essential part in the life of an individual. An individual taking part in sports has high demand of nutrients like carbohydrates, fats, protein, minerals, etc. Due to increasing physical activities, these essential nutrients only come from foods that we eat. Most of the sports person do not have proper knowledge of nutrition. This paper
Deepak is having
provides
network issue.
proper
Messenger.
guideline for the appropriate information about healthy and nutrition food for the sports and general fitness. It is said that nutrition diet is a key to good health. As we know, in this modern age, numerous people engage themselves in different types of physical activities for healthy life. Along with these, nutrition provide the fuel for these physical activities. Nutrition for sports and general fitness required proper eating strategies and physical activity life. The knowledge of nutrition is important for an athlete in order to produce best performance. In general, the food we eat play a major role in defining the medical conditions. Example, heart disease, diabetes, fatty liver, uric acid, cholesterol, etc. of an individual. In metropolitan cities, people do not focus on their dietary intake because of their passive as well as busy lifestyle, and this lead to potential overweight, reducing motor efficiencies, and thus decreases the general quality of life. Poor nutrition invite various deficiency to a non-athlete, and like injury, fatigue, and poor recovery to an athlete. Everyone has different goal related to their fitness. It may be weight loss, increases endurance, gain muscle, etc. Proper nutrition helps an individual to achieve these parameters as well as goals. All our energy which is used during growth, development, and activities that we perform comes from the food that we eat. A perfect food is one that contain all the constituents of food, like carbohydrate, proteins, fats, vitamins, minerals in optimal proportion, necessary for the growth and healthy body. A balanced diet provide adequate amount of all these constituent of food in proper ratio for all the metabolic requirement of the body. However, basic requirements of an individual depend upon his age, sex, and occupation. Different individuals require dietary needs according to their age, like growing child require more protein, active athlete require all the nutrients of diet depending upon their volume, intensity, duration of sports. Girls need more protein in their daily diet. Pregnant lady requires special dietary plans. Consuming too much food without engaging in work lead to overweight, and sometimes this habit makes a person obese, which is dangerous alarm of various types of life-threatening disease. Thank you.
Thank you, Sahil. You
Okay, sir.
have just given a compilation of the nutritional requirements for
Yeah, yes, sir.
different people. Is there any questions which the audience would like to ask?
No question in the chat box, sir.
Okay, then maybe I can ask one question.
Yes, so you and Janvi ma'am can
Yeah,
ask.
yeah. Yes, I'll see. When it comes to nutrition, the nutrition requirements for a person who is not a sports person and a sports person would vastly differ, right? So, how do you make a distinction? What is the nutrition for a sports person and what is the nutrition for a non-sports person? Sahil, are you there?
કીર્તિ રોય ચેન્જ કરેલી છે શેર કરી છે તારી હાથે
Dr. Tanvi, mute yourself, please.
સોરી મેમ
Mr. Sahil, are you there,
Sahil,
Sahil?
I
I
think he
think he's
left
not
Sahil.
there
the
in the. Can you
yes
confirm? Yeah. Okay. Okay, fine.
Fine,
Right, then
ma'am.
we can
We'll
move on
move
to
for.
the next presenter.
Yes.
we'll move to the next presentation. Dr. Chirag Bagela, are you there? Dr.
Yes,
Chirag
ma'am.
Bagela?
I am there. Yes, yes,
Yeah,
yes, 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 I am.
yeah. Start your presentation, sir.
Okay.
I'm just inform the topic, Janvi ma'am, the presenter's topic.
Dr. Tanvi, can you please share the topic of the presenter?
Now,
Okay. Yeah, he's already
is
started
the
sharing.
screen visible to you, sir, madam?
Yes, sir.
Yes, yes,
Yes,
yes,
sir.
yes, it is
Visible.
visible.
Okay. So may I start now?
Yes, please.
Okay, thank you. So I'm going to talk about the role of myostatin inhibition in muscle growth. Myostatin is one of the genetical component in the cells of mammals, It's actually found in all the species of on the planet. So basically, the word is derived from the Greek word myo means muscle and statin means the which thing or substance limiting the growth of the muscles. So we are going to talk about the myostatin inhibition. Animals who are lacking in myostatin or treated with the substance that block the activity of myostatin have significantly more muscles mass. Furthermore, individuals who have mutation in both the copies of myostatin gene have significantly more muscle mass and are stronger than normal. There is hope that studies into myostatin have therapeutic application in treating muscle wasting disease such as muscle dystrophy. The gene encoding myostatin was discovered in 1997 by geneticists S. Jean Lee and Alexandra McFarland, who produced a knockout strain of mice that lack the gene and have
Dr. Chirag?
approximately twice as
Yeah, sorry to interrupt. So you have 8 minutes. So your presentation.
muscle structure of a rat. So first one is the control group. तो control group में हम यहाँ पे देख सकते हैं कि मसल्स का मास कितना है. देन जो एक इनहेबिटेटर है जिसको बोलते हैं एक्टिव रिसेप्टर आईआईडी, अगर वो रिसेप्टर अगर एक्टिव करते हैं बॉडी में तो जो मायोस्टाटिन की एफिशिएंसी को रिड्यूस करके मसल्स ग्रो होता है. सेकेंड कॉलम में वो पिक्चर्स है एंड थर्ड इज पॉलीस्टाटिन. पॉलीस्टाटिन इज द एंटागोनिस्ट ऑफ मायोस्टाटिन. तो जब किसी का मायोस्टाटिन का अगर कम करना है या तो जीन थेरापी के थ्रू या तो क्रोमोसोम नॉकआउट के थ्रू, तो हमें इतने वंडरफुल मसल्स ग्रोथ के रिजल्ट मिल सकते हैं. यहाँ पर और एग्जांपल है, इसको फार्मिंग में भी यूज कर रहे हैं, एनिमल फार्मिंग में. तो इस तरह के रिजल्ट है जहाँ पे हम फर्स्ट पिक्चर में देख सकते हैं कि नॉर्मल बुल जो बेल्जियन बुल है उसका स्ट्रक्चर कैसा होता है और जिनको फोलिस्टाटिन हो दिया जाता है ट्रीटमेंट उनका स्ट्रक्चर कैसे होता है. इसका जो लोकेशन होता है ह्यूमन बॉडी के क्रोमोसोम के जो पैर्स होते हैं उसमें 24 में से सेकंड पैर के अंदर ये फाइंड आउट होता है मायोस्टाटिन. और उसका जो एंटागोनिस्ट है पॉलीस्टाटिन दैट इज इन फोर्थ पैर ऑफ जीन. म्यूटेशन. What is mutation? Mutation is basically the lack of myostatin in the chromosome only directly. तो दो तरह से हम लोग इसको ट्रीट कर सकते हैं. एक होता है कि हम जेनेटिकल थेरापी के थ्रू हमारे मायोस्टाटिन को अगर कंट्रोल कर रहे तो मसल्स ग्रोथ एनहांस कर सकते हैं. सेकंड, जो नेचुरली ही अगर इस क्रोमोसोम की डेफिशिएंसी हो बॉडी में तो वो उस चीज को बोलते हैं म्यूटेशन. अभी यहाँ पर एक डॉग है जो विथ द डिफॉर्मिटी मीन्स म्यूटेशन ही जिसका जन्म हुआ है तो पूरा फिजिकल स्ट्रक्चर और एबिलिटी चेंज होता है. दिस ब्रीड इज नोन फॉर द लॉन्ग डिस्टेंस रनिंग. बट जैसे ही मायोस्टाटिन नॉकआउट हो जाता है बॉडी में तो मसल्स ग्रोथ जो होता है वो काफी एबनॉर्मल हो जाता है और इनकी जो एनारोबिक कैपेसिटी रिड्यूस होके एरोबिक कैपेसिटी रिड्यूस होके एनारोबिक कैपेसिटी ड्रास्टिकली इंक्रीज हो जाती. ह्यूमंस में क्या सीन है? ह्यूमंस के अंदर 2014 में जर्मन बॉय को डायग्नोस किया गया था और उसके बाद इस तरह के काफी सारे केसेस मिले हैं जहां पर म्यूटेशन वाले बच्चे पाए गए हैं. तो जैसे कि कुछ एग्जांपल है, मारिया नोमोवा रसिया से है जिनकी कैपेसिटी है 10 इयर्स की एज में 150 केजी की बेंच प्रेस करने की. म्यूटेशन के और भी केसेस है जिसमें 8 साल की बच्ची जिसका खुद का वेट 40 केजी है वो 350 केजी तक का वेट लिफ्ट कर सकते हैं. देन यूलिनियो स्टोर, ये दो वर्ल्ड रिकॉर्ड होल्ड करते हैं पुशअप्स का और हैंडस्टैंड वॉकिंग का. और भी कुछ बच्चे हैं जैसे लियाम है, 5 मंथ की एज में, सिर्फ 5 मंथ की एज में इन्होंने आयरन बार को बाइंड कर दिया था. और उसी तरह से है एंड्री कोस्टा ऑफ यूक्रेन जिन्होंने 3000 पुशअप्स का वर्ल्ड रिकॉर्ड किया और उनका बेस्ट परफॉर्मेंस है 6000 पुशअप. 3000 पुशअप उन्होंने सिर्फ 2 घंटे 29 मिनट्स में अनस्टॉपेबल किया था, विदाउट ब्रेक किया था. अब मायोस्टाटिन इनहिबिटर का क्या हम लोग थेराप्यूटिक यूज कर सकते हैं? तो फर्स्ट ऑफ ऑल कि इसको मसल्स वास्टिंग या जो भी न्यूरोलॉजिकल डिसीज है जहाँ पे मसल्स वास्टिंग होता है या डिजनरेशन होता है बॉडी का, वहां पर इनहिबिटर्स को यूज कर सकते हैं. मायोस्टाटिन लेवल को हम मैनिपुलेट करके बॉडी में काफी सारी जेनेटिकल थेरापीज कर सकते हैं. मायोइनहिबिटर को हम लोग इनहिबिटर को यूज करके बोन मास को इम्प्रूव कर सकते हैं जो कि हमारे इंडियन फीमेल्स में काफी बड़ा प्रॉब्लम है बोन मास और बोन क्वालिटी से रिलेटेड. पॉलीस्टाटिन को हम लोग इसके एंटागोनिस्ट के तौर पे देखते हैं। इवन हमारे कार्डियक मसल्स पे भी इनहिबिटर्स का पॉजिटिव इम्पैक्ट होता है। एथलेटिक यूज क्या है? एथलेटिक यूज ये है कि जब भी मायोस्टेटिन कम होता है तो मसल्स मास बढ़ जाता है। डायरेक्टली ये कोई स्ट्रेंथ इंप्रूव नहीं करता है, बट मसल्स मास एक बार बढ़ जाता है तो ट्रेन करके हम लोग बहुत सारा वंडरफुल रिजल्ट गेन कर सकते हैं एथलेटिक परफॉर्मेंस में। वाडा ने मायोस्टेटिन इनहिबिटर को बैन किया हुआ है, बट अगर कोई विथ जो बाई बॉर्न ही जिसके अंदर ये म्यूटेशन आ जाता है तो उसको तो हम लोग रोक नहीं सकते हैं। पॉलीस्टाटिन जो है इसी कंसेप्ट पे ये हल्क मूवी बना हुआ था और ये रियल में एग्जिस्ट करता है। हमें इंडिया में इसकी स्क्रीनिंग करने की जरूरत है। तो कंक्लूजन ये है कि इस तरह की चीजों अगर हम इसको आर्टिफिशियली करेंगे तो ये वाडा में तो बैन है, बट अगर हमारा जो टैलेंट आइडेंटिफिकेशन है स्क्रीनिंग वाले प्रोग्राम से उसके अंदर हम म्यूटेशन वाले बच्चों को अगर ढूंढ ले तो वंडरफुल रिजल्ट मिल सकते हैं, जैसे यूक्रेन और रशिया के बच्चों को रिजल्ट मिल रहे हैं। थैंक यू। नाउ आई मे टेक क्वेश्चंस।
Dr. Chirag, it's a wonderful presentation. Am I audible?
Yes,
Yeah,
yes,
you are
yes.
audible.
As you have already mentioned that this is banned from VADA and NADA, right?
Yes.
So here my question is, we have to be very careful about that how the athletes are taking care of the doses and how this thing will
See,
be taken care of.
basically we don't need to do anything, okay, against the VADA specially. बट हमारा जो जेनेटिकल स्ट्रक्चर है उसमें जो सेकंड पेयर ऑफ क्रोमोसोम होता है उसके अंदर नेचुरली मायोस्टेटिन अगर नॉक्ड आउट है, मतलब मायोस्टेटिन डेवलप ही नहीं हो रहा है जो कि हमारे मसल्स ग्रोथ को रोक रहा है, तो आप देख सकते हैं कि इस तरह के बच्चों ने क्या परफॉर्म किया हुआ है। तो ये इस तरह के बच्चे हमारे हमारे टैलेंट आइडेंटिफिकेशन में हमें ऐसे जेनेटिकल स्क्रीनिंग को इंक्लूड करना पड़ेगा। अभी तक क्या है, हम लोग एंथ्रोपोमेट्रिक एरोबिक कैपेसिटी ये सब पैरामीटर को लेके चलते हैं। इस पैरामीटर को ऐड करना चाहिए। हमें कोई भी आर्टिफिशियल जेनेटिकल थेरेपी नहीं करनी जो वाडा में बैन है, बट अगर कोई विथ बाई बॉर्न ही अगर इस क्वालिटी के साथ प्रोड्यूस हो रहा है तो हम ऐसे बच्चे को अगर स्क्रीन करेंगे तो ये हमारे लिए बहुत ही वंडरफुल रिजल्ट्स लेके आ सकते हैं इंटरनेशनल स्पोर्ट्स में।
So what are the techniques and what are the options to add this genetical?
हाँ, इसमें क्या हुआ, जो इन बच्चों को भी फाइंड आउट ऐसे किया है जो इनका नेचुरल बॉडी स्ट्रक्चर बहुत ही नॉर्मल होता है, आप इसको नेचुरली आइडेंटिफाई नहीं कर सकते दूसरे बच्चों से। जब ये लोग स्पोर्ट्स में जाना शुरू करेंगे, जो कि यूक्रेन और रशिया में बहुत ही कम एज में बच्चे स्पोर्ट्स में एंगेज होना शुरू होते हैं, तो आपको अपने आप ही इनका ग्रोथ इतना फास्ट होता है और मसल्स पुट ऑन बहुत ही फास्ट करता है इनका बॉडी, तो आप इसको आइडेंटिफाई वैसे कर सकते हैं। पहला चीज है। दूसरा चीज, इसको कंफर्म किया जाता है। इसको कंफर्म ऐसे किया जाता है कि इसका जेनेटिकल टेस्टिंग होता है। कोई भी जेनेटिकल लैब के अंदर आप जाएंगे, उसको जीनेमोनिक लैब्स बोलते हैं, तो वहाँ पे जेनेमोनिक लैब्स में आप जाएंगे तो वहाँ पर ये टेस्ट आपको कंफर्म करके वो लोग दे देंगे कि मायोस्टेटिन इनका। और इसमें भी दो कैटेगरी होती है, एक होता है सिंगल नॉकआउट और डबल नॉकआउट, क्योंकि मदर और फादर दोनों तरफ से उनको ये जीन मिलते हैं। अगर सिंगल नॉकआउट होगा तो रिजल्ट थोड़े कम मिलते हैं, और डबल अगर दोनों तरफ से अगर इस तरह का जीन उनको मिले हुए हैं तो दोनों में मायोस्टेटिन का जो लेवल होगा बिल्कुल ही रिड्यूस्ड होगा। तो लैब में इसको कंफर्म कर सकते हैं, बट ये
Dr. Chirag,
यस सर।
is it? Yeah,
Yes, sir.
continue, finish it off, please. Then
Sir, I completed, sir. You may.
No, you were telling something. I didn't want to interrupt.
तो
Okay,
सर
so
इसमें
I
ये
just
होता है
wanted to
कि
know what. Continue. Sorry to interrupt
हाँ
again.
सर,
Continue.
ओके सर। तो इसमें सर ये होता है कि कुछ बच्चों को एक सिंगल पेरेंट से भी मिल जाता है इस तरह का जीन, और कई बार दोनों पेरेंट्स से मिल जाता है। तो अभी स्क्रीनिंग में क्या है, जैसे आंद्रे अगासी और स्टेफनी ग्राफ के बच्चे वगैरह है, उनके ऊपर ये काफी स्ट्रिक्ट वॉच रख के लोग चल रहे हैं कि इस तरह के बच्चों के अंदर क्या इस तरह का जीन मिल सकता है क्या ऑलरेडी। तो अभी ज्यादातर जो जिनके पेरेंट्स सर्कस वगैरह में ज्यादा लेबरस वर्क में जुड़े हुए थे, उनके बच्चों में इस तरह का जो म्यूटेशन वो ज्यादा देखने को मिलता है। अभी ये बहुत ही एडवांस स्टेज में नहीं आए हैं हम लोग, क्योंकि इंडिया में इसकी टेस्टिंग ही 2003 में स्टार्ट हुई है, और ग्लोबल लेवल पे भी इसकी जो फाइंड आउट वो 1997 में हुई। अवेयरनेस कम है। इंडिया में किंसियोलॉजी के जितने भी डिपार्टमेंट है जिसको हम फिजिकल एजुकेशन बोलते हैं, वहाँ पे जेनेटिकल स्टडीज नील के बराबर होती है ऑलमोस्ट। और अगर इसमें हम लोग प्रोग्रेस करेंगे तो हमारी स्क्रीनिंग टेक्निक ही पहले हमारी बदल जाएगी। और आप देख सकते हैं कि डिफरेंस इतना वास्ट है, क्योंकि इस तरह के बच्चों को जब एक बार आइडेंटिफाई करके जब कोर्स में इंट्रोड्यूस किया गया तो इन्होंने एक एक साल में ओलंपिक के लिए क्वालिफाई कर लिया। एक साल की ट्रेनिंग में ये 4-5 साल में ओलंपिक के मेडल्स लेके आए हैं जब ये एडल्ट हो गए। तो बाकी सर आप बताइए और क्या जानना चाहेंगे?
Yeah, so I just wanted to know what would be the probability in terms of percentage that we will have kind of mutated children among the general population.
Among the general population, sir, currently, like
Like,
in a
and is there
country
an
like
estimate, or
there is
have you
there is
tried to find out
not ready-made
that?
not ready-made data is available, but we can calculate on the basis of the population available in Russia. And there are 7 kids Russia means Ukraine and find out from their population. And if we have a like larger pool of population, we might have 50-60 kids probability today existing in our system, but we are not known of them. On later stage, we can use like stem cell
Because
technology and get that particular mutation ingested before they're born. Even the technology has become so advanced कि हमें अगर इस तरह का म्यूटेशन चाहिए तो हम पहले से ही इसको प्लान भी कर सकते हैं। बट हमारे पास बेसिकली पहले हमारे पास 1-2 बच्चे तो हो, तो बाद में उनके जो स्टेम सेल है उसको यूज किया जा सकता है।
but is there any data on the Indian children who are treated like this?
No, no data available in Indian population.
Okay. Okay, thank you so
Only
much for
four
the
five
whole
countries:
presentation. Is there
Germany,
any other?
yeah,
Yeah, continue, doctor.
only Germany, US, then England, and these Russia. There are 4-5 countries that only aware about this type of thing,
Okay.
and they have got their results here.
Okay, thank you. Any other question from the audience, Tanvi ma'am?
No, sir, no any questions. Thank you, Dr. Chirag Vagela.
Yeah, thank you, ma'am. Thank
Yeah,
you.
we are having next presenter with us, Ayush Rawat. His topic is effect of shadow training on the beginners and advanced player in achieving high performance in badminton. Ayush Rawat, are you there?
Yes, ma'am. Can I start?
Yes, sir. You can start and
Please.
you can present your screen also.
Uh, Good afternoon, one and all. Chairperson Dr. R. Ram Mohan Singh, Co-Chair Dr. Janvi Ichhapuria ma'am, Jignesh Tandil sir, and Dr. Tanvi Tarapara ma'am. Uh, my topic is effect of shadow training on beginners and advanced players in achieving high performance in badminton. Unfortunately, I'm out of PPT access right now, so I will be presenting my topic orally. Yeah. First of all, I would like to start by explaining the meaning of shadow training. Shadow training is basically the practicing of any game, be it in badminton or any other sports, by practicing it without the use of equipments. Like in like we are doing net practice in cricket, or in any other game, we are doing shadow practice by using the actual equipments. Like in badminton, we are we are practicing the shadow training by which helps us in maintaining the coordination abilities, the back strength, the physical ability, speed, endurance of a badminton players. So basically, it is like covering the badminton court without actually playing badminton. Shadow training is the most important training method, which is currently adopting in every academy in India and in world. So my research my research is basically on the effect of shadow training on beginners and advanced players. So for this research, Yeah. So for this research, this was an experimental research with a pre and post test design, which includes shadow training on selected experimental and control groups. For this study, we selected 20 male badminton players for this study, uh, and we divided into two groups: control group and the remaining 10 group in the experimental group. The age category of the badminton players were 15 to 19 years, and the duration of the shadow training was 30 to 35 minutes for 4 times a week. And the result and the result of the improvement of the subjects were calculated after the 12-week program. And so the data, the pre and the post test data collected were then statistically verified by using the analysis of covariance, which we can prove that there is significant effect of shadow training on some physical variables in the players of badminton. So for my research, I used two physical variables currently: the lower back strength and the upper back strength. Yeah, the lower back strength and the upper back strength. So initially, for the first week, we collected the data, which is the pre-test data of the beginners players of the control group and the experimental group, by using the cross Weber test. It is a test which we use in badminton or in any other game to check the back strength, lower back strength, and the upper back strength of a player. So for that, so we use the cross Weber test for uh, for for getting the data for pre-test of the control group and the experimental group. Then we use the shadow training program for 12 weeks on on the control on the experimental group and after the completion of the 12-week program, we then again check the back strength by the same test, cross Weber test, of the players of the selected experimental group. So there was significant difference between the rating of the pre-test and the post-test result of the experimental group. And to verify our data, we check the control group players also, to which the training was not given. So for statistically verifying this, we use the SPSS software 25 uh, to find out the significant variation in the pre-test and the post-test results of the selected experimental group. And by using the ANCOVA test, we could find out that there was a significant difference between the pre-test result and the post-test result of the control group to which the training was given. So yeah. Yeah. So after getting the result, we could easily conclude that there was significant effect of shadow training on the lower back strength and the upper back strength, and which was a great training method to improve the badminton skills and in achieving high performance of the badminton players. Yes, sir. So I have completed my presentation. So is there any question you can ask?
Okay. Yeah. Thank you. Thank you, Ayush.
Yes, sir.
The house is open for questions from the audience.
No any question in chat box, sir.
Okay. Ayush, I would like to ask, see, you had a group that were beginners and there were also groups that were little advanced, correct?
Yes, sir.
So what type of differences did you give in the shadow training for both these groups?
Sir, the shadow training of the pattern of shadow training for the advanced and the beginners group was almost similar, but the intensity and the duration The intensity and the duration of the training was there was difference in intensity and the duration of the shadow training for the advanced group and the beginners group. Like for the beginners group, the initially it was for 30 minutes because they were like the beginners group and the intensity was around 50 to 60. Whereas as compared to the advanced group, which are already used to that training, they were easily able to do the 40 to 45 minutes training with an intensity of 70 to 80%, because as they're already used to the training, so they were a bit comfortable with the training schedule.
Okay, so how did the distinction come between the beginners and the advanced players? What type of distinctions in the post test did you see?
Sir, the initial results were the initial results of the control group, the initial groups which were made of the control group and experimental group. They both were beginners group. For the test, I did not use the advanced group because uh, to check the actual difference, I used the beginners group in both the control group and the experimental group. So at the first time, the reading of both the experimental and control group were almost similar, as both of them were beginners. But at the end of the post test, after the completion of the training program, the one beginners group which was imposed the shadow training program, in the readings, like for back strength, there was almost improvement in for 20 to 30% improvement in every players. And comparative to the control group, again the reading was taken which was not given the shadow training. The results were almost similar. So by that we can conclude that the group which was given the shadow training program, there was an improvement in the readings as compared to the uh, non-training group.
Okay, so was the shadow training given thrice a week or you did it every day? Did they undergo any other training or they did only shadow training?
No, sir. It was 4 times a week, and with including there was also a skill test. There was also a skill practice also, because as my topic is achieving high performance in badminton, we need to give the physical test as well as the skill test. So apart from shadow training, there after the completion of shadow training, there was skill practice also. Like shadow training is without the use of shuttlecock. So after shadow training, we were given the same shadow training with the use of shuttlecock. So which
Okay. Okay, thank
Yes,
you.
sir. I think Dr. Himanshu Dave wants to ask this question. Dr. Himanshu?
Am I audible now?
Yes, sir. You are audible.
I would like to ask one question that is it obvious shadow training for the advanced player and how it is? Because your study suggests that there is a development in lower and upper back by shadow training. But I guess those who are advanced players, they achieved most of the skills at its best, and then only they compete at the higher level. So, is it advisable for the advanced player training?
shadow training is the most important. Shadow training is given to the advanced players also. Like if you watch the training schedule of PV Sindhu and Saina Nehwal, shadow training is must for them. But for the research, if we want to actually define the effect of shadow training, we have to take the beginners group to see the actual effect. If we see the data of advanced players, because they are usually used to the shadow training. So if we collect the data according to the advanced players, we won't get any much difference, because they're already used to it. So for the research purpose, I use the beginners group to see the actual effect of shadow training. And shadow training is everywhere. Like the Olympics also, the players which are currently presenting India in the international level, they are they are also completing the shadow training almost daily. As they are advanced player, they are doing shadow training for more than 1 hour daily with an intensity of 50 to 90%,
Okay.
because their
Thank
body are
you.
used to it. Yeah.
Thank you.
Thank you, sir.
Yeah, thank you.
Thank you, Ayush Rawat. It was a good presentation. Now I would like to request Manish Bhutani, sir. Are you there, sir?
Yes, ma'am.
Yeah. His topic is role of aerobic exercise to reduce body fat percentage of overweight people. Yeah, Manish Bhutani, sir, over to you.
Thank you very much, ma'am. Good afternoon, everyone. Dr. Ram sir, Tanvi, Tanvi ma'am, Dr. Janvi ma'am, and all the
Good
participants.
afternoon.
My topic is role of aerobic exercises to reduce body fat percentage of overweight people. For this, the purpose of this presentation of the study is to find out the role of aerobic exercise to reduce effect of aerobic exercise to reduce body fat percentage of overweight people. For this, I have selected 40 overweight people of male and female as a subject between 35 to 50 years, and I divided both the group in equal 20 people, persons, uh, 20 as an experimental group and 20 as a control group. In uh, in the present study, randomly this sampling technique, purposive random sampling technique was used to select the objects and for measuring body fat percentage, the body comparison analyzer and WHO's BMI format it was used. Uh, and after that, after measuring pre-test, I gave aerobic training to the experimental group till 8 weeks, and found out that what is the difference between on the basis of conducting t-test formulas. Uh, Through our human history, being fatty was no an option because at that time.
Manish sir, just go straight to. Excuse me,
Sorry.
Manish sir, you can go off to methodology. Methodology. Start from methodology. Method. Yeah.
Achieve this purpose, all these 40 people, male and female overweight people, they were divided in two groups. One as an 20 people were control group and experimental group. Variables of the instruments for measuring body fat, body composition analyzer, BMI was used. Then after 8 weeks training program of various aerobic exercises was done. Beginner for 2 weeks, beginner walking, standing, footwork, jumping jack, basic aerobic exercises. Then intermediate another 2 weeks, and advanced 4 weeks. That is skipping, rope, advanced aerobic exercises, mountain climbing, jogging on treadmill, cross trainer, cycling. This type of exercises it was given to the experimental group. After procedure, for the measurement of body fat percentage, body comparison analyzer, after assessment of pre-test and experimental group aerobic exercises was given for 8 weeks, and no training was given to the control group. After the completion of this specific training program, the post-test also was conducted through BMI and body fat percentage calculation. After that, the t-test was used to determine the role of aerobic exercises to reduce body fat percentage of overweight people. Further, it was significant was set at a 0.05 level, and the result on that basis of after calculating three tables by fixing the t-test, it was found. Then in first group, there was no significant difference in pre-test of body fat percentage. And after post-test body fat percentage score between control and experimental group, that comes and a t-test is also 2.04. So in same level, and it came to 4.75. So on that basis, we can say that effect of aerobic exercise it was affected, and it was helpful to reduce the body fat percentage in experimental group. Again, in control group, both the way pre-test and post-test control. So we could not see the significant difference between pre-test and post-test in their body fat percentage. And then last table, especially for experimental group, pre-test and post-test, there is a vast difference of T ratio, that is 6.44. So hence it may be considered that there was a significant difference found in body fat percentage between pre-test and post-test experimental group. So on that basis, we can say that any type of physical activities or any specifically aerobic exercise, it will affect to the to reducing the body fat percentage. Conclusion, with the limitations of study, it was conducted that there was no significant similarities found between control and experimental group in pre-test. And further, it was conducted that 8 weeks aerobics training, exercise training, the experimental group having a low percentage of body fat in comparison to control group, those having no training in comparison to them. The overall result showed that the effect of aerobic exercises was significant on body fat percentage of experimental group as compared to the control groups. Thank you very much.
Thank you, Mr. Manish. As you have mentioned that there are two groups, controlled and experimental. I could not find the intensity and volume bifurcation of the training program. So could you please highlight those parts?
Sorry, ma'am. Can you repeat the question?
Yes, yes. I could not find during 8 weeks what are the intensity and what are the volume of the exercise you have given to the participants. So can you highlight those parts?
Yes, yes, yes. Maybe it was uh, in first and part it was there. The this training, it was conducted on daily basis, 60 minutes, 1 hour daily basis, that is per week. That is for continuous for 8 weeks to the experimental group. In a
Janvi, please unmute yourself first.
Oh, I'm sorry.
Yeah.
60 minutes per week or per day?
per day, ma'am.
Per day. Okay. Please continue.
Yes, it was nice presentation, Manisha.
Thank you
Uh,
very much.
we are having 4 questions in a row. Rupal Singh, you had raised your hand. You are having any question? Rupal Singh, are you there? Second, Ayush Rawat, you want to ask question? Dr. Hasmukh Patel, if you want to ask a question. Last, Dr. Himanshu Dave, please ask the question.
Manish, is there any specific criteria to select the overweight people for your study?
Hello.
Hello.
Yes, sir.
Manish, is there any specific criteria to select the subject for your study? Those who are over.
Yes, sir. It is a on the basis of purposive random sampling techniques will be used for to select the object, sample.
Okay. And how you can define those general people, overweight general people, give them a title of something else?
Generally, it depends on their physique and depends on their obesity level, BMI level.
Okay, but is it advisable to give them a mountain training or skipping those who are overweight?
Okay. So, can you repeat, sir? Your voice is not clear.
I'm asking you
Mountain.
that is it advisable to give them mountain climbing or for those overweight people, those who don't have any sports background?
Uh, at in the last stage, we can on basic level we can give, sir. In a at advanced level in a fourth stage, fourth last week. In the beginning, we cannot give. Otherwise, definitely that people cannot be able to perform that type of exercise.
Okay, thank you.
Welcome, sir.
Yeah. Yes, Dr. Vikas
Yeah.
Prajapati, sir, you
Yeah.
can ask your question.
Manish.
Yes. Thank you, ma'am. Manishji, I have just one
Yes.
question that why you have used the WHO BMI criteria when the criteria for the BMI for the Asians and especially for the Indians is a little differ.
Most probably, the BMI criteria it is little bit same only on the basis of
No, it
high
is not same. Let me
standard.
let me correct it, Manishji. It's not the
It's not
same.
same.
That is why I have put ask this question.
The general standardized BMI only I have preferred. That is to calculate BMI weight upon height square in meters.
It's a formula.
Yeah. So on what basis you are telling, sir?
I had a simple question. When we have an Indian standard, Indian norms for the BMI, why you have not taken this as a criteria for BMI?
I am not getting proper.
Yeah, okay. It is. You can take it as a suggestion, Mr. Manish. So there is a
Okay, okay,
separate
sir.
standard for BMI calculation of our Indian population. So instead of sticking to the American and European standards, we have a formula for Indian standards. So kindly take it as a suggestion to use it in your future.
Okay, okay. Thank you, sir.
Yeah, and two suggestions I am having that I think you need to look into it. First thing
Please,
is
sir.
you have added mountain climbing, right?
Yes, yes.
See, mountain climbing itself is a very big task, and when you go and climb mountain, it will take weeks and months. So it probably, I think you want to indicate hill training or hill climbing, than telling it as mountain climbing. Correct? So mountain, you are doing 8 weeks of training. So it will be one specific hour, right? 2 hours or 3 hours in the morning or 2 hours or 3 hours in the evening. So in these 2 3 hours, you can't climb a mountain and come back. So
That is
it
not, sir.
the
Excuse me, sir. That
yeah.
mountain climbing, it is related to only the in-house training we are doing, like push-ups, and we are doing the mountain climbing related
Yeah, so
exercises.
you can mention it as hill training or a step training or slope training. When you term as mountain climbing, it means something completely different. So
Okay.
that's one suggestion. Another suggestion is in the discussion part, you have mentioned that no significant similarities were found in the control and experimental group.
Okay.
So when you say that no similarities were found, that means in the starting stage itself there is difference. So the group has to be equal before training. Only after training you can show some difference, or there can be some difference. So maybe there also the words you have used is not exactly signifying the result, because in the beginning itself when the groups are different, then obviously in the end also you could have difference in the impact. So it has to be equated. Before you start the experiment, both control and experimental group should be similar. There should not have dissimilarities. So that is one more suggestion. Maybe grammatically or wording wise, some you have to look into that aspect. Thank you.
Welcome, sir.
Thank you, Manish sir. Uh, Janvi ma'am and Ram sir, please note, Sunil Galapati is not going to present the paper due to technical issues at their end. Now we are moving to last presentation. Again, Raghvendra Bazi Reddy sir, are you there?
Yes, yes,
Yeah, and I hope your connectivity is now clear.
yes.
And sir's the topic is effect of different proportion of aerobics and anaerobics demands on FVC and FEV1 among allied athletes. Over to you, Raghvendra sir.
Thank you.
Dr. Tanvi, there is one more name, Amit Rawal. Is he
Ma'am, he
going
is
to
going to
present?
present in track 2.
Okay, fine, fine.
Yeah.
Thank you.
Sir, it is visible, sir.
Sir, please continue.
No, you have to open the file.
Yes, sir, I have
Open
opened.
your PPT.
Yes, sir, already I have
Then
opened.
select tab, you will get tab window. Select tab. When you are selecting present, you have to select a tab or a window according to the file situation, and then only it will show.
Stop presenting.
Okay.
Again, click on presentation.
Yes, yes. Stop presenting. Present now. Can I
Yeah.
click on enter?
You are getting options. No,
Enter, enter screen.
where you have opened the file. You,
Yes, and desktop.
no, file. You have opened
Yes,
it.
yes, sir. Already opened.
Yeah, then select tab.
Yes.
Present a tab.
Third option.
Tab, full window, full screen. Okay, doesn't matter.
Doesn't matter. You start your presentation
You
orally.
start
It's
orally.
okay,
Yeah.
sir. No problem.
Yeah.
Yes.
You just see the presentation there and you start talking, no problem.
Good afternoon to you all. My topic is effect of different proportions of aerobic and anaerobic demands on forced vital capacity and forced expiratory volume in 1 second among elite athletes. For this study, human cannot live without oxygen. Oxygen is essential for energy production that fuels our body's workouts. Without oxygen, we cannot make energy to our body. Regular aerobic exercise requires more oxygen. It is possible through increase the ventilation capacity. Progressively increased load on the respiratory muscles will enhance the frequency and the speed of the respiratory muscles. According to Anju Mandan et al. 2015, aerobic exercise works towards increasing total pulmonary ventilation. Long-term training in endurance activities seems to establish that more constant airway changes can occur during the course of sports season. The methodology is selection of variables depends on different proportions of aerobic and anaerobic activities. The human body will get different adaptations. According to Edward L. Fox suggested different proportions of extreme aerobic and extreme anaerobic events. In this, 0% aerobic to 100% anaerobic is extreme low, 100% aerobic to 0% anaerobic is extreme high. As in this table, 0% aerobic, 0% aerobic, 100% anaerobic activity is 100 meters race, that is time is 10 seconds, and 10% aerobic, 90% anaerobic is 200 meters. Like that 50% aerobic, 50% anaerobic is 1500 race, and 90% aerobic, 10% anaerobic is 10,000 meter race. In this, I have chosen three independent variables. Group 1 is 10% aerobic and 90% anaerobic proportion 200-meter race, and group 2 is 50% aerobic and 50% anaerobic proportion is 1500-meter race, and group 3 is 90% aerobic, 10% anaerobic proportion is 10,000-meter race. The selection of subjects is I have taken 45 male elite athletes, national varsity male elite athletes were randomly selected as subjects from Telangana and Andhra Pradesh states. All the athletes were successfully participants at national and university level sports. Subjects aged between 20 and 25 years. All the athletes were in top form and healthy. Their sports age is from 5 years to 7 years. The dependent variables are forced vital capacity and forced expiratory volume in 1 second. The definition of vital capacity is maximum value of expired after maximal inspiration. That is a forced vital capacity. The forced vital expiratory volume in 1 second is defined as a value that is expired in the first second of the forced expiration. That is the collection of data. The data was collected with a smart one spirometer. The calibration is made at Rome, Italy. The product is smart one spirometer. For this study, the statistical analysis is I have used ANOVA and data were analyzed by the using of IBM 25 SPSS package. The level of confidence was fixed at 0.05 for significance. To determine the significant difference among the three groups, I have used CFS post hoc test applied for post hoc test. The result of the study, the means of 10% aerobic forced vital capacity, group 1 mean is 4.526 liters and group 2 50% aerobic, 50% anaerobic mean is 4.536 and 90% aerobic, 10% anaerobic mean is 4.817. The obtained F ratio is 37.123 is greater than the table value of 3.22. Degree of freedom 2 and 42 for significance at 0.05 level of confidence. Hence, there is a significant difference among three groups. The group 1 and group 2, the mean difference of 0.010 liter, the mean difference of group 1 and group 2 is less than the table confidence interval value. There is a first group and second group significant. There is no significant difference, and 50% Arabic, 50% Arabic group is 0.28. There is a greater than the confidence interval value of 0.069. So there is a significant difference, and group 1 and group 2 and group 3. There is a more significant difference between group 1 and group 3. The main difference is 0.291 is greater than the confidence interval value of 0.069. There is a forced vital capacity is 90% aerobic and 10% anaerobic is more than the other two groups. The forced expiratory volume in 1 second, the means of group 1 is 3.77 and group 2 is 3.822 and group 3 4.108. The obtained F ratio is 63.844 is greater than the table value of 3.22. Degree of freedom 2 and 42 is significance at 0.05 level. There is a significant difference among three groups, but group 1 and group 2, there is a main difference is 0.43 is less than the confidence interval value 0.059. So there is no significant difference between group 1 and group 2. There is a significant difference group 2 and group 3. The main difference is 0.28 is greater than the confidence interval value of 0.059. And the main difference of group 1 and group 3, that is a 10% aerobic and 90% anaerobic, and 90% aerobic and 10% anaerobic is 0.329 is greater than the confidence interval value of 0.059. There is a significant difference between group 1 and group 3. In this forced expiratory volume in 1 second is 90% aerobic, 10% anaerobic is greater than other two groups. The conclusion is the forced vital capacity at rest has been significantly increased 90% aerobic and 10% anaerobic group as compared to 10% aerobic and 90% anaerobic group. Further, it is found that there is no difference between 10% aerobic, 90% anaerobic group and 50% aerobic, 50% anaerobic group. The forced expiratory volume in 1 second is has been significantly increased 90% aerobic and 10% anaerobic group as compared to other two groups. Then the 10% aerobic, 90% aerobic group and 50% aerobic and 50% aerobic risk, there is no significant difference. The implications is for the result of the study, the investigator has revealed that the 90% aerobic and 10% anaerobic training is quite suitable for proportion to increase the forced vital capacity at rest and forced expiratory volume in 1 second at rest. Thank you, sir. This is my presentation. Any questions?
Thank you very much, Mr. Raghavendra. Nice concept you have given. Yeah. Any questions from the audience?
No questions, sir.
Fine. So let me just ask one question.
Sir.
Now you see these different proportions you have taken for actually, yeah. How do you think going to affect the athletes? They are all elite. Max has changed according to events. And what is it? How is it going to help their future? Your findings, how you can practically implement on athletes. Do you have any suggestions for that?
Sir, Edward L. Fox suggested that 10% different percentages of aerobic and anaerobic events is different events. 10% is 90%, 10% aerobic, 90% aerobic is 200-meter race. And like that, 90% aerobic, 10% aerobic, 10,000-meter race. 100% aerobic and 0% anaerobic is marathon races. He is suggested. In that, I have taken three proportions, sir. If aerobic event, continuous event, there is a more adaptations in the human systems.
Yeah, correct. So because of the training, these changes have occurred. So what do you want to conclude by that? So the sprinters, the 100 meters runners also should do something like the marathon runners to improve their VO2 max. What is your suggestion? I'm just asking for a question's sake. Nice study. So I'm just asking what is your answer for that? Or you now the idea is to have good VO2 max, like you want to improve it. Vital capacity you want to improve. So you want the sprinters also to do like marathon runners?
No, sir. Marathon runners is different activities. That is purely aerobic activities, endurance activities.
Yeah. So now, how do you want to conclude in your study based on the findings?
In these findings, my suggestion is more aerobic activity is more adaptations getting human body. That is 90% aerobic, 10% anaerobic. I have taken that independent variable. 100% aerobic also more adaptations will be.
Okay. Thank you so much. Any other questions?
No, sir. Thank you so much, Raghavendra Reddy, sir.
Thank you, ma'am.
With this fixed knowledgeable presentation, I request Dr. Ram and Dr. Janvi to summarize the track 1's presentation.
Yeah. I request Janvi ma'am to please do the honors.
Thank you so much, Dr. Ram. It was indeed Very good presentation. All the authors have shared a very insightful information with all of us. And now, not taking much time as Dr. Geeta has joined, and she is facing already connectivity issues. So I request Dr. Tanvi to invite her for her presentation.
Yeah, okay. Thank you so much, Janvi ma'am and Ram sir. Now I
Thank you, ma'am.
request Dr. Purvi
I would,
Kothari ma'am to,
if I can just take 1 minute, I would like to thank
yes,
the organizers, Tanvi ma'am, Janvi ma'am, Surat University, Oro University, Surat. A big thanks for
Thank you, Dr.
giving me
Ram,
this wonderful
for the
opportunity.
request.
Thank you so much.
thank you sir, thank you so much.
Thank you.
Now I request Purvi ma'am to take the platform on her hand. Over to you, Purvi ma'am.
Yes, we have been enjoying a wonderful session. Excellent papers are being presented. But as per the promise, Dr. Neeta Bandopadhyay is back. She committed us for 1:30, and I think she is waiting. Let us hear words from ma'am, straight from Calcutta. So over to you, Dr. Neeta.
Thank you, Purvi. Really, sorry for the inconvenience. I tried all day, but I could not connect. Now also, I'm not getting connection in my laptop, so I'm sharing. I'll keep my video on and I'll showing the laptop. Okay.
Absolutely fine, ma'am. Your words
Yeah,
are more than important to us. Even if we
yeah.
cannot see the presentation, everybody is
I
eager to hear you.
It's
Please
okay.
go
Now
ahead.
I think it's visible, no? Yeah.
Yes, yes, ma'am.
Okay, okay.
Yes, ma'am.
So my topic was need of physical literacy in 21st century. Uh, so
Yes ma'am, it is visible.
okay, okay. So now I'm going to talk on topic need of physical literacy in 21st century. The 21st century witnessed the huge technological development and in communication, in information, and in other areas also. Technology is the application of scientific knowledge for practical purpose. Here are some facts about technological growth. The 40% of the total world's population has access to the internet. 90% of the world's data was generated within the past 2 years alone. 5 billion people in the world own a mobile device. 2.65 billion people in the world use social media. Mobile banking adoption will produce 95 million jobs. So there is a impact of technology in our community life, work, health, and communication. There is no doubt that the invention of science in technology has created many amazing tools and devices which may affect our life both in negative attention span. It can increase the risk and lack of privacy, and it may increase the risk of depression. Teenagers and children who were reported more time using media are more likely to suffer from mental health issues. Now there is a chance of obesity. Already we have heard from Dr. Irani's lecture how we can gain weight because all these technological devices and equipments, they are encouraging human being to live an inactive life, sedentary life, which may result obesity. And there is one more term, that is FOMO, fear of missing out, which may be defined by the New York Times as the blend of anxiety, inadequacy, and irritation that can flare up while skimming social media. And there is one more term, that is phantom vibration syndrome. This is the perception that one's mobile is vibrating or ringing when it is not. There is a tactile hallucination since the brain perceives a sensation that is not present. And there is popcorn brain. The constant stimulation from electronics makes the human brain accustomed to popping fast-paced stream of information that can be found on the internet. So we are becoming less patient, and this is why the human are becoming increasingly less adapt to handle the slower pace of real life. Now here you see the 90s kid and the kid of today. The 90s kid, they used to spend more time with their peers. They used to play outdoor games and used to enjoy environment. But today's kid, they spend most of their time with with these gadgets, electronic gadgets, and electronic tools at home. Here the same picture I also borrow from the internet that Dr. Irani also has shown that 1990s adult and now 2008, not it is 2021's adult. You can this technology has also affected the adult also. Adults lifestyle, adults every sphere of life. Now, so even the technology is adversely affecting the adult population. The obesity and the hypokinetic diseases are the result of today's lifestyle. Already we have heard from Dr. Irani's lecture that so many hypokinetic disease. Hypokinetic disease means the disease occurred due to inactivity, due to sedentary lifestyle. Here also, that is why we need to be active. We need to have the active lifestyle. So, in this perspective, it is necessary to understand the need of active lifestyle. The active lifestyle may help the human being to live longer and prevent many chronic diseases such as heart disease, high blood pressure, abnormal blood lipid profile, then stroke, type 2 diabetes, metabolic syndrome, and colon and breast cancers. And also, the active lifestyle can improve cardiorespiratory and muscular fitness. It can raise the metabolism and help to lose weight more easily. If we can raise our metabolism, if we can maintain, we can stimulate our BMR, then we may not gain weight much. Then it can also, active lifestyle can also reduce stress, anxiety, depression, and also can improve mood. And it also helps to maintain brain function in older adults, and it also helps in digestion and promotes regular bowel movement, increases the bone density, and also it helps to improve the sleep quality and improves overall quality of life. So we, the physical educator and the parents, should take an initiative to incorporate the physical literacy into children's lives from the very young age. Now, physical literacy means born to move. Physical literacy can be developed, can be acquired through running, jumping, kicking, climbing, and swimming. Physical literacy may be defined as the motivation, confidence, physical competence, knowledge, and understanding to value and take responsibility for engagement in activity for life. Physical literacy can be initiated with the motivation to move, then we proceed to having confidence to move, then we proceed having competence to move. And the physical literacy concept and accessible to all. It's not like that if physical literacy is only for children. It is for all ages of people, for all population. If you have not done any physical activity in your young age, it's not too late to start. Even you can anybody can start anytime physical activity or physical literacy, and it represents a unique journey for each individual. It is not the universal for everyone. You can enjoy your journey. You can enjoy your physical activity, physical literacy, physical movement, your body movement at your own pace. Okay, then it can be cultivated and enjoyed through a range of experience in different environments and cultures, and it's need to be valued and nurtured throughout the life. It's not like that ki you have played, you have invested much time for different sports and games in your young age and you will get the advantage in later life. It's not like that. It's not like the investing in a bank, so you will get the interest. If you want to gain the advantage from active life, then you have to be active throughout the life. Then motivation and commitment to be active are the core aspects. Now, here are the elements of physical literacy. There are four elements that may be motivation and confidence, that is the affective element, and then physical competence, that is the physical element, and knowledge and understanding, that is the cognitive element, and engage in physical activities for life, that is the behavioral element. So, in motivation and confidence, that is motivation and confidence refers to an individual enthusiasm for enjoyment and self-assurance in adopting physical activity as integral part of life. And then physical competence, that refers to an individual ability to develop movement skill and pattern and the capacity to experience a variety of movement with different intensities and duration. And enhanced physical competence enables an individual to participate in a wide range of physical activity and settings. Now, the cognitive, that means the knowledge and understanding, that includes the ability to identify and express the essential qualities that influence movement, understand the health benefits of an active lifestyle, and appreciate appropriate safety measures associated with physical activity in a variety of setting and physical environments. And then behavioral, the element, that means that engagement in physical activities for life refers to an individual taking personal responsibility for physical literacy by freely choosing to be active on a regular basis. Now, here are some organizations, some individual who can contribute to physical literacy to the individual. There are leaders and educators. They can teach new skills. They can encourage children to try different activities so that the children can acquire physical literacy. And the program designer, they can design program individually and for the individual. Even recreation professionals, they can create more fun in physical activities so that the every individual will be motivated to participate in a physical activity. And then parents and coaches, the parents play most important role to motivate children to remain active. And the health practitioners, they can also contribute to promote health environments. And here, the kids develop physical literacy gradually through a variety of structured and unstructured activities. The nature of these activities changes with growth and the ability as age increases. During first 3 years, the children should be encouraged for performing early movements or basic movements like crawling, standing, walking, like that. And during 3 to 5 years, the children should be encouraged to play and keep it fun. Just play for the sake of play and getting fun from play. Not any serious sports, not any serious competition, nothing is there. We should not impose them for competition. Okay. Then during these 5 to 8 years, the focus should be given on fundamental skills. And then 8 to 12 years, we should introduce more complex skills as kids are ready. Then they gain little bit biological potential, biological maturity, physiological maturity, so then they can go for these complex skills. Now, here is our fundamental movement skill. Fundamental movement skills are a specific set of skills that involve different body parts such as feet, legs, trunk, head, arms, and hands. To become completely physically literate, children need to master the fundamental movement skill, which include balance, locomotor, and object control. There are three categories. These are most important to acquire, to gain the mastery over the physical literacy, that is balance. That involves balancing the body while it is in stationary or it is in dynamic condition. And then the locomotor, that it involves the moving the body in any direction from one point to another point. This locomotion includes everything. And then object control, that involves controlling implements and objects by hand, foot, or any part of the body. That means when we play with the ball in basketball, when we play hockey with a hockey stick, or when we play the badminton with a racket, or when we play football with a ball, that time we have to control the ball. Apart from our physical sports action, we have to control the ball. Apart from these also, there are 13 fundamental movement skills that are walking, running, balance, skating, skiing, jumping, swimming, cycling, skipping, throwing, kicking, striking, catching, and trapping. These are the fundamental movements. So we should encourage the children to go for all these movements during their very young age, because this age has certain characteristics. They can develop their fundamental movements, they can develop their motor abilities during this age. If a 40 years old man, if he wants to improve his flexibility, he cannot improve like a gymnast. He can improve little bit, he can improve, but he or she cannot improve like a gymnast. If you want to gain the flexibility, you have to go for flexibility training during the very young age. So during this young age, the certain age that have certain characteristics, that which motor ability we can develop in a particular age, we have to follow that one, and accordingly that we have to prepare the schedule for the children. Here are certain things that if you cannot run, so you cannot take part in these games. That is soccer, means football, and that is the basketball, volleyball, track and field, squash, badminton, rugby. All these require running. If you cannot throw, you cannot take part this baseball, softball, which requires throwing with ball or something else. So you cannot take part all these. And these are the fundamental movements: run, throw, and then swim. If you can't swim, then you cannot take part in any aquatic sport, that is swimming, diving, water polo, scuba, kayaking, sailing, and surfing. So you have to be conscious enough to develop all this fundamental movement skill into your child. Now the role of parents and teachers to develop physical literacy among children. Each child comes to school with a dream. Do we help them to realize it or destroy it? Let's see. Now here are some tips for the teachers, what they should do to make the students, very young students, physically literate. Then teacher has to be positive role models. The teacher, he should show the movements. He should be active enough so that the students become motivated to move. And then the teachers should provide opportunities for children to develop and practice the fundamental movement skill, including use of nature and outdoor play. The teacher should encourage the children to go for this outdoor play, not indoor. All these gadgets and taking all these indoors means also now many this English medium school, they encourage the indoor games, that is the carom, chess. That should be taught. But apart from that, we should encourage during this child age. It is very important to take the children for this outdoor play, so that they can realize their body movement. They can realize the which joint can perform what kind of movement. Now teachers should encourage the children to move and positively reinforce their efforts, allow children to guide activities based on their interest and building on their ideas. Teachers should ensure children have ample rest between activities, and they facilitate activities that use a wide variety of fundamental movement skill. The teacher should plan the activities which will include the fundamental movement skill. That they can design any kind of game which require much more running, jogging, or jumping, catching, like that. Then teachers should be model and encourage determination as they learn new and challenging movements. They should promote the building of children's resilience and critical thinking by facilitating the use of learned skill in a new and exciting environment. Then they should modify activities for children of different developmental activities. And they should foster an environment that supports learning through practice and ensures children can regulate their emotions, behavior, attention in order to cope with the demands of their situation. I hope you can all see, no? Hello? 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 Hello?
Ma'am, yes, we can see.
Yeah, you can see and you can hear.
Yes, yes, we can
Okay,
hear.
okay.
Seeing it is little small but fine.
Okay,
Please
okay.
continue.
That cannot be done anything actually. I'm taking,
Yes, yes.
I'm,
No other way. Yeah.
I'm keeping my video on and I'm showing this, no slides.
Yes, 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 ma'am. Carry on. Yeah.
Okay, okay. And now here, the parents are telling that, dear kids, I will help you love to move. Now here are certain tips for the parents. These tips are also same. The parents also has to be the positive active role model. If parents are spending their time with mobile and this with Facebook and social media, and they are asking their children to go for this activity, then it's not possible. Then parents has to be active himself or herself, then they can then automatically the children will learn from the parent, because the children, they follow the parents, they follow the teachers, no, they, in young age they imitate their these parents and teachers. Then also the parents spend much time to play together with their children. This will improve the bonding with the children. And then they should catch their children on fundamental movement skill, praising them for success. Coach, sorry. And they should provide children with options for play, observing and listening to how they have fun. Then ensure that children take ample rest. And also the parents, they should encourage the outdoor activities and ensure that the children get sufficient sleep so that they can refresh and alert the next day. 11 to 14 hours for toddlers and 10 to 13 hours for the preschoolers and 9 to 11 hours for the school age children. And here is how physical literacy helps an individual to get the personal success or educational success. When you acquire the physical literacy, you can get the mastery over the physical literacy helps a child to develop. Now, it improves this physical health, physique, and stimulates growth physically, mentally, and intellectually. It provides opportunity for peer group interaction, and it also improves academic performance, cognitive skill, mental health, psychological wellness, social skill, and healthy lifestyle habits. Most of the parents, they think if our child invest much time for study, they can develop their intellectual properties, they can develop their academic score, but it is wrong, the idea is wrong. If through games and sports, the children can develop much faster the cognitive ability, because in games and sports many situation occurs where the children, where the sportsman, where the individual needs to take an immediate decision, immediate solution. So by that way, they can improve their cognitive ability, they can improve their thinking ability, they can improve their perception ability. Most of the children, most of the, even not only children, most of the individual, they see so many things, they observe so many things, but they cannot perceive properly because they have very lack of perception. They are watching but they cannot perceive. So all these can be developed through games and sports. In games and sports is such kind of what should I say, such kind of event, such kind of event in our life by which we can develop, we can face many situations, we can solve the situations with fun, with enjoyment, even with the achievement, and we can develop our these skills. And also physical literacy can develop the motivation and ability to understand, communicate, apply and analyze various forms of movement. uh, all individual, all human being, we move but we do not know how we move, in which joint what kind of movement is permissible, and how we can develop our movement capability, our mobility, that sufficient knowledge most of the individual they don't have. So it also physical literacy can demonstrate a variety of movements confidently and competently across a wide range of physical activity. Nowadays, I have seen the children, those who are living in a metropolitan city in a flat, they are very weak in movement. Even they cannot go to the stairs, and they cannot get down from the stairs properly. Then it can also develop strong bones, muscles, and good posture. It can benefit motor skills and improves the capacity of heart, lung, oxygen consumption, agility, neuromuscular coordination. This is the very important thing, the neuromuscular coordination and hand-eye coordination. These only can be developed through various exposures. If frequent stimulus is given, then only the nerve impulse will come faster, and the neuromuscular coordination and the speed in the movement will develop. And it can also develop skill like decision making, gazing, creating ideas. Through various traditional games, we can acquire all these skills: decision making, then gazing, creating ideas. And also it reduces the risk of obesity. Now the obesity is the most burning issues in human life. Now obesity is creating many disease itself, so we are all aware to make ourselves not to obese. So this physical literacy can reduce the risk of obesity, and it develops the spatial awareness, and it reduces the risk of heart disease, stroke, cancer and anxiety, and also annual incomes, higher annual incomes. It means that if you are physically literate, if you are physically active, then you will be fit. You don't need to visit doctor frequently, and you don't need to invest your money for your health. And here are the global recommendations set by the World Health Organization in 2010. They are telling children and youth aged 5 to 17 years old, they should accumulate at least 60 minutes of moderate to vigorous intensity physical activity daily. And the adults aged 18 to 64 years, they should go for at least 150 minutes of moderate intensity aerobic physical activity throughout the week, or do at least 75 minutes of vigorous activity, aerobic activity throughout the week. And then older adults should go at least 150 minutes of moderate intensity aerobic physical activity throughout the week. Then physical exercise and physical literacy. Here are many physical exercise. I hope here the many parents, they are listening my lecture. They are participating in this seminar. Even you are not the parent, you may have your brother, sister, or a young children in your family, in your community, so that you can encourage all this movement during the child age. So the children will be motivated to move, and they will get fun from the movement. That is the animal friends. This activity develops coordination and balance. The kids try to imitate the movements of different animals. We can say you walk like an elephant, you run like a cat, like that you jump like a frog, so that they can imitate the movement of the animal. They will get fun, and side by side they can learn the movement. They can they can develop their ability. And then ball hockey for children. This can be also done. Then the balance poses, you just stand like that way. Who can stand for longer duration? We can create a small competition among the children, and they can develop their coordination and balance. Then basic pedal biking, we should encourage the children to go for the cycling and all, with the small cycle, so that they can develop many this dynamic balance, coordination, all these abilities they can develop. And there is basketball dribbling. With the small ball they can play and they can go for dribbling. And then bathtub swimmers, even we can arrange the small bathtub, and we can give the exposure to the children for swimming. And this flying dish and ball throws, these can also be done in at home also. The parents can also take part with their children to all these kinds of games. And here is this wheelbarrow walking, then standing broad jump, and this monkey bar challenge, and hopscotch. And nowadays, again, the days has come. We can again introduce the hopscotch. We can encourage the children for hopscotch, because we have faced nearly 1 year a unusual, a strange biological disaster, that is COVID-19, and we spend much of our time with the family members, with the kids. So the kids can be encouraged to go for this. I hope many of the parents, they have already encouraged their children to go for this again traditional games. And then jumping rope, that also that can be encouraged to the children. Then soccer dribbling, and many more games. Before I conclude with the Thomas Jefferson quote, I should say that in present day we are very uh, we have gone through a very critical and new unusual situation, that is COVID-19. And apart from this COVID-19 also, this technological development and metropolitan flat culture are also discouraging children to get the natural exposure to physical activity or peer group recreational activity. So in this context, it is the responsibility of the physical educators, sport trainer, moreover the parents, to make the children realize the importance of physical literacy and should encourage them to remain physically active. Nowadays, parents emphasize more on studies, drawing, singing, but they often neglect the physical health of their children. Being a physical educator, it is my earnest request to all parents that you should give equal importance or even more importance to keep your child physically active, physically literate, so that they will get success in life and they can enjoy their life to its fullest. And now, with the Thomas Jefferson, I will conclude my lecture, that is, exercise and recreation are as necessary as reading. I will rather say more necessary, because health is worth more than learning. With this, I thank you all, and once again, I apologize. I apologize for my inconvenience, and I thank you all. Thank you.
Thank you very much, ma'am, Dr. Neeta Bandhopadhyay, ma'am, for your indeed very informative session. After this, all the chaos was happened due to technical issues. Thank you so much, Neeta, ma'am.
Yes, thank you.
Yeah, we have a wonderful start for the conference session. And being a moderator, I would like fail in my duty if I don't thank everybody who has worked hard and tirelessly contributed to make this conference successful. On the outside of the technical session, I would like to thank again Dr. Neeta Bandhopadhyay ma'am, Dr. R. Ram Mohan Singh sir, and Dr. Janvi Chapuria for handling the session smoothly and finish on the time. Now let's begin our second track. I would like to hand over the platform to second moderator, Dr. Himanshu Dave. Over to you, Dr. Himanshu Dave. Platform is yours now.
Thank you, Tanvi ma'am. Am I audible?
Yes, sir, you are audible.
Okay. We are here for National E-Conference on Advances in Sports, Exercise Science and Pedagogy of Physical Education, organized by Sarvajanik Education Society, Sri KP College of Commerce, Surat. Would like to congratulate first Sarvajanik Education Society and Sri KP College of Commerce, Dr. Jignesh Tandel and his team to make it possible. For session 3, take 2, track 2, we have two great personalities with us for the chair and co-chair. We have Dr. Hasmukh Bhai H. Patel sir with us as a chair. He is working as an associate professor at Sri CP Degree College of Physical Education, Rajpipla. He is the treasurer of Gujarat State Kho Association. He is also the founder chairman of Board of Sports, Swarnim Gujarat Sports University. He is also the national qualified official of Kho Federation of India. He has also published and present a paper in national seminars. We warmly welcome you, sir. Then we have Dr. Vikas Prajapati sir with us as a co-chair for this session. Dr. Vikas Prajapati sir is the gold medalist throughout his academics. He is the Assistant Director of Physical Education of Maharaja Sayaji Rao University of Baroda since 2007. He has various publications in international and national journals. Sir has attended international and national workshops and symposiums. Vikas Prajapati sir has published various books and chapters in books. Sir has cited many research papers in different countries like Germany, Netherlands, etc. He is also qualified IAAF Level 1 athletic coach. He is also certified coach of tennis from National Institute of Sports. We warmly welcome you, sir.
Thank you.
Would like to request Dr. Hasmukh Patel sir and Vikas Prajapati sir for any instruction for the participants for track 2. Hasmukh sir and Vikas Prajapati sir, if there are any instruction for the participants of track 2.
Hasmukh sir, mute,
Unmute yourself, Hasmukh sir.
Himanshu, ask to Hasmukh sir, unmute yourself.
Hasmukh sir, please unmute yourself. Hasmukh sir, if you hear me, please unmute yourself.
Admin can also unmute.
Hasmukh sir, if you hear me, please unmute yourself.
એડમિન પણ અનમ્યુટ કરી શકશે. હિમાંશુ સર, એડમિન ને કોને અનમ્યુટ કરી દે?
Vikas sir, if you want to say a few words, you can continue. We are contacting with Hasmukh sir.
Okay. With permission of the chair, Dr. Hasmukh sir, Adharniya Hasmukh sir, meanwhile he is joining us. I would request all the participants. We have 8 presentations during track 2 session. So I would request all the participants to stick to the time limit of 8 minutes. 6 minutes there will be a warning, and then we will have a final call at 8 minutes. Okay, and all the audience can raise your hand if you have any query after the presentation, or maybe you can write in your chat box if you have any question regarding the presentation. So with permission of chair, I would like to invite Dr. Tejas R. Sharma, who's going to present the paper on sports expertise, major concern. Dr. Tejas.
Vikas sir, for your kind knowledge, we skip the first participants. We'll start with the second participant.
Okay.
He is Desai R. Ramesh Chandra sir, and his research paper title is Advanced Technology Used in Cricket for 21st Century.
Hello.
Desai
Hello.
Ramachandra sir, are you with us?
Himanshu sir. Yes.
Okay, sir, you
Rutesh
can
here,
start,
sir.
please.
Yeah, Tanvi ma'am, please share my PPT screen share. Hello.
Yes, I am sharing your PPT from here. Give me a second, sir.
Okay.
Yeah, it's visible now, sir.
No. Hello.
Yes, it is visible.
Yes, sir. Now you can start, Rutesh, sir.
No. I have no visible. I can't see it. Hello.
Yeah, it's visible, sir, to everyone.
No, I can't. Just a minute.
Rutesh, sir, please unmute yourself first. I think he is having technical
Okay. Yeah.
issues.
Yeah. Now clear.
Now
Okay.
it's visible, sir?
Tanvi ma'am. Yeah.
Yeah.
Hello. Now
Yes, sir,
visible.
please
Okay.
go ahead.
Please continue with your presentation, Rutesh, sir.
Yeah. Just a minute. I will start. Okay. First of all, I welcome you all. Myself, Rupesh Desai, and my topic is advanced technology used in cricket for 21st century. Tanvi ma'am, next. Okay. The technique, the technological demands for cricket. I am audible.
Yes, you are.
Okay, the technological demands for cricket in the 21st century are vastly different from that of the previous era. In the 20th century, the focus for the technical companies was primarily on the broadcasting and enhancing the reach of the game. More countries, more players, more matches, more audience. In the past, the first one-day international game was played in 1971 between England and Australia as an experiment to engage the audience. After the first 3 days of the test match were was out due to rain, the audience loved the format and so the limited overs came into the play. Today, cricket became one of the most watched sports in the world, only next to the soccer. The technology focus for the cricket in the 21st century has shifted towards enhancing the fan engagement of the game, enabling a better experience by the making the game more credible, connected, and enjoyable for the audience. Let us look at the few innovative technologies involved in enhancing the experience of fan. Next, okay, making the game more credible. Credibility plays a key link in retaining the engagement of the fan. Any umpiring errors, especially ours, often undergo heavy criticism from both the players and fans in both physical and online mediums. Some can even change the complexion of the game completely. The Umpire Decision Review System (DRS), often used as a combination of the technologies mentioned below, was brought to address some of the gaps in the real-time decision making of the umpires. Next, Nico or age detection. Real-time Nico, Tanvi ma'am, back. Hello, back. First, Nico or age detection. Back. Tanvi ma'am, back.
Yes, sir.
First one, Nico or age detection, ma'am. हाँ, Nico and age detection, ma'am. Please. Yeah.
Yes, sir.
Yeah. Okay.
Now the first invention is SNECO or age detection. Real-time SNECO from DPG Sports or Ultra Age from Hawkeye Innovation works on the principle of sound frequency to detect the whether the ball touched the bat before being caught by the fielding team. It uses a sensitive stump microphone connected to an oscilloscope for sound wave measurement. The sound waves are then filtered for ambient noise synchronized with the video signals and played along with the slow motion video for the third umpire to make a call. Next, this is a image Hawkeye Innovation Ultra Aegis. Next, Tanvi ma'am. Okay, second one, hot sports. The technology introduced by BBG Sports to cricket in the 2006 AC series uses two infrared cameras placed on the opposite side of the ground near the side screen. With a clear view of the batsman when the ball hits any equipment of the batsman, it creates localized hit due to friction between the object and the region is then displayed as a white spot on the infrared image. Based on the analysis of the infrared image, the third umpire makes a verdict out or a not out. Next. Okay. This is why next. Okay, ball tracking. Ball tracking by Hawkeye Innovation uses six cameras placed around the ground in specific location to cover the entire trajectory of the ball from the bowler's end to the stop at intervals of every hundred of the microsecond. The ball is identified in the image. Its position from the ground is calculated through a triangulation method, and the images are then synchronized to create a 3D visualization with ball by prediction to be used in the analysis by the umpires and viewers. Close LBW calls are better judged through Hawkeye visualization. The image from the camera are also used to present the ball pitch map and wagon wheel information. Next, this is the image review. We already seen a cricket match, the wicket missing, intake in line, pitching in line, Hawkeye innovation. Okay, next. Okay, making the game more connected and enjoyable. Now, in recent times there is a bird eye view. A spider cam designed by a company called Spider Cam uses cameras that can move in all the three axes, horizontal, vertical, and in the rotary axis. It allows for a bird's eye view of the game and in the angle that were never witnessed through regular broadcasting cameras. The camera is suspended from an array of Kevlar cables operated through motorized winches positioned in four roof corners of the stadium. A spider cam pilot operates the camera through a software and the commands to and fro are communicated to the camera through fiber optic cable attached along with the Kevlar cables. Which spider cam even the normal routine like bowlers run up, batsmen taking guards, fielder aligning to the position, etc. are spied up for the audience viewing and commentary discussion. Next. Okay. This is the bird view eye camera. We see in a figure. Joy root. Okay, next. Okay, flying camera. Drone camera by the company Batcam was used in the ICC Men's World Cup in 2019. These cameras had 360-degree viewing angle was used to capture shots from near ground level to skyline view. The camera was remotely controlled and equipped with the automatic collision avoidance systems. We are showing a figure image. Okay, next. Player and game graphics 3D. 3D graphics and animation have added fun portent to the way data can be analyzed and presented to the audience. There are quite a handful companies that operate in both the analytics and graphics space. 3D players model presented during the game, during break, whatever, and during post-match commentaries provide interesting ways to visualize the skill, tactics, and performance of the players and teams. We have seen a image, the 3D image. Next, power shot analysis. Now this is the latest one. We are already seen in IPL matches and also in a domestic cricket match. Power shot analysis. Power made technology by Spectrum provides real-time feedback on the batting performance, including data on bat speed, impact location, twist, launch angle, and the power behind the every shot. It uses ultra lightweight and ultraviolet to save sensors placed behind the bat to compute the batting metrics using machine learning algorithms, which are then the share a real time for broadcasting. The audience can now understand the science behind the power hitting. Okay, next. Okay, references. Thank you. Any question?
Yeah, presentation is open for the question and answer.
Hello. Hello.
Any questions from the audience? There may not be any questions.
Himanshu sir, no questions in chat box.
Okay, then because we move further for the next participants.
Yeah, please.
Okay. The next participant is Kunjera Meena Prabhubhai, and her research paper title is All-Round Development of Children Through Sports in School. Meena ma'am, can you with us?
Himanshu sir, can we move on the third presentation? Meanwhile, we can contact Meena ma'am.
Okay. Then
Yeah,
we
thank
have
you.
Dr. Dhananjay Yadav and Dr. Hemant Padhyar sir, and his research paper title is Effect of Circuit Training on Selected Physical Variables on Male Wrestling Players. Dhananjay Yadav sir, are you with us?
Yeah, he is joining us.
મારામાં એ કરો મારામાં કરો
લે ભાઈ લે ચાલ રાજુ કાંઈ ગયો પતી ગયો આ પતી ગયો
May I request all the participants to mute yourself?
Yes, sir, please mute yourself.
hello
Yes, sir, please mute yourself.
yeah sorry ma'am sorry
Dhananjay sir, we are ready for your presentation. Please start.
Yes, I am a vision, sir. Can I start my presentation?
Yes, please.
Myself, Dhananjay Yadav, research scholar, Pacific Academy of Higher Education and Research University, Udaipur, and second presenter, Dr. Hemant Pandya, research Pacific Academy of Higher Education and Research University, Udaipur. Today, I am going to just my topic is effect of circuit training on selected physical variables of male wrestling players. Selection of subject to accomplish the purpose of this study, a group of 30 intercollegiate male wrestlers were selected randomly from the different colleges of VNSU, Surat. The age of the selected participant was between 18 to 23 years. Selections of variables and test. Variables स्पीड को मेजर करने के लिए टेस्ट आइटम 50 मीटर डैश टेस्ट और मेजरिंग यूनिट्स 1/100 second stopwatch. एंड सेकंड वेरिएबल्स एजिलिटी, एजिलिटी को मेजर करने का टेस्ट आइटम्स टेकन 10 meters into 4 shuttle run test 1/100 second. And third variables muscular endurance test item is 1 minute sit up test, measuring units total number of sit ups. Training protocol. This is an experimental research with a pre and post test, including a circuit training and a control group. The subjects were assigned into two groups, namely Group A, 15 subject circuit training, and Group B, 15 subject control group. The duration of the circuit training program was 45 minutes per session. 10 resistance exercises were given in the schedule thrice per week. All the subjects were tested prior to and after the 8 weeks of program. Statistical procedures to find the mean difference of pre and post test ANOVA was applied. The level of confidence was set as 0.05 level. Table first, computation of analysis of covariance of speed, agility and muscular endurance. And next, result, speed, agility and muscular endurance obtained. F ratio was of adjusted post-test were 85.59, speed 85.59, agility 18.63 and muscular endurance obtained 57.03. The table value was 4.20 at the 0.5 level of significance for the degree of freedom 127. Therefore, it is proved that circuit training group has been better than the control group. Conclusions. The basis of findings and limitation of the study, the following conclusions were drawn. The speed, agility, and muscular endurance were significantly improved due to the influence of effect of circuit training of inter-college men wrestling players. Circuit training significantly improved the speed, agility, and muscular endurance greater than that of control group of inter-college men wrestling players. Thank you.
Presentation is open for question and answer.
I am audible?
Yes, Hasmukh sir, you're audible.
Okay, okay. Thank you very much. Thank you very much. But a technical problem is there, so I cannot join you. So thank you very much, Dhananjay Yadav, doctor. Very nice presentation. If any problem, you can ask the question. Okay, questions.
Himanshu sir, no any question in the group chat box.
धनंजय जी, आपने इस टॉपिक के लिए कौन सा एक्सपेरिमेंटल डिजाइन यूज किया था और कौन सा स्टैटिस्टिक यूज किया था?
स्टैटिक्स एनालिसिस के लिए ANOVA टेस्ट यूज किया।
ANOVA
sorry sir, sorry, Ankova.
ओके, ठीक है। और एक्सपेरिमेंटल डिजाइन?
Pre and post test.
ओके
Hmm.
ओके
Thank
ओके, थैंक यू धनंजय जी।
Himanshu sir, please unmute yourself first.
Thank you. Thank you, Dhananjay sir.
thank you.
Vikas sir, can I move further?
Yes, 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 yes.
Okay. Uh, we have Kunjira Meena ma'am with us, and her topic is development of children through sports in school. Meena ma'am, you can start your presentation, please.
To sports and school. I am not sharing paper, so I will speak. All-round development of children through sports in
Himanshu, it is not audible. Dr.
Sir, she
Himanshu?
left the meeting due to technical
Yeah.
reason. I think
Oh,
she joined us again.
okay.
We'll give her two minutes.
Okay.
Well, Himanshu Shravan, can we move further? When she will join, we will
Yeah, I
allow her.
think, sir, we have to move forward
Yeah.
and we'll
Okay.
contact her again and we'll take her in the last person, as a last person.
Okay. Okay.
Yeah, Himanshu, sir,
In
take
that
the other
case,
one.
No.
would like to invite Mr. Malav Shah, and his research paper title is "Which exercises are useful for rehabilitation after knee injuries?"
Himanshu,
Yes, sir.
uh, number 8 presentation, Nikunj Hodicha is available.
Okay. Vikas sir and Apu sir will take number 8 presenter first.
Okay, okay. Go
Nikunj
forward.
Holuja sir,
Yeah.
Yes, sir.
and his research paper title is Review on Technological Advancement and Change the Sports.
I am audible, sir?
Yes, you are.
Okay, sir. Thank you. Okay, I am presenting my screen, sir.
Yes, sir, you have to present your screen.
Okay, just a second. Is it visible?
Yes, sir, your screen is visible.
Okay. Hello everyone. Good afternoon. My topic for today's National E-Conference on Advancing Sports Exercise, Science and Pedagogy of Physical Education is review on technological advancement that have changed the sports. Myself, Nikunj Hindocha, I am Assistant Professor in Home Engineering College, Junagadh. Firstly, the sports world today is getting technological by combining natural athletic talent with advanced analytics and artificial intelligence to produce the best possible outcome on the playing field of sports. Modern sports use sophisticated technology to improve the performance. It helps athletes to increase their accuracy and performance. Also, technology has promoted fairness in different sports events. For example, if हम देखें कि सचिन तेंदुलकर को क्रिकेट में काफी बार नॉट आउट होके भी आउट दिया गया, लेकिन that's not thing happen in today's modern era due to the more technologies are available to correct the decision. In the beginning, technology and sports did not always seems like they were a natural pairing. But as we have seen through the years, there is a room for improvement even with our beloved pastime. Regardless of whether it is for ensuring safety, making a great thing even more incredible, or fixing a system that's broken, technological advancement have played a role in performing sports which we love to agonize and analyze over. So here the review on the biggest technological advancement in sports over the last decade. There are so many technological advancements, but here I listed some of the biggest technological advancement. The first one is Hawkeye technology, as one sir told in the previous paper. Just as it sounds, this technology used 6 to 7 high-end cameras situated above the field of play, that is bird eye view, to analyze the flight and trajectory of an object being used in a sports competition. But this technology not only used in cricket, but so many games this technology are being used nowadays. Most commonly used in tennis, cricket, rugby, and volleyball. Hawkeye technology has been in use since 2006. In tennis, firstly, this technology is used and is more accurate than a judge eye. Here are some of the photographs of the Hawkeye technology. This is the schematic layout. First, camera calibration is done, then camera start processing the image, and then ball recognition is done, and then geometry algorithm is being generated from the ball recognition, and that algorithm makes a 3D position of the ball and then track of the ball, and lastly the predicted the flight of the ball that shown in that figure. Up to the white line, that is the actual ball, and the blue line shown in that figure shown the trajectory of the ball that Hawkeye gives us. And this picture are shown taken from the tennis court. There are 6 7 high end cameras are uh, giving the image, and then we make a trajectory and give the correct decision. Benefit of this technology: Hawkeye technology helps to take an error-free decision in cricket, lawn tennis, rugby league, football, and baseball. This technology has reduced the criticism of the players and spectator about the decision of the match referee. By the analyzing the movement of the ball through this technology, the umpire can take an error-free decision quickly when the game is going on. Second, the technology, advanced technology we can use in the sports is HANS device. A vast majority of technological advancement in sports resolve around safety, and the HNS, that is head and neck support device used in motorsport, is one of the most famous. At the time of Dale Earnhardt's death on the track at the Daytona 500 due to the head and neck trauma, Thomas Gibson, Senior Director of Safety Research and Development of NASCAR, claimed that only about 6 drivers were wearing HNS device. But that moment changed the sports as more drivers adopted this technology geared toward the saving their lives in the event of the trajectory crash. So these are the main features of HANS device. The first figure, normal driving straight ahead, impact with HNS device. If the driver has an impact, then if he wear HNS device, then the impact was less. But if it does not wear HNS device, then impact was very bigger. And here are the second figure is for HNS device. Very useful tool in motor sports bike. Details of HNS device: U-shaped device which is placed behind the neck, and its 2 arms are placed over the pectoral musculars of the chest. It is only connected to the helmet by 2 anchors on each side and support by the shoulders. HNS device keeps the head from whipping forward and backward in a crash by also preventing the excessive twisting movement also. Third technology, advanced technology we can use is video technology. Everything is live now, not just on your home TV, but on your smartphone, tablet. In today's sports world, you are never far from live access. We can enjoy the live match स्टेडियम में बैठ के जो हम एंजॉय कर सकते हैं वो आज हम घर पे बैठ के भी एंजॉय कर सकते हैं. But it isn't just access that has adapted to the time, but it is a feature, instant replay, pitch tracker, SGTV sets, DVR. The experience of watching sports has changed dramatically for the better. ग्राउंड पे हम सिर्फ लाइव देख सकते हैं, लेकिन घर पे बैठ के हम रिप्ले देख सकते हैं, बार बार पिच ट्रैक, बॉल की ट्रेजेक्टरी देख सकते हैं, एवरीथिंग वी सीन फ्रॉम होम. And the last one is wearable computers. Another advancement in the world of safety and monitoring. Wearable computers allow for real-time tracking of an athlete health. Since their creation, the incidence of dehydration, heart attacks, and worse have dramatically decreased. When Minnesota Vikings offensive lineman Corey Stringers died of heat stroke during training camp in 2001, companies began to investigate way to monitor health in real time and stave off tragedies like this. Wearable tech has made difference in the lives of many athletes by supervising pulse rate, hydration, temperature through its wireless and microscopic health monitoring system. Here are some figures of wearable computers we can use now. The conclusion of my studies: sports as a special social phenomena has become a modern technology accessory. The world of sports is changing because of technology, as technology plays a large role in daily life. It also plays a large role in changing the body. Thus, technology continues to change the way sports are played, how injuries are treated, what kind of sports are played, and enhance performance outcome. Technological advancement in sports are useful as they offer various benefits, including ensuring the health and safety of players. It is set as well to continue benefiting our favorite sports and team in ways that we previously couldn't think of. Congratulations. Thank you so much. If you have any questions, feel free to ask.
Questions from the chat and co-chat, please.
निकुंज जी, हेलो.
Yes, sir.
हाँ, Nikunj, very nice and effective presentation from your side. But
Thank you so much, sir.
my question is, sometimes in cricket, umpire taking a DRS system.
Yes.
In Hawkeye case, Hawkeye image, ball hitting the stump. But
yes,
main umpire says that it is not out.
Yes.
How it is effective for this situation? Umpire decision is not out. Main umpire decision is not out.
Yes, sir.
In Hawkeye image, ball hitting the stump.
Hitting the stump.
How can it is effective?
Okay, sir. Actually, the rule of ICC is that more than 50% of the ball is have to hit the stump. If not more than 50% of the ball hit the stump, then umpire is to decide if ball is, for example, ball is hitting only 10% to the stump. Then if umpire said no, this is not is enough to ball, then umpire's call is very important. If ball is hitting more than 50% to the stump, then it's definitely out. If umpire also giving not out. So the major concern ICC rule is defined that more than 50% ball is necessary to hit the stump. Then that is also then and also the umpire's decision will be reversed. Otherwise, the umpire's call will be final if the ball is hitting less than 50% to the stump.
Okay. Thank you.
Nikunji, I think you are belong to engineering background.
Yes, sir.
I would like to just have some light on what could be the I would say the factors that affect the hawk eye uh, during using on general method, not on cricket or any tennis.
Sir, as I mentioned in that image, firstly, 6 or 7 cameras are taking the image of that ball, and then image is processing and make one algorithm, and from that algorithm, one 3D image of that ball trajectory is to be make, and then ये ball टच जहाँ पे हुआ है प्लेयर के लेग से, वहां से उस वहां से वो आगे कहाँ तक टच करेगा उसका एक 3D वो प्रिडिक्ट कर रहे हैं हम। वो 100% प्रिडिक्शन नहीं भी हो सकता, लेकिन हम एक प्रिडिक्ट कर रहे हैं। वो जो हमें 6 कैमरास से जो इमेज मिली है, उसके जो अल्गोरिदम हमने क्रिएट किया है, उसकी 3D इमेज बना के हमने प्रिडिक्ट किया कि ये बॉल आगे इस रूट पे जाएगी। एक रूट हम प्रेडिक्ट करते हैं कि ये बॉल की ट्रेजेक्टरी ये है, तो वो इस तरफ इस डायरेक्शन में सर आगे जाएगी।
Okay, and what do you suggest that this technology could be used at the beginning level? What we have seen your presentation is all about the international matches where this technologies are used. What your suggestion about these technologies in using this at the domestic level?
Sir, we are using domestic level. This technology we are using in Ranji Trophy also, and this technology we used not used in very lower level because it is a very expensive technology. So we can't afford in local match. But no doubt it is a very error-free judgment from that technology we can conclude. मैंने पहले ही बोला कि अगर ये टेक्नोलॉजी पहले होती तो सचिन के आज जितने रन है उससे डबल रन होते, क्योंकि काफी बार सचिन तेंदुलकर को नॉट आउट होते हुए आउट दिया गया है। अगर उस वक्त बीआरएस होता तो सचिन तेंदुलकर के और काफी ज्यादा रन हमें देखने को मिलते। तो दिस टेक्नोलॉजी इज डेफिनेटली बेनिफिट, लेकिन आईसीसी का रूल जो हसमुख सर ने कहा है कि वो अंपायर कभी आउट देते हैं, नॉट आउट देते हैं, फिर आउट देते हैं, फिर भी नॉट आउट रहता है। तो वो आईसीसी का रूल जो 50% बॉल हिट करता है तभी आउट होता है, वो थोड़ा आईसीसी का रूल चेंज करना चाहिए। टेक्नोलॉजी में कोई डिसएडवांटेज नहीं है सर।
I would have loved to listen you from the aspect of engineering,
Yes sir,
aspect.
I am completed masters from MS University as well.
It's nice to talk with the alumni. Uh, but I would
From
like to have an
transportation
answer of
engineering, Mr.
sir.
Patel sir was our head.
I would have expecting answer on the engineering aspect, how you can make it more approachable to the general people. It is not all about the when we are talking about the ICC level. It's a BCCI. We are not talking about the BCCI. We are talking also about the other games. ना, if you
Yes,
want to
yes.
generalize the technology that आप उस चीज में कैसे अपने आपके फील्ड का कंट्रीब्यूशन देख रहे हैं?
Actually, sir, I am from civil engineering background, and this all are जो आप टेक्नोलॉजी की बात करें वो लिटिल बिट आईटी इंजीनियरिंग और इलेक्ट्रिकल इंजीनियरिंग पर डिपेंड करता है। तो उसका मुझे बेसिक नॉलेज, बिकॉज आई एम इन अ कंस्ट्रक्शन इंजीनियरिंग लाइन, सिविल इंजीनियरिंग लाइन। सो लेकिन मैं स्वर्णिम गुजरात में स्पोर्ट्स कोऑर्डिनेटर का काम करता हूँ। स्पोर्ट्स मेरी हॉबी है पहले से, स्पोर्ट्स के बारे में लिखना, स्पोर्ट्स के बारे में पढ़ना। So that's why I am publishing this paper. So I am not.
क्वेश्चन पूछ सकते हैं?
Yes sir.
सर टेनिस में हॉकाई का कैलकुलेटेड एरर है 2.6 mm, क्योंकि उसमें क्या लाइन भी मार्क्ड रहती और कैमरा सेटअप गेम से बहुत करीब होता है। तो क्रिकेट में कितने mm का एरर हो सकता है कैलकुलेशन का?
Sorry sir.
Sir, in tennis the error in Hawkeye system is 2.6 mm.
Yes sir.
Okay. So can you tell me what is the calculated error of Hawkeye system in cricket? टेनिस में 2.6 mm का वेरिएशन रहता है उसका एक्चुअल
Yes sir.
डिसीजन में। तो क्रिकेट में कुछ
Yes sir.
आइडिया आपको कितना mm का एरर आता है हॉकाई सिस्टम में?
नहीं सर, मैक्सिमम 2 mm का हम अलाउ कर सकते हैं, अदरवाइज जो स्टंप का है, बिकॉज अब अगर इसमें मैंने बोला कि 50% से ज्यादा बॉल्स लगना चाहिए, तो वो जो डिस्टेंस है वो बहुत कम है। अगर यहाँ पे हम अलाउड करेंगे 3 to 4 mm का एरर, तो डिसीजन पूरा चेंज हो जाएगा। तो क्रिकेट में हम उतना मोर देन 2 mm से ज्यादा हम एरर अलाउड नहीं कर सकते सर।
ओके, थैंक यू। कुछ सब्स्टिट्यूट हो सकता है हॉकाई का, क्योंकि ये अभी पेटेंटेड टेक्नोलॉजी होगी, तो इसको तो अभी सेम टेक्नोलॉजी यूज नहीं कर सकते। कोई अदर एडवांसमेंट हुआ है इसमें कुछ?
नॉट रियली सर, होकाई से अभी एडवांसमेंट है। एलबीडब्ल्यू में हम होकाई ही यूज कर सकते हैं, क्योंकि हमें बॉल आगे कहाँ स्टंप पे लगेगा वो देखना है। लेकिन कॉट बिहाइंड में हम, अगले सर ने बताया, ऐसे हम हॉटस्पॉट यूज करते सकते हैं, स्निकोमीटर यूज कर सकते हैं। लेकिन लेग बिफोर जो विकेट है उसमें अभी होकाई के अलावा और कोई टेक्नोलॉजी हम यूज नहीं कर सकते, क्योंकि वो इमेजिनरी पाथ हमें देना है कि ये बॉल लेग के लग के स्टंप पे टच होती है या नहीं। तो वो इमेजिनरी पाथ हमें बनाना है, इसलिए अभी उसके आगे कोई टेक्नोलॉजी इंप्रूव नहीं हुए सर।
थैंक यू सर।
होनी चाहिए। ओके सर, थैंक यू सो मच।
थैंक यू निकुंज जी, आप हमारे साथ जुड़े हुए हैं, स्वर्णिम गुजरात स्पोर्ट्स यूनिवर्सिटी से जुड़े हुए हैं, और वैसे भी आपका मेन जो फोकस है वो सिविल इंजीनियरिंग है, और हमारा अच्छा सा एक स्टेडियम और अच्छा सा कॉम्प्लेक्स बन रहा है डेसर में, आपका हम जरूर यूज करेंगे। थैंक यू वेरी मच।
श्योर सर, थैंक यू सो मच।
ओके डॉक्टर हिमांशु। हाँ हाँ, ओके हिमांशु, गो अहेड। गुड।
With due permission of Hasmukh sir and Vikas Prajapati sir, we'll have 7 number candidate now. Is ready with us.
Okay.
Is Mr. Amit Rawal and Dr. Nimesh Bhai Chaudhary, and their research paper title is Effect of Pilot on Coordination on School Students.
Okay, proceed.
Mr. Amit Rawal sir. Yes sir, you are audible.
आपका होस्ट नहीं है।
Amit sir, can you hear us?
Oh my God, I will.
It is visible. You can start.
Sorry to interrupt you, Amit Rawal sir. Your voice is not audible.
Amit sir, it's not so clear. Yes sir. Yes, your screen is visible.
ओके सर, अब आप मेरी आवाज आ रही होगी सर?
Yes sir, it's good now. Please proceed.
Okay, sir. Effect of pilots on coordination on school students. Sir, I myself, sir, Amit. Amit, आवाज आ रही है. Okay, okay. बंद नहीं होते कुछ. Yes. Sir, screen दिख रही है, sir?
Not properly.
Not properly.
Yes, yes, it's visible now.
Okay. Sir, effect of pilots on coordination on students. Sir, we travel from Department of Physical Education and Sports Science, Dhaka. Maybe the aim was effect of pilot training on coordination of students. School students 12 to 17 years age from the school of Pedagogy School. Total 60 children were selected as subject for the sample of the present study, which 30 students were included in the pilot training group and 30 students included in the control group. The criteria measurement of coordination through Nelson coordinate test, statistical technique such as analysis of covariation was applied to measure the effect on pilot training group. Mean difference was examined at 0.05 level by using level significant difference analysis of covariation test. It is hereby clear that due to pilot training, significant improvement is seen in the performance or subjects of pilot training group in coordination test with the comparison to the control group. Noteworthy improvement in sync coordination of the subject select through 12-week training. It is hereby clear that due to pilot training, significant improvement is seen in the performance of subject of pilot training group in eye-hand and eye-leg coordination, with comparison to the control group. Noteworthy improvement in seen eye-hand and eye-leg coordination of the subject selected through 12-week training. So the pilot training is just exercise. Pilot is not just a random choice of particular movement. Pilot is a system of physical and mental conditioning that can enhance one's physical strength, flexibility, and coordination, as well as reduce stress, improve mental focus, and foster an improved sense of well-being. Pilot can be for anyone and everyone. Pilot is an exercise system based on yoga principles with Germanic overtones embedded. It is mainly focused on improving endurance and flexibility of the abdomen, lower back, and hips. This exercise developed by the late Joseph Pilates in the 1920s.
Amit, can you move forward to the methodology, please?
Okay, sure. Aims of the study. The aim was effect of pilots on coordination on school students. Select subject, students 12 to 17 years, age from the schools of Ahmedabad City School. Total 16 school children were selected as subject for the sample of the present study, in which 30 students were included in the pilot training group and 30 students were included in the control group. So, यहाँ पे थोड़ी सा टेस्ट की बात की गई सर, पहले ट्रेनिंग में दी, तो उनमें से 30 स्टूडेंट को मैंने कंट्रोल है, 30 स्टूडेंट को मैंने ट्रेनिंग दी हुई है. तो ये कोऑर्डिनेशन टेस्ट के लिए उन्होंने आई हैंड कोऑर्डिनेशन एंड आई लेग कोऑर्डिनेशन, जो नेल्सन कोऑर्डिनेशन टेस्ट है, उनको मैंने अप्लाई किया हुआ है बच्चों पे. सो statistical techniques such analysis of correlation was applied to know the effect on pilot training group. Mean difference was examined at 0.05 hours by using least significant difference analysis of covariance test. So, sir, results of study, yeah, sir, analysis of covariance of mean scores of an eye-hand coordination, experimental group, and control group. They are able to have, sir, analysis of covariance of mean score of a leg coordination, experimental group, and a control group. So, sir, last conclusion. It is hereby clear that due to pilot training, significant improvement is seen in the performance of subject of pilot training group in eye-hand coordination with comparison to the control group. Noteworthy improvement is seen in eye-hand coordination of the subject selected through 12-week training. It is hereby clear that due to pilot training, significant improvement is seen in the performance of subject of pilot training group in eye-leg coordination with comparison to the control group. Noteworthy improvement is seen in eye-leg coordination of the subject selected through 12-week training. Okay, sir. Thank you, sir.
Any questions from the audience?
No any question in chat box, Himanshu sir.
Okay. Hasmukh sir or Vikas sir, if you can ask any question.
Okay, no questions.
With your due permission, can I ask one question?
Yeah, definitely you can ask.
Amit sir, as per my knowledge, pellet training is based on strength training. How is it relevant to the coordination?
Sir, can you please हिंदी में बोलिएगा थोड़ा
जहां तक मुझे नॉलेज है, पिलेट ट्रेनिंग जो है वो बेसिकली अपन स्ट्रेंथ ट्रेनिंग का एक माध्यम के तरीके यूज करते हैं। तो अगर हम उसका कोऑर्डिनेशन में यूज कर रहे हैं किसी भी स्पोर्ट्स के लिए या किन्हीं सब्जेक्ट्स के ऊपर, तो हमारा जो ट्रेनिंग का मेथोडोलॉजी होगा वो कौन से बेसिस पे होगा? इज इट एक्सप्लोसिव और मैक्सिमम स्ट्रेंथ और व्हाटएवर?
सर एक्चुअली स्टैंड है तो कोऑर्डिनेशन तो सर स्टैंडिंग में सर हम लोग कोऑर्डिनेशन सर थोड़ा अच्छा रहेगा। इससे कोऑर्डिनेशन के लिए सर जो ट्रेनिंग देते हैं उसको स्टैंडिंग, जिससे कोऑर्डिनेशन थोड़ा अच्छा है उनका। उसमें पाइप स्टैंडिंग के अंदर स्ट्रेंथ, फ्लेक्सिबिलिटी, ये सब इंप्रूवमेंट होता है उसमें। तो मेरा मानना है तब सर उनका अच्छा ही होता है सर, पायलट ड्यू टू पायलट ट्रेनिंग सर।
सर बता सकते हैं हम कौन सी सेट ऑफ एक्सरसाइजेस यूज कर सकते हैं डेवलपमेंट के लिए?
सर बहुत सारी एक्सरसाइज है, तो सर बहुत सारे एक्सरसाइज है। कैट स्ट्रेचिंग होता है सर, स्विमिंग भी होता है सर, ऐसा होता है एक्सरसाइज का नाम सर, स्ट्रेच होता है वो सब। तो उससे हमारा मतलब कोऑर्डिनेशन डेवलप होता है सर।
ओके सर, थैंक यू।
ओके
तन्वी मैम।
Yes sir.
Can you please tell me who is ready, Meena ma'am or Malo sir, who is ready with us?
Both are ready with us, sir. We can proceed with the Malav Shah.
Okay. Sir, we have fifth number candidate, Mr. Malav Shah, and his research paper title is "Which exercises are useful for rehabilitation after knee injury?" Mr. Malav, you can proceed.
Malav sir, are you with us?
Malav sir, can you hear us?
Can you listen me?
Yes.
Yeah.
You are audible and your
Hello.
presentation also share.
Okay. Okay. Good afternoon, all of you. My subject is which exercise is useful rehabilitation after knee injury. Introduction. Importance of research. The knee slide. The
Tanvi
Can I
ma'am,
speak,
please share
sir?
PPT.
Yeah, sir, it's visible.
Can I speak, sir?
Yes, you can.
Yes, sir, you can.
Okay. The knee is one of the most important organ in the body. It carries all the your body and weight, which is a big job in itself. Not to mention the added work you need put when you decide to walk, run, jump, or skip. It's no my style why knee injury are so common. If you understand how your knee work and the parts within it, you will be able to easier identify the case of your knee pain. The knee is made up of bones, ligaments, tendon and muscles. Ligament join the knee bones and provide stability to the knee. There are four major ligaments in the knee: anterior cruciate ligaments, posterior cruciate ligaments, medium and lateral tendinous ligaments, patellar ligaments, tendons. स्लाइड नहीं वर्क हो रही स्लाइड.
Sir, it is working.
Number next. That okay. There are two major tendons in the knee. Quadriceps tendons contact the quadriceps muscles to the kneecap. Patellar tendons contact the kneecap to the shin bones. Goal: rehabilitation by exercise. Major injuries area: ACL, PCL, LCL, meniscus and hamstrings. Number next, method, scope of method and analysis. Number one, passive knee extension, heel slide, standing calf stretch, hamstring stretch on wall, straight leg rise, pon hip extension, calm exercise, wall squat with a ball, step up, knee stabilization, uh, resistant terminal knee extension, wooden ball exercise. There are exercise ACL injuries rehabilitation exercise. Number next, MTR rehabilitation exercise, or number next, mandibular rehabilitation exercise, wooden ball exercise, and total results: improve stabilization, less pain over knee, good strengthening, easy to move and direction, improve confidence and during running and other activity. Number next, conclusion. I got good result for his this research, and I did get good experience of this research. This research is helping me when some people are suffering from above injury. Their these exercises are very easy to learn. No need to more space, you can do in small areas, and no need to high expensive equipment. So this exercise gave good result to us, and we took help from other researchers while researching, and they have guided to me. Those we were my subject, they got rehabilitation and good result for this exercise. Thank you.
Dr. Himanshu, any questions?
Sir, not so far.
Yeah.
Tanvi ma'am, did you get any question?
No, sir. No any question.
Any questions from the?
Sir, I have. Yes, sir, I have one.
Okay. Proceed.
Who is
Yes, Nikun sir, you can ask the question.
There is a in injury type there is ACL, MCL. I can't get that word. What is the full form of ACL, MCL? Sir?
Excuse me, sir.
In the types of knee injury, I only
Anterior
understand
cruciate
hamstring.
ligament.
Okay.
Yes. ACL, एंटीरियर क्रूशियल लिगामेंट्स, जो नीचे अंदर आता है वो
ओके सर।
थाई बॉन्स के नीचे और सीन बॉन्स के ऊपर के जो जॉइंट्स है, नी जॉइंट्स, उसमें आते हैं।
Okay, Malav.
PCL means posterior crucial. Yes.
Yeah, Malav. With step up exercise.
Yes,
yeah, Malav, hear me? Hello, Malav.
What? Step up. Yes.
You
yes.
Can you hear me?
Yes. Yes.
Okay. With step up exercise, how can we rehabilitate our muscles, knee muscles, with step up exercise?
Knee muscles. Okay. मैं आपको प्रोसीजर पहले बताता हूँ. स्टैंड विद द फुट ऑफ योर इंजर्ड लेग. जो आपका इंजर्ड लेग है, आपको स्टॉप करना है. सपोर्ट 3 to 5 inches high like small step block of wood and keep your other foot flat on the floor. हमारा floor. Shift your weight onto the injured leg on the supports. Strengthen your injured legs and the other legs come off floor. Return to the starting position by bending your injured leg and slow lowering your injuries. Leg back to 4. ये आप हम 2 या 3 बार करेंगे रिपीटेशन, तो इंजरीज रिहेबिलिटेशन होंगी.
Okay, thank you. Dr. Vikas Prajapati, have you any questions?
No, sir. Thank you. Thank you, sir.
Okay.
Thank you, Malav.
Okay. Okay, thank you, Malav.
Okay, thank you.
Dr.
Okay,
Dr. Himanshu. Dr. Himanshu.
For the kind information of Hasmukh sir and Dr. Vikas Prajapati sir,
Yeah.
we'll skip number 1 and number 6 candidates. So we have the last candidate in our list, and she is Ina.
Yeah.
And her topic is all-round development of children through sports in school.
Yeah.
Meena
Okay,
ma'am,
okay, proceed. Okay, okay.
Hello, namaskar sir. Good afternoon sir. Hello.
Himanshu sir, I think Meena ma'am is not with us.
Okay.
Yes, Kamlesh Parmar sir.
Madam. Good afternoon, madam.
Good afternoon, sir.
My name is Kamlesh Parmar, PhD scholar, Gujarat Vishnu Ahmedabad. My topic is sport management. Hello. Hello.
Yes, sir. Sir, your station is all going to start in a few minutes. We are just concluding second session first. Then we'll call you for the pure presentation. Kamlesh Parmar, sir.
Yes, madam.
Your track is going to start in a few minutes, so wait for the while. We are concluding our second session first.
કમલેશભાઈ તમારો કમલેશભાઈ અવાજ આવે છે?
Speak in Gujarati. Dr.
તમારું
Himanshu,
તમારું
please speak
તમારું
in
તમારું
Gujarati.
આ સેશન પછી તમારું પેપર છે. આ સેશનમાં તમારું નામ નથી. 5-10 મિનિટ પછી જે નવું સેશન ચાલુ થશે ને એમાં તમારું નામ છે.
Okay, okay, okay. Thank you.
Please,
Okay. So with this note, at the end of the session, I would like to request Dr. Hasmukh Patel sir and Dr. Vikas Prajapati sir to give special comments and summarize the session.
Okay. Dr. Vikas Prajapati.
Yes, sir.
Is your special comment on this paper presentation?
Thank you very much, sir.
Yeah.
With the permission of Chair Adanya Hasmukh sir, I would like to conclude the session with a summary. First presentation was about the advanced technology used in cricket for 21st century, presented by the Desai Rutesh ji. It was all about the technology use and how technology changes the decision making and making all the game enjoyable for the viewers also. A good presentation by the Dr. Rupesh Desai. Next presentation was all about the circuit trading effect on selected physical variable, presented by Dhananjay Yadav and Dr. Hemant Pandya, where he just summarized the circuit training effect on some of the physical variable like speed and agility. Where the next presenter, Shri Nikunj Indo Chaji, has presented good review of technical advancement, including the Hawkeye, including the NASEN used device, and trying to explain how this technology could help the sports and the sportsmen for a betterment of their involvement, as well as for their improvement in their performance. Amit Rawal and Dr. Nimesh Bhai has presented the paper on effect of pilots on coordination in school students, which has with some limitations of the pilots. He has presented. He has come to conclusion of improvement in coordination ability of school students. And the last, Mr. Malo Shah has explained some of the rehabilitation exercises for the knee injuries. Just a brief explanation of exercises for rehabilitation of various knee injuries. So basically, this session was all about the technology advancement, as well as these two experimental research of circuit training and pillars training. थैंक यू डॉक्टर हसमुख सर, आदरणीय हसमुख सर, आपનો ખૂબ ખૂબ આભાર. આપ સેશન ચેર કર્યું. ડોક્ટર હિમાંશુ દવે, થેન્ક્સ ફોર કોઓર્ડિનેટિંગ વિથ ધી team. Dr. Tanvi ma'am, thank you very much. Over to you, Hasmukh sir.
Okay, thank you very much, Dr. Vikas Prajapati sir, who is a co-chairperson of this session, and moderator Dr. Himanshu Dave, and very well coordinate Tanvi Tarparaji. Thank you very much. And also thank you very much to Sarvajanik Education Society and Principal Ma'am, Dr. Martina, Sir KP Commerce College, Surat, and huge thank you to Dr. Jignesh Tandel, who can organize very nice and tremendous program for this national level seminar. Very nice, Dr. Jignesh Tandel. And here I am seeing fourth member, that is Tanvi Tarpara, Dr. Himanshu, Dr. Jignesh Kandel, and Ichapuria ma'am. All are our alumni, all are very genius and very well organized this program. Thank you very much, and I am very proud of you people. Very nice. Thank you very much. Thank you all.
Thank you very much, Vikas
Thank you,
Prajapati sir
Hasmukh sir.
and Hasmukh sir, for your kind and generous words. With this note, on behalf of Sarvajanik Education Society, the KP Commerce College, Surat, would like to thank you, both the chair and their would like to thank Ravi ma'am for your kind support and Dr. Patel sir for your kind help and support. I'd like to thank all the participants for their too as well. Thank you very much. Have a nice day ahead. Over to Ravi ma'am.
Yes, sir. Thank you so much, Hasmukh sir and Prajapati sir.
Thank you. Thank you very much.
We are today here just because of you. Yes, sir, you well said. We are your best alumni, and we feel definitely proud of you. Now, let's begin our third track. I would like to hand over the platform to our third track moderator, Dr. Amit Patel. Over to you, Dr. Amit Patel.
Thank you, Dr. Ma'am. Himanshu sir, Hasmukh sir, Vikas sir. Welcome you all to the third session of today, track 3. In this session, Dr. Bhavesh Devta will be the chair and Dr. Jaimal Nayak will be the co-chair. I would like to introduce chair and co-chair. Dr. Bhavesh Devta, Associate Professor of Physical Education at V.S. Patel College, Billimora. He has to his credit BPEd, MPEd gold medalist, MPhil and PhD. He has participated in many national, state and university games. He has published more than 20 papers present in national and international seminar or conference. Second, Dr. Jaimal Nayak, Assistant Professor of Physical Education at MRD Arts and ELK Commerce College, Chikli. He is member of the Board of Sports at Green Urban South Gujarat University from last 2 years. He is also a coordinator of Dr. Baba Saheb Ambedkar Open University from last 10 years. He has published a total 11 papers in national and international journals, and he has also presented a total of 18 papers in national and international seminars or conference. Thank you. Total 8 papers in this track, and I am go for our chair and co-chair. Please proceed. Over to you, sir. Dr. Bhavesh Devta and Dr. Jaimal Nayak.
Thank you, Amit. Heartily thank you. Hello.
Bhavesh sir, we are not hearing you.
Hello. May I audible?
Yes, sir.
Yes, sir. Now you are audible.
Thank you, Amit.
Yes, sir.
I and Jaimal like to thanks organizing committee, especially thanks to Dr. Jignesh and his team. Firstly, मैं बोल रहा हूँ कि अभी स्टार्ट ही करते बाद में टाइम भी हो चुका है और मेरे फर्स्ट पेपर स्टार्ट करने का परमिशन देता हूँ अमित. अभी आप स्टार्ट करो फर्स्ट पेपर.
I would like to Nilesh Kumar U. Patel. Nilesh Kumar.
हाँ सर. ગુડ આફ્ટરનૂન એવરીવન. મારું જે ટાઇટલ છે ગુજરાત વિદ્યાપીઠમાં સ્નાતક કક્ષાએ અભ્યાસ કરતી સૂક્ષ્મ જીવાણુ વિજ્ઞાન અને શારીરિક શિક્ષણ પ્રવાહની બહેનોનો યોગ પ્રત્યેના વલણનો અભ્યાસ. આ અભ્યાસનો હેતુ ગુજરાત વિદ્યાપીઠમાં સ્નાતક કક્ષાએ અભ્યાસ કરતી સૂક્ષ્મ જીવાણુ વિજ્ઞાન અને શારીરિક શિક્ષણ પ્રવાહની બહેનોનો યોગ પ્રત્યેના વલણનો અભ્યાસ કરવાનો હતો. આ સંશોધન અભ્યાસમાં ગુજરાત વિદ્યાપીઠમાં સ્નાતક કક્ષાએ અભ્યાસ કરતી સૂક્ષ્મ જીવાણુ વિજ્ઞાન અને શારીરિક શિક્ષણ પ્રવાહની બહેનોનો વિષય પાત્ર તરીકે
પસંદ કરવામાં આવી હતી. આ સંશોધન અભ્યાસમાં ગુજરાત વિદ્યાપીઠમાં સ્નાતક કક્ષાએ અભ્યાસ કરતી સૂક્ષ્મ જીવન વિજ્ઞાન પ્રવાહની 30 બહેનો અને શારીરિક શિક્ષણ પ્રવાહની 30 બહેનોને વિષય પાત્રો તરીકે પસંદ કરવામાં આવી હતી, જેમની ઉંમર 17 થી 22 વર્ષ વય જૂથ પસંદ કરવામાં આવી હતી. આ સંશોધનમાં કુલ 7 બહેનોને રેન્ડમ તરીકે પસંદ કરી 2 જૂથની રચના કરવામાં આવી હતી, જેમાં યોગ પ્રત્યેના વલણનો અભ્યાસ ડોક્ટર મહેશ મુછાલ પ્રશ્નાવલીને માપન ધોરણ તરીકે પસંદ કરી આંકડાઓનું એકત્રીકરણ કરી બંને જૂથો વચ્ચે ટી ટેસ્ટ લાગુ પાડી 0.05 કક્ષાએ સાર્થક તપાસતા બંને ગ્રુપ વચ્ચે સાર્થક તફાવત માલુમ પડતો ન હતો. થેન્ક યુ સર.
Any question?
Tanvi,
Bhavesh
any
sir,
question?
નહીં સર, ચેટ બોક્સમાં કોઈ પણ ક્વેશ્ચન મને મળ્યા નથી. આપ આપના ડેસ્ક પરથી ક્વેશ્ચન પૂછી શકો છો.
નિલય, તમે કઈ ગર્લ્સ કઈ તમારી ક્યાંથી લીધી? છોકરીઓ ક્યાંની હતી બધી?
સિટીમાંથી સાદરા કેમ્પસની બહેનો હતી અને બીજા કેમ્પસની સાયન્સની બહેનો હતી.
તમારું ક્વેશ્ચનરી કઈ હતી? ક્વેશ્ચનરી છે તમારી?
મહેશ મુછાલ.
કઈ? માઇક મોસાલ?
મહેશ મુછાલની ક્વેશ્ચનરી હતી મારી. મહેશ મુછાલ.
ઓકે 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 ઓકે. જયમલ,
હા નિલય, હવે તમારું જે પેપર છે, તમે રિસર્ચ સ્કોલર છો?
હા.
રિસર્ચ સ્કોલર છો તમે?
હા સર.
હેલો. હા, તો તમારું જે પ્રેઝન્ટેશન છે એ ખૂબ જ, એટલે પેપર બહુ નાનું હોય એવું લાગે છે. આઈ થિંક તમારું એક જ મિનિટમાં પેપર પૂરું થઈ ગયું. બરાબર છે. હવે પેપર તમારી સ્લાઇડ પણ નથી એટલે ખ્યાલ નથી આવતો, પણ તમારે છે ને તેને વેરિયેબલમાં ડિવાઈડ કરવા જોઈએ. ત્યાર પછી એના અભ્યાસના તમારા હેતુઓ, મહત્વ, આ બધું પણ તમારે પેપરમાં પ્રેઝન્ટ કરવું જોઈએ. અને છેલ્લે કન્ક્લુઝન તમે પાછું એકવાર આપશો? કન્ક્લુઝન
બંને ગ્રુપ
તમે
વચ્ચે
અભ્યાસ
સાર્થક
કર્યો
તફાવત જોવા મળ્યો ન હતો.
હા, એટલે બંને યોગ પ્રત્યે સેમ જ છે એવું તમે માનો છો વલણોમાં?
હા.
ફિઝિકલ એજ્યુકેશન અને સાયન્સ ના સ્ટુડન્ટ બંનેના, બરાબર છે?
હા, બંનેનો.
અને કેટલા ક્વેશ્ચન હતા? તમે જે મુંજાલની જે ઓથેન્ટિક છે ક્વેશ્ચનરી, એનું તમે કઈ પાયલોટ સ્ટડી જેવું કઈ કરેલું પેલા?
ના ના, હજુ પીએચડી માં અમારું ફર્સ્ટ સેમેસ્ટર છે, જસ્ટ એડમિશન થયું છે. સો
ઓકે ઓકે. પણ છે કોઈ પણ તમે ક્વેશ્ચનરી લાવ તો એની ઓથેન્ટિસિટી પહેલા આપણે ચેક કરવાની. અને એમ તો આ લેખક જે છે મુંજાલ, એ પ્રતિષ્ઠિત, તમે ક્યાંથી આ સિલેક્ટ કરી છે ક્વેશ્ચનરી?
સર પરથી લીધી હતી, જે અમારા ત્યાં પ્રોફેસરો હતા ત્યાં તેમના પરથી લીધી હતી.
ઓકે, વેરી ગુડ. કઈ વાંધો નહીં, તમારો પ્રયત્ન ખૂબ જ સારો છે. પણ આપણું જે પ્રેઝન્ટેશન છે એ ઓછામાં ઓછી 6 મિનિટનું હોવું જોઈએ. 6 મિનિટનું હોવું જોઈએ. એટલે તમે જે પેપર બનાવેલું છે એમાં તમારે પ્રસ્તાવના થોડી મૂકવાની હોય, ત્યાર પછી એના હેતુઓ હોય, ઉત્કલ્પના જો રાખેલી હોય તો એ હોય.
મૂકી જ છે, પણ મેં સર એબ્સ્ટ્રેક્ટ જ ખાલી વાંચ્યું છે એટલે.
માત્ર એબ્સ્ટ્રેક્ટ જ વાંચ્યું છે, પણ એબ્સ્ટ્રેક્ટ ના ચાલે. પેપરમાં તમારે આખું પહેલા એબ્સ્ટ્રેક્ટ વાંચ્યું, પણ પછીથી તમારે એનું મહત્વ, હેતુઓ, પછી તમે જે સ્ટેપ તમે જે લીધા છે એ બધા જ એમાં આપણે પેપરમાં
આપી દો પાછું સર.
બરાબર ને?
એ રજૂ કરી દો પાછું.
નથી.
ઓકે ઓકે ઓકે
તમારો
ઓકે
પ્રયત્ન સારો છે, તમે સ્કોલર છો,
હા
એટલે અમારા તરફથી તમને એક છે ને તે
હા
પાછળ
હા
તમે
સર
જયારે કશે પ્રેઝન્ટ કરો બીજી
હા ઓકે
જગ્યાએ, ત્યારે તમારે 6 મિનિટમાં તમારે આ બધું અંદર કરવાનું હોય, છેલ્લે તમારે કન્ક્લુઝન આપવાનું હોય. બરાબર છે? ઓકે, થેન્ક યુ. ગુડ.
ઓકે, થેન્ક યુ. આઈ હોપ કે નેક્સ્ટ જેટલા પણ પાર્ટી છે તેમને સમજ આવી ગયો
ગો
હશે
ફર્ધર.
કે આપણે પ્રેઝન્ટેશન કેવી રીતના કરવાનું છે. તો આપણે આગળ વધીએ. સિરિયલ નંબર 3 છે મૌલિક ત્રિભુવનદાસ પટેલ. મૌલિક ત્રિભુવનદાસ પટેલ.
ગુડ આફ્ટરનૂન સર.
હેલો મૌલિક.
હેલો સર.
ઓકે
અવાજ આવે છે
ઓકે
સર?
ઓકે આવે છે આવે છે.
ગુડ આફ્ટરનૂન સર.
તમે તમારું પ્રેઝન્ટેશન સ્ટાર્ટ કરી શકો.
ઓકે, થેન્ક યુ સર. સર, માય નેમ ઇઝ મૌલિક પટેલ, PhD scholar, Gujarat University. My guide name Dr. C.C. Chavda, Associate Professor, R. Bhavans College, Ahmedabad. My topic: સૌરાષ્ટ્ર યુનિવર્સિટી ના રાજકોટ શહેરના શારીરિક શિક્ષણના વિદ્યાર્થી અને વિજ્ઞાન પ્રવાહના વિદ્યાર્થીઓનો માનસિક સ્વાસ્થ્યનો અભ્યાસ, તુલનાત્મક અભ્યાસ. અભ્યાસનો હેતુ: સૌરાષ્ટ્ર યુનિવર્સિટીના રાજકોટ શહેરના શારીરિક શિક્ષણના વિદ્યાર્થી અને વિજ્ઞાન પ્રવાહ વિદ્યાર્થીઓનો ભાઈઓ વચ્ચે માનસિક સ્વાસ્થ્યનો તુલનાત્મક અભ્યાસ કરવાનો હેતુ. વિષય પાત્રોની પસંદગી: આ સંશોધન અભ્યાસમાં સૌરાષ્ટ્ર યુનિવર્સિટીના રાજકોટ શહેરના શારીરિક શિક્ષણના 50 વિદ્યાર્થીઓ અને વિજ્ઞાન પ્રવાહના 50 વિદ્યાર્થીઓ, એમ કુલ 100 વિદ્યાર્થીઓ ભાઈઓને વિષય પાત્રો તરીકે પસંદ કરવામાં આવ્યા હતા. આ સંશોધન અભ્યાસમાં 17 થી 25 વર્ષના વય જૂથના વિદ્યાર્થી ભાઈઓને વિષય પાત્રો તરીકે પસંદ કરવામાં આવ્યા હતા. માપનના ધોરણો: માનસિક સ્વાસ્થ્યની કસોટી કસોટી માટે ડીડી જી ભટ્ટ અને જીઆર ગ્રેડાની પ્રશ્નાવલીના માપનના ધોરણો પસંદ કરવામાં આવ્યા હતા. આંકડાકીય પ્રક્રિયા: ખેલાડી અને બિન ખેલાડી જૂથના પ્રાપ્ત કરેલ માહિતી પર ટી-ટેસ્ટ લાગુ કરી મધ્યકો વચ્ચેનો તફાવત 0.05 કક્ષાએ સાર્થકતા ચકાસવામાં આવી હતી. અભ્યાસના પરિણામો: સારણી 1 પરથી માલુમ પડે છે કે કોટક સાયન્સ કોલેજના ભાઈઓનો માનસિક સ્વાસ્થ્યનો અભ્યાસનો મધ્યક 25.80, જ્યારે શારીરિક શિક્ષણ ભવનના ભાઈઓનો માનસિક સ્વાસ્થ્યનો મધ્યક 26.320 જોવા મળ્યો હતો. કોટક સાયન્સ કોલેજના ભાઈઓનું પ્રમાણિત વિચલન 5.431 અને શારીરિક શિક્ષણ ભવનના ભાઈઓનું પ્રમાણિત વિચલન 4.955 જોવા મળ્યું હતું, જ્યારે તફાવત 0.5 જોવા મળ્યો હતો. જ્યારે ટી રેશિયો 0.598 જોવા મળ્યો હતો, જે 0.05 કક્ષાએ બરાબર 1.98 તથા બંને જૂથો વચ્ચે સાર્થકતા તફાવત માલુમ પડ્યો ન હતો. તારણ: કોટક સાયન્સ કોલેજના ભાઈઓ અને શારીરિક શિક્ષણ ભાઈઓ વચ્ચે માનસિક સ્વાસ્થ્ય સાર્થકતા તફાવત જોવા ન મળ્યો હતો. થેન્ક યુ સર.
Maulik. Any questions?
Presentation is open. Any question?
ચેટ બોક્સમાં છે કોઈ પ્રશ્ન?
No any questions in chat box.
મૌલિકભાઈ, તમારે ક્વેશ્ચનરી તમે બનાવી છે, તમે છે કોમ્પ્યુટરમાં તમારે ક્વેશ્ચનરી?
હા સર, છે.
તો
સર, હું હાલ કોમ્પ્યુટર યુઝ નથી કરતો, હું ઓન ધ વે છું, ગાડીમાં છું, ઓન હાઈવે છું.
જયમલ, પૂછવું છે કઈ તમારે? જયમલ સાહેબ, ડોક્ટર જયમલ.
ટેકનિકલ ઇસ્યુ આવે છે સર જયમલ સર ને. આપણે નેક્સ્ટ પર જઈએ સર.
હા જાઓ.
થેન્ક યુ સર.
ઓકે, થેન્ક યુ મૌલિકભાઈ.
થેન્ક યુ સર.
નેક્સ્ટ પાર્ટિસિપન્ટ છે બ્રિજેશ એસ પ્રજાપતિ એન્ડ ડોક્ટર રમેશ જે ચૌધરી. એમનો ટાઇટલ છે મનોરંજન માટે રમતો અને સૂર્ય નમસ્કારની તાલીમ દ્વારા બહેનોની ઝડપ પર થતી અસરોનો અભ્યાસ. બ્રિજેશભાઈ.
યસ સર.
ઓકે, તમારું પ્રેઝન્ટેશન સ્ટાર્ટ કરી શકો છો બ્રિજેશભાઈ.
ઓકે સર થેન્ક યુ.
હા
ગુડ
મૌલિકભાઈ,
આફ્ટરનૂન સર.
તમે કેટલા વિદ્યાર્થી પસંદ કર્યા હતા? હા આઈ એમ ઓડિબલ.
50 વિદ્યાર્થી પસંદ કર્યા છે જયમલ. બ્રિજેશ 2 મિનિટ. બ્રિજેશ હમણાં તો ઉપર બ્રિજેશ. હા મૌલિક, તમને જયમલ સાહેબ પ્રશ્ન પૂછીને કેટલા વિદ્યાર્થી તમે 50 વિદ્યાર્થી લીધેલા? કેટલા
50 વિદ્યાર્થી સર.
જયમલ.
હેલો જયમલ સર, સંભળાય છે તમને? હેલો. ભાવેશ સર.
હા
સર આપણે નેક્સ્ટ સ્ટાર્ટ કરીએ કે ટેકનિકલ ઇશ્યુ આવે છે સર?
હા તો
જયમલ સર
આપણે છેલ્લે મૌલિકભાઈ તમે જતા નહીં, તમારે રહેજો છેક સુધી. હવે તમને ફરી ક્વેશ્ચન પૂછીશું જ્યારે નેટ આવશે ત્યારે જયમલભાઈ.
ઓકે સર.
બ્રિજેશ સર તમે સ્ટાર્ટ કરી શકો.
ઓકે સર, થેન્ક યુ.
ઓકે.
ગુડ આફ્ટરનૂન સર. મારું નામ બ્રિજેશ પ્રજાપતિ છે અને મારું ટાઇટલ છે મનોરંજનાત્મક રમતો અને સૂર્ય નમસ્કારની તાલીમ દ્વારા બહેનોની ઝડપ ઉપર થતી અસરોનો અભ્યાસ. આ સંસ્થાનો અભ્યાસનો હેતુ મનોરંજનાત્મક રમતો અને સૂર્ય નમસ્કારની તાલીમ દ્વારા બહેનોની ઝડપ ઉપર થતી અસરોનો અભ્યાસ કરવાનો હતો. અને આ સંસ્થાના અભ્યાસમાં ગુજરાત યુનિવર્સિટીની માન્યતા ધરાવતી ઇન્ડિયા કેબીસી એજ્યુકેશન ટ્રસ્ટની વિવિધ કોલેજોની બહેનોને વિષય પાત્રો તરીકે પસંદ કરવામાં આવી હતી. આ સંશોધન અભ્યાસમાં 18 થી 25 વર્ષની વય જૂથની બહેનોને વિષય પાત્રો તરીકે પસંદ કરવામાં આવી હતી. માપનના ધોરણોમાં ઝડપનું માપન 50 સ્વરના દોડ દ્વારા કરવામાં આવ્યું હતું અને મનોરંજનાત્મક
હવે તમે એ વિદ્યાર્થીઓ હેલો આઈ એમ ઓડિબલ.
બરાબર સંભળાતું નથી બ્રિજેશભાઈ. બરાબર સંભળાતું નથી બ્રિજેશ.
ઓકે સર.
બ્રિજેશભાઈ માઇક થોડો નજીક રાખો.
યસ સર. મૌલિક નથી, હું બ્રિજેશ છું સર.
હા બ્રિજેશ સંભળાતું નથી બરાબર. તમે માઇક હાથમાં રાખીને બોલો તો સંભળાશે.
હા.
ઓકે.
હા હવે એ પ્રમાણે બોલો.
ઓકે. માપનના ધોરણોમાં ઝડપનું માપન 50 સ્વર દોડ દ્વારા કરવામાં આવ્યું હતું. મનોરંજનાત્મક રમતો અને સૂર્ય નમસ્કારની જૂથ ઉપર થતી અસરો જાણવા એક માર્ગીય વિચરણ સહવિચરણ પૃથ્થકરણ વન વે એનાલિસિસ ઓફ કોઓર્ડિનેટ કસોટી લાગુ પાડી મધ્યકો વચ્ચેના તફાવતને લીસ્ટ સિગ્નિફાઈંગ ડિફરન્સ પોસ્ટ હોક કસોટી દ્વારા 0.05 કક્ષાએ સાર્થક ચકાસવામાં આવ્યા હતા. જેનું તારણ આ પ્રમાણે જોવા મળ્યું હતું. પદ્ધતિસરના 12 અઠવાડિયાના મનોરંજનાત્મક રમતો અને સૂર્ય નમસ્કારની તાલીમ કાર્યક્રમની પસંદ તથા વિષય પાત્રોની ઝડપમાં નોંધપાત્ર સુધારો જોવા મળ્યો હતો. પ્રસ્તાવના. પ્રાચીન કાળથી આદિમાનવ પોતાના જીવનની જરૂરિયાતો પૂરી કરવા માટે દોડવું, કૂદવું, ફેંકવું, ઝીલવું, ચડવું, હસવું, રડવું, ફટકો મારવો, બાથમ કરી પોતાનું ચડિયાતું બતાવવું વગેરે પ્રવૃત્તિઓમાં પ્રવૃત્ત રહેતો. પ્રાચીન યુગમાં જીવનની જરૂરિયાતોને પહોંચી વળવાની માનવીની એકવિધ પ્રવૃત્તિઓમાંથી આ પ્રવૃત્તિઓ મોટે ભાગે સંતોષથી માનવીની રમતો કરતા સાધન કૌશલ્યને યુક્તિ પ્રયુક્તિ દ્રષ્ટિએ ઘણી જ વિકાસ પામી છે. આથી વિકસિત રમતો માટે ઉપયોગી અપેક્ષિત કૌશલ્ય હસ્તગત કરવા માટે સાદી મોટી રીલે સાધન વ્યાયામ જેવી સરળ રમતો તથા પ્રવૃત્તિઓ ઘણી જ ઉપયોગી છે. રમત એ પ્રાણી માત્રની સ્વાભાવિક પ્રવૃત્તિ છે. નાના મોટા દરેક બાળકને રમત પ્રત્યે સ્વાભાવિક પ્રેમ હોય છે. શાળામાં નાની રીલે વિશેષ નજર કરીશું તો બાળકો સ્તરની અનુકૂળતા પ્રમાણે જુદા જુદા સમૂહમાં અનેકવિધ રમત પ્રવૃત્તિઓમાં મગ્ન માલુમ પડે છે. રજાના દિવસોમાં રસ્તાઓ ઉપર કે પોતાની સાંકડી ગલીઓમાં મેદાનો ઉપર બાળકો રમતા જોવા મળે છે. બાળકોને રમવા માટે કહેવું પડતું નથી કે તેમને રમત શીખવાડવાની જરૂર પડતી નથી, પણ રમત બાળકની સ્વાભાવિક પ્રવૃત્તિ છે. માનવ માત્ર જ નહીં પરંતુ નીચલી કોટીના પ્રાણીઓ પણ દોડા કૂદવા અને પૂછો પકડવાની પ્રવૃત્તિઓ કરતા માલુમ પડે છે. નાના મોટા ઉકલિયા તથા બિલાડીના બચ્ચા એકબીજા સાથે બાથમબાથી અને દોડાદોડી કરે છે. વાંદરા બચ્ચા કુદાકૂદ કરે છે. આ બધામાંથી સજીવ પ્રાણીઓ પોતાની સ્વાભાવિક પ્રવૃત્તિઓને સંતોષે છે. અભ્યાસનો હેતુ આ સંશોધન અભ્યાસનો હેતુ મનોરંજનાત્મક રમતો અને સૂર્ય નમસ્કારની તાલીમ દ્વારા બહેનોની ઝડપ ઉપર થતી અસરોનો અભ્યાસ કરવાનો હતો. વિષય પત્રોની પસંદગી. આ સંશોધનમાં ગુજરાત યુનિવર્સિટીની માન્યતા ધરાવતી ઉમિયા કેવીસી એજ્યુકેશન ટ્રસ્ટની વિવિધ કોલેજોમાંથી બહેનોને વિષય પાત્રો તરીકે પસંદ કરવામાં આવી હતી. આ સંશોધન અભ્યાસમાં 18 થી 25 વર્ષની વય જૂથની બહેનોને વિષય પાત્રો તરીકે પસંદ કરવામાં આવી હતી. માપનના ધોરણોમાં ઝડપ 50 વાર દોડ છે અને સેકન્ડમાં એને માપેલી છે. હવે અભ્યાસના પરિણામો. સાણિકમાં પૂર્વ કસોટી એફ રેશિયો 2.659 જોવા મળેલો હતો, જેનું ટેબલ વેલ્યુ સાથે સરખાવતા 0.05 કક્ષાએ સાર્થક થયેલો જોવા મળ્યો ન હતો અને અંતિમ કસોટીનો એફ રેશિયો 12.744 જોવા મળેલો હતો, જેને ટેબલ વેલ્યુ સાથે સરખાવતા 0.05 કક્ષાએ સાર્થક થયેલો જોવા મળ્યો હતો. તેની આપવામાં આવેલ તાલીમની વિશિષ્ટ પાત્રોના દેખાવમાં સાર્થક કક્ષાએ સુધારો થયેલો સાબિત થાય છે. ઉપરાંત સુધારેલા મધ્યકનો એફ રેશિયો 11.326 જોવા મળેલ હતો, જેની ટેબલ વેલ્યુ સાથે સરખાવતા 0.05 કક્ષાએ સાર્થક થયેલો જોવા મળ્યો હતો. સાણી ટુમાં સૂર્ય નમસ્કાર જૂથ ખૂબ જ સાર્થક 1.06 કક્ષાએ સુધારો જોવા મળ્યો હતો. ત્યારબાદ મનોરંજનાત્મક રમતોનું જૂથ એમાં 0.44 કક્ષાએ સુધારો દર્શાવેલો છે અને મનોરંજક રમતો જૂથ અને સૂર્ય નમસ્કારની જૂથ પ્રાયોગિક માનવમાં મનોરંજનાત્મક જૂથને આપવામાં આવેલ તાલીમની વધુ સાર્થક અસર જોવા મળી હતી. નિયંત્રણ જૂથની સરખામણીમાં બંને પ્રાયોગિક જૂથો મનોરંજનાત્મક રમતો જૂથ અને સૂર્ય નમસ્કાર જૂથમાં પ્રાયોગિક માવજતની સાર્થક અસર જોવા મળી હતી. કારણ પ્રતિસાદના 12 અઠવાડિયાના મનોરંજનાત્મક રમતોના તાલીમ અને સૂર્ય નમસ્કારની તાલીમની કાર્યક્રમથી પસંદ થતા વિષય પાત્રોની ઝડપમાં નોંધપાત્ર સુધારો જોવા મળ્યો હતો. થેન્ક યુ સર.
Any question? Any question to ask audience?
No questions, sir, in chat box.
Okay. British.
Yes, sir.
બ્રિજેશ, મનોરંજનાત્મક જે રમતો હતી તે ફિક્સ કરેલી હતી કઈ કઈ છે?
હા સર, મુકુલ શાહ કરણસિંહ ગોહિલ સાહેબની મેં 4 બુકો મંગાવેલી હતી. એમાંથી નૈસર્ગિક રમતો હતી, અભિનય રમતો હતી, સાતતાળી રમતો હતી, તળપદી રમતો હતી, સ્ટન પિરામિડ હતી, સ્પર્ધા રમતો હતી, પછી રીલે રમતો હતી, બેઠી રમતો વિશિષ્ટ. એની અંદર જો ગોળ મટોળ, દડો રમવો, આગ ગાડી, ઊભી ખો, ખો, કબડ્ડી, લંગડી, ઘોડાકૂદ, પાલખી, તાર ગાડી, પીછે દોડ, આ બધી લીંબુ ચમચી, આ રીતની બધી રમતો મેં અંદર પસંદ કરેલી તે બુકમાંથી.
તો બધું દરરોજ રમાડતા હતા, દરરોજ ડેલી
ના
કેટલા દિવસ
સર,
રમાડ્યું?
ના સર, આની ઓલ્ટરનેટ હતું સર. એક દિવસ સોમવારે ધારો કે મેં મનોરંજનાત્મક રમતોને બોલાવ્યા હોય, તો મંગળવારે મેં સૂર્ય નમસ્કાર વાળાને બોલાવ્યા હતા, પછી બુધવારે મનોરંજનાત્મક, ગુરુવારે સૂર્ય નમસ્કાર, એ તો ઓલ્ટરનેટ સર રીતે બોલાવેલા હતા.
એટલે બંનેનું અલગ અલગ કરેલું છે. તમારું કોઈ કંટ્રોલ ગ્રુપ કે એવું કઈ હતું કે પછી આ બે જ રમતોનું હતું
હા,
ખાલી?
નિયંત્રિત ગ્રુપ હતું સર.
હા, તમે નિયંત્રિત ગ્રુપ હતું, તમે ત્રણનું તમે ભેગું કરીને તમે આ ટી રેશિયો શોધેલો છે?
ના સર, હા, એટલે ત્રણેયનો કઈને એફ રેશિયો શોધેલો છે સર.
એફ રેશિયો શોધ્યો છે.
હા.
હા, જયમલ છે જયમલ?
હા, આઈ એમ ઓડિબલ?
હા, યસ યસ, જયમલ હવે સંભળાય.
યસ સર, યસ સર.
ઓકે, બ્રિજેશ, તમે કેટલી બહેનોનું સિલેક્શન કર્યું હતું એઝ અ સેમ્પલ?
ટોટલ સર રેન્ડમલી ટોટલ સર 90 છોકરીઓ હતી, એમાંથી એક ગ્રુપમાં 30 હતી, એટલે કુલ ત્રણેય ગ્રુપમાં 30 મેં મૂકેલી હતી. ટોટલ શું છે, ઉમિયા કેવી એજ્યુકેશન ટ્રસ્ટમાંથી વિવિધ કોલેજોમાંથી આપણે બહેનોને પસંદ કરી હતી.
કઈ સેમ્પલિંગ મેથડ કઈ યુઝ કર્યો? કઈ સેમ્પલિંગ મેથડ યુઝ કર્યો?
રેન્ડમલી જ લીધી હતી છોકરીઓને, કારણ કે ઉમિયા આર્ટ્સ એન્ડ કોમર્સ કોલેજની અંદર આર્ટ્સ, કોમર્સ, બીબીએ, બીસીએ બધું અંદર ચાલે છે. મેં અંદરથી રેન્ડમલી છોકરીઓને પસંદ કરી એને ગ્રુપમાં પાડીને 30 છોકરીઓને પસંદ કરી.
રેન્ડમ સેમ્પલિંગ.
યસ સર.
ઓકે, વેરી ગુડ.
થેન્ક યુ સર.
ગો ફર્ધર, અમિત.
થેન્ક યુ.
થેન્ક યુ સર.
બ્રિજેશ પ્રજાપતિ.
થેન્ક યુ.
નેક્સ્ટ પાર્ટિસિપન્ટ છે અલ્પેશ કુમાર ઝા અને ડોક્ટર પરિચિત કે મંડોરાનું ટાઇટલ છે ગુજરાતની વ્યક્તિગત અને ટીમ રમતોના આંતર યુનિવર્સિટી કક્ષાના ખેલાડીઓના આવેગિક પરિપક્વતાના પાસા, સામાજિક અને કુસમાયોજન અને વ્યક્તિત્વ વિઘટનનો અભ્યાસ. અલ્પેશ કુમાર ઝા.
આદરણીય ચેરપર્સન ડોક્ટર ભાવેશ દેવતા સાહેબશ્રી તથા ડોક્ટર મનીષ નિજામા સાહેબ, કો ચેરપર્સન ડોક્ટર જયમલ નાઈક સાહેબ અને મોડરેટર શ્રી અમિતભાઈ પટેલ સાહેબને મારા સાદર પ્રણામ. હું અલ્પેશ કુમાર હસમુખરાય ઝા આજ રોજ આપ સૌ સમક્ષ મારું પેપર રજૂ કરવા જઈ રહ્યો છું. સૌપ્રથમ મારું જે ટાઇટલ છે ગુજરાતની વ્યક્તિગત અને ટીમ રમતોના આંતર યુનિવર્સિટી કક્ષાના ખેલાડીઓના આવેગિક પરિપક્વતાના પાસા, સામાજિક કુસમાયોજન અને વ્યક્તિત્વ વિઘટનનો તુલનાત્મક અભ્યાસ. મારા ગાઈડ શ્રી પરિચિત શ્રી ડી મંડોળા સાહેબ સ્વામિનારાયણ આર્ટ્સ કોલેજ માં જે પ્રોફેસર તરીકે કામ કરે છે એમને મને આ પેપર બનાવવામાં ખૂબ જ સારી એવી મદદ કરી છે. આ સંશોધન અભ્યાસનો હેતુ ગુજરાતની વ્યક્તિગત અને ટીમ રમતોના આંતર યુનિવર્સિટી કક્ષાના ખેલાડીઓના આવેગિક પરિપક્વતાના પાસા, સામાજિક કુસમાયોજન અને વ્યક્તિત્વ વિઘટનનો તુલનાત્મક અભ્યાસ કરવાનો હતો. આ સંશોધન અભ્યાસમાં વ્યક્તિગત અને ટીમ રમતોના આંતર યુનિવર્સિટી કક્ષાના ખેલાડીઓને વિષય પાત્રો તરીકે પસંદ કરવામાં આવ્યા હતા. આ સંશોધન અભ્યાસમાં ગુજરાતની એસપી યુનિવર્સિટી એટલે વિદ્યાનગર, હેમચંદ્રાચાર્ય ઉત્તર ગુજરાત યુનિવર્સિટી પાટણ, સ્વર્ણિમ ગુજરાત સ્પોર્ટ્સ યુનિવર્સિટી ગાંધીનગર અને ગુજરાત યુનિવર્સિટી અમદાવાદ એમ 4 યુનિવર્સિટીઓમાંથી ખેલાડીઓને પસંદ કરવામાં આવ્યા હતા. આ સંશોધન અભ્યાસમાં ટેબલ ટેનિસ, બેડમિન્ટન કે જે વ્યક્તિગત રમતોમાં આવે છે, ખોખો અને કબડ્ડી જે ટીમ રમતોમાં આવે છે એ રમતના ખેલાડીઓને પસંદ કરવામાં આવ્યા હતા. આ સંશોધન અભ્યાસમાં 18 થી 25 વર્ષની વય જૂથના ફક્ત પુરુષ ખેલાડીઓને જ પસંદ કરવામાં આવ્યા હતા. આ સંશોધન અભ્યાસમાં આવેગિક પરિપક્વતાના માપન માટે ડોક્ટર યશવીરસિંહ અને ડોક્ટર મહેશ ભાર્ગવ રચિત પ્રશ્નાવલીનો ઉપયોગ કરવામાં આવ્યો હતો. ગુજરાતની વ્યક્તિગત અને ટીમ રમતોના આંતર યુનિવર્સિટી કક્ષાના ખેલાડીઓના આત્મવિશ્વાસની તુલના કરવા માટે ટી રેશિયો લાગુ પાડી સાર્થકતા ચકાસવામાં આવી હતી. વ્યક્તિગત અને ટીમ રમતોના ખેલાડીઓના આવેગાત્મક પરિપક્વતાના પાસા, સામાજિક કુસમાયોજનમાં સાર્થક તફાવત જોવા મળ્યો હતો. આથી કહી શકાય કે ટીમ રમતના ખેલાડીઓ કરતા વ્યક્તિગત રમતના ખેલાડીઓ આવેગાત્મક પરિપક્વતાના પાસા, સામાજિક કુસમાયોજનમાં ચઢિયાતા જોવા મળ્યા હતા. વ્યક્તિગત અને ટીમ રમતના ખેલાડીઓના આવેગાત્મક પરિપક્વતાના પાસા વ્યક્તિત્વ વિઘટનમાં સાર્થક તફાવત જોવા મળ્યો હતો. આથી કહી શકાય કે ટીમ રમતના ખેલાડીઓ કરતા વ્યક્તિગત રમતના ખેલાડીઓનું વ્યક્તિત્વ વિઘટનમાં ચઢિયાતા જોવા મળ્યા હતા. નેક્સ્ટ સ્લાઇડ પ્લીઝ. પ્રસ્તાવના. આવેગ એ પ્રત્યેક માનવીની રોજબરોજ થતો અનુભવ છે. આ શબ્દ લેટિન ભાષામાંથી આવેલો છે. તેનો અર્થ શુદ્ધ થવું, ખળભળવું એવો થાય છે. આવેગના અનુભવ સમયે સમગ્ર મજ્જાતંત્ર ખળભળી ઉઠે છે, એટલે કે ક્ષુબ્ધ થાય છે. આ સમયે મજ્જાતંત્ર અતિ પરિણામે આવેગ દરમિયાન અનેકવિધ બાહ્ય અને આંતરિક શારીરિક ફેરફારો થાય છે. આમ આવેગ એ શરીરની ક્ષુબ્ધાવસ્થા છે કે જે વિવિધ શારીરિક પરિવર્તનો દ્વારા વ્યક્ત થાય છે. આવેગ એ સુખદ કે દુઃખદ લાગણી છે. આ સુખદ કે દુઃખદ લાગણી વ્યક્તિને વિવિધ પ્રવૃત્તિઓ કરવા પ્રેરે છે. આમ આવેગો એ પ્રેરક બળ તરીકે કાર્ય કરે છે, જેનાથી ખેલાડીઓ પોતાના આવેગો દ્વારા રમતની સફળતા હાંસલ કરતા થાય છે. જ્હોન મેયર તેમજ ડોક્ટર પીટર સોલોવીએ ભાવનાશીલ સમજદારી આવેગાત્મક વ્યક્તિઓના પારસ્પરિક સંબંધો અંગે તેઓની જર્નલ ઓફ પર્સનાલિટી એસેસમેન્ટમાં રજૂઆત કરે છે. તેઓએ વ્યક્તિઓના પારસ્પરિક સંબંધો અંગેનું વર્ણન, આવેગો સમજવાની ક્ષમતા તેમજ અન્ય લોકોની ભાવનાશીલતા અંગે પોતાની સમજદારીની બુનિયાદ મુજબ વર્તન પરત્વે વ્યાખ્યા કરે છે. ત્યારબાદ 1995માં માનસશાસ્ત્રી ડેનિયલ ગોલમેને આ વ્યાખ્યા પોતાના ઇમોશનલ ઇન્ટેલિજન્સ વાય ઇટ કેન મેટર મોર ધેન બૌદ્ધિકત્વ દ્વારા લોકપ્રિય બનાવી વ્યવસાયિક રૂપ આપેલ છે. નેક્સ્ટ સ્લાઇડ. અભ્યાસનો હેતુ. આ સંશોધન અભ્યાસનો હેતુ ગુજરાતની વ્યક્તિગત અને ટીમ રમતોના આંતર યુનિવર્સિટી કક્ષાના ખેલાડીઓના આવેગિક પરિપક્વતાના પાસા, સામાજિક સુસમાયોજન અને વ્યક્તિત્વ વિઘટનનો તુલનાત્મક અભ્યાસ કરવાનો હતો. વિષય પાત્રોની પસંદગી. તો આ સંશોધન અભ્યાસમાં વ્યક્તિગત અને ટીમ રમતોના આંતર યુનિવર્સિટી કક્ષાના ખેલાડીઓને વિષય પાત્રો તરીકે પસંદ કરવામાં આવ્યા હતા. આ સંશોધન અભ્યાસમાં ગુજરાતની એસપી યુનિવર્સિટી વિદ્યાનગર, હેમચંદ્રાચાર્ય ઉત્તર ગુજરાત યુનિવર્સિટી પાટણ, સ્વર્ણિમ ગુજરાત સ્પોર્ટ્સ યુનિવર્સિટી ગાંધીનગર અને ગુજરાત યુનિવર્સિટી અમદાવાદ એમ 4 યુનિવર્સિટીઓમાંથી ખેલાડીઓને પસંદ કરવામાં આવ્યા હતા. આ સંશોધન અભ્યાસમાં ટેબલ ટેનિસ, બેડમિન્ટન, ખોખો અને કબડ્ડી રમતના ખેલાડીઓને પસંદ કરવામાં આવ્યા હતા. આ સંશોધન અભ્યાસમાં 18 થી 25 વર્ષની વયે જૂથના ફક્ત પુરુષ ખેલાડીઓને જ પસંદ કરવામાં આવ્યા હતા. માપનના ધોરણો. આ સંશોધન અભ્યાસમાં આવેગિક પરિપક્વતાના માપન માટે ડોક્ટર યશવીર સિંઘ અને ડોક્ટર મહેશ ભાર્ગવ રચિત પ્રશ્નાવલીનો ઉપયોગ કરવામાં આવ્યો હતો. આંકડાકીય પ્રક્રિયા. ગુજરાતની વ્યક્તિગત અને ટીમ રમતોના આંતર યુનિવર્સિટી કક્ષાના ખેલાડીઓના આવેગિક પરિપક્વતાના પાસા, સામાજિક કુસમાયોજન અને વ્યક્તિત્વ વિઘટનની તુલના કરવા માટે ટી રેશિયો લાગુ પાડી સાર્થકતા ચકાસવામાં આવી હતી. નેક્સ્ટ સ્લાઇડ. અભ્યાસના પરિણામો. સારણી 1. વ્યક્તિગત અને ટીમ રમતોના આવેગાત્મક પરિપક્વતાના પાસા, સામાજિક કુસમાયોજનનો મધ્યક પ્રમાણિત વિચલન, મધ્યક તફાવત અને ટી રેશિયો દર્શાવતી સારણી. એની અંદર જૂથ, મધ્યક સંખ્યા, પ્રમાણિત વિચલન, મધ્યક તફાવત અને ટી રેશિયો. જૂથની અંદર 2 જૂથ છે, એક વ્યક્તિગત અને બીજું ટીમ રમત. વ્યક્તિગત જે ટુકડીઓ છે એમાં મધ્યક છે 28.910, એની સંખ્યા હતી 42, પ્રમાણિત વિચલન 6.744. ટીમ રમતની અંદર 23 મધ્યક છે 23.630, એની સંખ્યા હતી 108 અને પ્રમાણિત વિચલન 7.177. બંનેનો મધ્યકનો તફાવત છે 3.180 અને ટી રેશિયો આવે છે 2.477. સાર્થકતાનું ધોરણ 0.05 કક્ષાએ ટી ઇઝ ઇક્વલ ટુ 148 into 1.976. સારણી 1 માં જોઈ શકાય છે કે આવેગાત્મક પરિપક્વતાના પાસા, સામાજિક કુસમાયોજનમાં વ્યક્તિગત ખેલાડીઓનો મધ્યક 28.910 જોવા મળ્યો હતો અને ટીમ રમતોના ખેલાડીઓનો મધ્યક 23.630 જોવા મળ્યો હતો. વ્યક્તિગત રમતના ખેલાડીઓનું પ્રમાણિત વિચલન 6.744 અને ટીમ રમતના ખેલાડીઓનું પ્રમાણિત વિચલન 7.177 જોવા મળ્યું હતું, જ્યારે મધ્યક તફાવત 3.180 જોવા મળ્યો હતો, જેનો ટી રેશિયો 2.477 જોવા મળ્યો હતો, જે 0.05 કક્ષાએ સાર્થક તફાવત જોવા મળ્યો હતો. નેક્સ્ટ સ્લાઇડ. નેક્સ્ટ સ્લાઇડ. સારણી 2. વ્યક્તિગત અને ટીમ રમતોના આવેગાત્મક પરિપક્વતાના પાસા, વ્યક્તિત્વ વિઘટનનો મધ્યક પ્રમાણિત વિચલન, મધ્યક તફાવત અને ટી રેશિયો દર્શાવતી સારણી. એમાં પણ 2 જૂથ છે, વ્યક્તિગત અને ટીમ રમત. મધ્યક છે 27.333, ટીમ રમતનો છે 23.880, સંખ્યા છે 42 અને ટીમ રમતની 108, પ્રમાણિત વિચલન 6.842, 9.026, મધ્યક તફાવત છે 3.454 અને ટી રેશિયો છે 2.240. સાતત્યતાનું ધોરણ 0.05 કક્ષાએ t is equal to 148 into 1.976. સારણી 2 માં જોઈ શકાય છે કે આવેગાત્મક પરિપક્વતાના પાસા વ્યક્તિત્વ વિઘટનમાં વ્યક્તિગત ખેલાડીઓનો મધ્યક 27.333 જોવા મળ્યો હતો અને ટીમ રમતના ખેલાડીઓનો મધ્યક 23.880 જોવા મળ્યો હતો. વ્યક્તિગત રમતના પ્રમાણિત ખેલાડીઓનું પ્રમાણિત વિચલન 6.842 અને ટીમ રમતના ખેલાડીઓનું પ્રમાણિત વિચલન 9.026 જોવા મળ્યું હતું. જ્યારે મધ્યક તફાવત 3.454 જોવા મળ્યો હતો, જેનો ટી રેશિયો 2.240 જોવા મળ્યો હતો, જે 0.05 કક્ષાએ સાર્થક તફાવત જોવા મળ્યો હતો. નેક્સ્ટ સ્લાઇડ. કારણો. વ્યક્તિગત અને ટીમ રમતના ખેલાડીઓના આવેગાત્મક પરિપક્વતાના પાસા સામાજિક કુસમાયોજનમાં સાર્થક તફાવત જોવા મળ્યો હતો. આથી કહી શકાય કે ટીમ રમતના ખેલાડીઓ કરતા વ્યક્તિગત રમતના ખેલાડીઓનો આવેગાત્મક પરિપક્વતાના પાસા સામાજિક કુસમાયોજનમાં ચઢિયાતા જોવા મળ્યા હતા. વ્યક્તિગત અને ટીમ રમતના ખેલાડીઓના આવેગાત્મક પરિપક્વતાના પાસા વ્યક્તિત્વ વિઘટનમાં સાર્થક તફાવત જોવા મળ્યો હતો. આથી કહી શકાય કે ટીમ રમતના ખેલાડીઓ કરતા વ્યક્તિગત રમતના ખેલાડીઓ આવેગાત્મક પરિપક્વતાના પાસા વ્યક્તિત્વ વિઘટનમાં ચઢિયાતા જોવા મળ્યા હતા. થેન્ક યુ.
ક્વેશ્ચન ઓડિયન્સ માંથી એની ક્વેશ્ચન?
Okay. Any questions?
અલ્પેશભાઈ, વ્યક્તિગત અને ટીમ રમતોની સંખ્યામાં તમે અલગ અલગ સંખ્યા બતાવી છે સ્ટેટિસ્ટિકલ કોઠામાં?
હા સર.
બંનેમાં અલગ અલગ થઈને પછી તમે એને કેવી રીતે ટી રેશિયો મતલબ ટી રેશિયો તમે શોધેલો છે, તો અલગ અલગ સંખ્યા ટી રેશિયો નું પ્રમાણ રહે ખરું બરાબર? એમાં તમે મને જરા વિગતવાર કહેશો?
વીકમાં એક દિવસ તાલીમ કાર્યક્રમ અને એક દિવસ ફૂલ્લી 1 કલાક એ લોકોને સાદી રમતો રમાડવામાં આવે.
સાદી રમતોમાં કઈ કઈ રમતો રમાડતા હતા?
એમાં લીંબુ ચમચી છે, પહેલા તો ખોખોની રમત રમાડતા હતા અને પછી એ લોકોને સાદી રમતો જેમાં લીંબુ ચમચી છે, બટાકા દોડ છે. હા હા
તો એવી
ના એ તો
એવી એવી કોઈ રિલે રમતોમાં એવી કઈ
ના એવી તો
કઈ તમારે કે એમાં ફાસ્ટ
નથી
દોડવાનું આવે, લીંબુ ચમચી છે,
એમાં
ડેકાબૂટ છે,
હા
એનાથી કઈ સ્પીડ વધી જાય એ રમત
એવું નથી
છે.
નથી ને અમારે જે
એટલે
ટેબલમાં
તમે
છે.
બહેનોની ઝડપ વધારવા માંગતા હોય
જે ઉષ્મા
તમે જો
પ્રેરક
ઝડપ વધારવા માંગતા હોય તો
હા
હા ઉષ્મા પ્રેરક માં ચાલી જાય, પણ ઝડપ વધે એવી તમારે રમત કઈ
અને જરા તૂટક તૂટક બોલને સમજવાવું પડે એવું હતું, કારણ કે તમે બોલી ગયા અને થોડુંક સમજ ઓછી પડી એવું લાગ્યું મને. એટલે તમારો પ્રયત્ન ખૂબ સારો છે, તમે ઇંગ્લિશમાં બોલ્યા છો, પ્રયત્ન સારો છે, પણ એને જરા વ્યવસ્થિત સમજાઈને મેથોડોલોજી ને એની પ્રક્રિયા બધું કરીને તમે બોલો તો આ પેપર તમારું સારું રહે, નહીતર સારું ના રહે તમારું પેપર. જયમલભાઈ.
હા, કમલેશભાઈ, કમલેશભાઈ,
યસ યસ.
આ કન્ક્લુઝન તમે અલગથી કર્યું છે, યુ ડિફાઇન.
હા સર. sports planning, organization in sport, supply of sport, directing sport.
સ્પોર્ટ્સ મેનેજમેન્ટના કી પોઈન્ટ્સ શું છે એ ખ્યાલ નહીં આવ્યો. સ્પોર્ટ્સ મેનેજમેન્ટનું તમે પેપર બનાવ્યું, સ્પોર્ટ્સ મેનેજમેન્ટ શું છે અને સ્પોર્ટ્સ મેનેજરમાં કયા કયા પોઈન્ટ્સને સામેલ કરી શકાય.
sport planning, organizing sports.
આપ ઇંગ્લિશ મીડિયમના સ્ટુડન્ટ છો તો ઇંગ્લિશમાં ક્વેશ્ચન કરું.
હા સર, ગુજરાતી મીડિયમ છું.
કી પોઈન્ટ્સ કેવો, ખાલી કી પોઈન્ટ્સ. ખૂબ જ વાઇડ સબ્જેક્ટ છે સ્પોર્ટ્સ મેનેજમેન્ટ, તો આપણે સ્પોર્ટ્સ મેનેજમેન્ટ થી શું કરી શકીએ એના કી પોઈન્ટ્સ છે આપની પાસે?
એના મુખ્ય મુદ્દાઓ છે તમારી પાસે?
મેનેજમેન્ટ ખૂબ જ મોટો સબ્જેક્ટ છે, એને આપણે સ્પોર્ટ્સમાં એડ કર્યો છે, તો સ્પોર્ટ્સને શું ફાયદો થઈ શકે એનાથી? આપ સાંભળી શકો છો કમલેશભાઈ? યુ આર ઓડિબલ ઓર નોટ? મારો અવાજ સંભળાય છે?
આજે અમને તો સંભળાય છે, હવે એમને મને લાગે સંભળાતો નથી અથવા એ થોડા કન્ફ્યુઝ થઈ ગયેલા છે એવું લાગે છે.
કમલેશભાઈ આઈડિયા ના હોય તો આપણે સ્કીપ કરીએ. હવે કેવું, સ્પોર્ટ્સ મેનેજમેન્ટમાં આપણે મેનેજમેન્ટ જે રીતે બીજા ફિલ્ડમાં કરીએ છીએ તે રીતે સ્પોર્ટ્સમાં કઈ કઈ રીતે કરી શકાય, તો આપણે ટુર્નામેન્ટનું આયોજન કરવામાં કયા કયા પોઈન્ટ્સ આવે છે, ગ્રાઉન્ડ થી માંડીને, અમ્પાયરિંગ થી માંડીને, ઇક્વિપમેન્ટ્સ થી માંડીને, ટીમ્સ, સ્પોન્સરશિપ, પ્રેસ, જર્નલિઝમ, તો એ બધા પોઈન્ટ્સ અંદર આવવા જોઈએ કે આપણે મોટી બિગ ઇવેન્ટ, આપણે આઈપીએલ છે તો આઈપીએલ આપણે રમાડીએ તો કઈ કઈ રીતે આપણે એમાં, તો એમાં સ્પોર્ટ્સ મેનેજમેન્ટ નું શું કામ છે તે ખબર પડવી જોઈએ એમ. ઓકે ઓકે અમિતભાઈ.
ઓકે. થેન્ક યુ જયમલભાઈ. થેન્ક યુ ડેટા સર. થેન્ક યુ કમલેશભાઈ. નેક્સ્ટ પાર્ટિસિપન્ટ છે આપણા અંકિત એસ ઠાકોર, એમનો ટાઇટલ છે સ્પોર્ટ્સ એન્ડ ફિટનેસ. અંકિતભાઈ, તમારું પીપીટી હાજરમાં નહીં હતું પણ તમારું પેપર મળ્યું છે અમને, એ પેપર તમને પેપર શેર કરીએ છીએ. ઓકે
ઓકે સર,
આ તમે પ્રેઝન્ટ કરી શકો છો.
hello. Good afternoon, respected sir, ma'am, and today's my topic sports and fitness. I am PhD research scholar, Gujarat University, Ahmedabad. Abstract: the best sports for fitness and one in which you exercise continuously. Those that are least likely to injure you and one on your injure at the most. You become fit and exercising rigorously enough and necessary circulation of blood. It makes no difference to your heart and ensure when circulation. The best sports of fitness use leg become because the blood barriers in your leg and so large
that you can circulation for more blood with your legs muscle. For an arm exercise, try to earlier become most people have work arms. Sports can be a large way and get a shape or a stay and way. Having a specific goal can be a great motivator. You need strength and endurance. Your training will vary with your sports. You might have a cross training supplying means that your include a very variety of fitness activity in program. Research that show cross training builds stronger bond. Some sport require a great level of sports just to start. For explain to jump rope, you can must spin that rope more than 80 items a minute to keep in from uh, 10. Many people can jump 80 items a minute. Surface the sports are low impact aerobic, walking, swimming, and pedaling stationary bicycle, which can damage muscles and bones. Keywords. Keywords exercise, fitness, endurance, and motivation. Physical fitness is the body ability to function efficiently and effectively. It consists to health related physical fitness and skill related physical fitness, which has had led 11 different components, each of which contributes to total quality of life. Physical fitness also include metabolic fitness, physical fitness, and associated, which a person ability to work effe- effectively, enjoy leisure time, habit healthily, research hypokinetic disease, and meet emergency situations. Emotional and spiritual component of fitness. Although the development of physical fitness, the result of many things, optimal physical fitness is not possible without regular exercise. Sports play a wonderful role in physical fitness. Sports is a application of fitness in fantastic share of competition and mastery. It is after all the combined express on application of the 10 general skills that it our motivation of their development in the first place. Sports and games like soccer, martial arts, baseball, and basketball, in contrast to our training, workouts have more varied to less tactical movements. Sports is better in our view at expression and testing of skill that it is developing that some like both expression and development are circulation to our fitness. Sports is a many respect more closely mimic and the demand of nature that does training. We encourage and expect of our athletes and engage to regular sports offer in addition to all of their strength and conditioning work. Unlike most trouble, defining physical fitness is not subjective matter in face determining what is meant be to physical fit can be a matter of life and death. The This component of physical fitness are primarily influenced by regular physical fitness mental exercise. However, social pressure to be thin of or very full fears uh, has restored the importance of being physically fit. Meaning comments. First, uh, patient is isn't don't try to do much too soon and do not quit before you have change exercise and reward of improve fitness and the price is worth the price. Second, in the following page, you will find the basic information and you need to being and maintain a personal physical fitness program. This guideline and return for the average healthy dual until your goal to be sound and show after of then how long and how hard must exercise to achieve then it also include information that will make you work out easier, tougher and more satisfying. The rest is up to you. Checking your health. If you under 35 in good health, you do not need to see doctor before beginning an exercise program. But if you are over 35 and have been several years, you should consult your physical physician, uh, conditioner, and indicate and a need of a medical clearance are high blood pressure, heart trouble, family history of early stroke, heart attack, death, frequency disease, self, extreme breathlessness after mind extremes, other bones problem, several muscular ligaments or tendon problem, other no suspended disease, vigorous exercise involves minimum health risk from personal in good health or those following doctors avoid fear presented by habits and obesity. Defining fitness. Physical fitness is the human body what fine training. Yes, sir. Training
દે-
is and yes, sir. Yes, sir.
કેટલું હજુ કેટલું બાકી છે તારે આગળ પેપર?
Sir, last anatomic symptoms, cardio research, endurance, muscular strength, muscular endurance, flexibility, and last
અંડર
conclusion.
અંડર અંડર ની વાત છે તો ચાલશે, જે બોલ્ડ પોઈન્ટ છે
Yes, sir.
એટલું બોલી જાય ખાલી.
Conclusion बोल दो. Okay. Last conclusion. Physical fitness component to related concept, general fitness and specific fitness. Physical fitness is generally achieved through correct nutrition, exercise, and intro rest. In previous years, however, an automatic increase lesser time change in lifestyle following in the introduction revolution results in the definition emulation and current and contrast physical fitness in considered and measures of the body ability to function efficiency and effectively in work and lesser activity to be a heart to resist hypokinic disease and meet emergency situation. Thank you, sir.
અંકિત ભાઈ
Yes, sir. Yes, sir.
તમારું જયમલ તું પૂછી લે પહેલા કે જયમલ જતો રહ્યો.
Yes, sir.
જયમલ આવ્યો ચલો.
અંકિતભાઈ.
Yes, sir.
હા, તો ફિઝિકલ ફિટનેસ ના કોમ્પોનન્ટ્સ કયા કયા છે?
Physical fitness
મેઇન કોમ્પોનન્ટ્સ.
and components sir हाल keywords માં છે exercise fitness endurance motivation.
મોટિવેશન.
હમ
મોટિવેશન પણ આવે ફિટનેસમાં?
exercise fitness endurance.
ના, પણ ફિટનેસના જે કી પોઈન્ટ્સ છે એ કયા કયા? મોટર કોમ્પોનન્ટ્સ.
fitness હા
મોટર
fitness
કોમ્પોનન્ટ્સ કયા કયા?
motor component एक मिनट sir एक मिनट
તમે લીધેલા જ છે અંકિતભાઈ એ જ બોલવાનું છે.
हाँ हाँ सर हाँ सर exercise fitness endurance motivation.
ખેલાડી ફિટ છે એવું ક્યારે કહી શકાય? કયા કયા કમ્પોનન્ટ ના આધારે?
cardio research endurance, muscles strength endurance, muscles endurance and flexibility.
ઓકે, અને
muscle strength endurance yes sir.
એટલા જ આવે?
છે સર બીજા પણ મેં આટલા લીધા છે. હા મેં અત્યારે આટલા લીધા છે.
ઓકે.
હા મેં
અને
લિમિટેશન હતી એટલે યસ
એને સ્પોર્ટ્સ સાથે તમે રિલેટ કર્યું છે, સ્પોર્ટ્સ એન્ડ ફિટનેસ?
હા સર.
તો એને તમે પેપરમાં કઈ સ્પોર્ટ્સ સાથે ફિટનેસ ડેવલપ કરવામાં કયા કયા સ્પોર્ટ્સ નો યુઝ કર્યો છે એવું કઈ?
ના સર સ્પોર્ટ્સ નથી, આ
સ્પોર્ટ્સ
જનરલ
રમવાથી
સર એનું હા એક મિનિટ સર, જેમ કે વેઇટ લિફ્ટિંગ છે સર, તો એક મિનિટ સર.
એટલે તમે તમારો ટોપિક જ એવો છે કે સ્પોર્ટ્સ એન્ડ ફિટનેસ. હવે માત્ર
યસ સર.
ફિટનેસ શું છે ને ફિટનેસ ના તમે એન્ડ્યોરન્સ ને બધું સમજાવો છો, પણ સ્પોર્ટ્સ રમવાથી ફિટનેસ આવે છે કે કેમ, એકલી એક્સરસાઇઝ ની તમે વાત કરી.
હા.
ઓકે દેવદાસ સર.
કઈ તમે કઈ સ્પોર્ટ્સ એવું પૂછવા માંગે છે જયમલ સાહેબ, કઈ તમે કઈ સ્પોર્ટ્સ નું તમે સ્પોર્ટ્સ એન્ડ ફિટનેસ છે એટલે આ બહુ વાઇડ સબ્જેક્ટ છે ભાઈ. સ્પોર્ટ્સ એન્ડ ફિટનેસ બહુ મોટો સબ્જેક્ટ છે, બરાબર. એમાં
હા
તમે
યસ સર.
એટલે એમાં જરા થોડુંક મહેનત કરવી પડે એવું છે તમારે, બરાબર.
હા ઓકે સર.
ઓકે અમિત,
ઓકે
છે કોઈ બાકી હવે?
થેન્ક યુ સર. થેન્ક યુ.
આપણે જયમલ સાહેબ,
હા સર. દેવદાસ
તમે
સર
પેલા એક આપણે જે એક ભાઈ અલ્પેશભાઈ ઠાકોર નું મને લાગે છે, નહીં અલ્પેશ નહીં પણ તમે
હા સુરતિયા સેકન્ડ નું એક મિસ છે.
હા
સુતરિયા.
સુરત તો મિસ જ છે,
ઓકે.
બરાબર
અને
ને પણ
હા કઈ નઈ, પેલો ક્વેશ્ચન હતો એ તો સાહેબ જવા દેવો હોય.
ઓકે
ટાઈમ
ચલો
ટાઈમ ઘણો થઈ ગયો છે.
ઓકે સર,
અને
ઓકે ઓકે ઓકે
ખૂબ
અમિત
ઓકે સર.
હવે હા ઓકે
સર હવે
આપણે દેવતા સાહેબ આભાર માની લઈએ.
ના ના
હા
સર, સર એક મિનિટ.
હા
જયમલ સર,
ઓકે ઓકે.
આપણે સિરિયલ નંબર 2 છે ને સુતરિયા હેતવી ધીરજલાલ નું એક પ્રેઝન્ટેશન બાકી રહી ગયું, ટેકનિકલ ઇશ્યુઝ ને કારણે પ્રેઝન્ટ
ઓકે
થઈ ન શક્યું હતું.
ઓકે
તો એ અત્યારે જોઈન થઈ રહી છે
ઓકે
અને
ઓકે.
એમનું પ્રેઝન્ટ કરવા માંગે છે.
કઈ વાંધો
તો છેલ્લું જ છે.
હા કરો
ચોક્કસ.
કરો
હવે તમે એલાવ કરો તો
ના
નહીં
ના
કરો
ના
કરવાનું
ના
છે, હા કરો
કરો કરો કરો.
ઓકે સર, થેન્ક યુ. ને લાસ્ટ પાર્ટિસિપન્ટ છે સુતરિયા હેતવી ધીરજલાલ. એમનો ટાઇટલ છે પ્રાણાયામ અને વૈજ્ઞાનિક ફાયદો. હેતવી?
Yes, sir, I'm present.
ઓકે ઓકે, તમે તમારું પેપર પ્રેઝન્ટ કરી શકો છો.
ઓકે સર. તો મારું નામ હેતવી સુતરિયા છે. હું પીએચડી સ્કોલર છું. ગુડ ઇવનિંગ ઓલ ઓફ યુ. ગુડ ઇવનિંગ વલસાડ. મારો ટોપિક છે પ્રાણાયામ અને વૈજ્ઞાનિક ફાયદાઓ સર. જેમાં એબ્સ્ટ્રેક્ટ છે પ્રાણાયામ. પ્રાણાયામ એટલે શું? પ્રાણાયામ એ યોગના 8 અંગો માનો એક પ્રકાર છે. 8 અંગો એ તો પ્રકારનો એક પ્રકાર છે પ્રાણાયામ. જેમાં શ્વાસ ઉચ્છ્વાસની ગતિને ધ્યાનમાં લેવામાં આવે છે. પ્રાણાયામ એ ઋષિ મુનિઓની દેન છે. પ્રાણાયામથી આપણે પૂરતા પ્રમાણમાં ઓક્સિજન મેળવી શકીએ છીએ અને કાર્બન ડાયોક્સાઇડને બહાર કાઢી શકીએ છીએ. પ્રાણાયામથી શ્વાસ પર નિયંત્રણ કરી શકાય છે. પ્રાણાયામથી ઘણા બધા વૈજ્ઞાનિક ફાયદાઓ થતા હોય છે. જેવા કે કાર્ડિયોવાસ્ક્યુલર અને રક્ત પરિભ્રમણ પર સારી અસર પડે છે. ફેફસાને મજબૂત બનાવે છે. ટોક્સિન્સને બહાર કાઢવામાં મદદ કરે છે. રોગ પ્રતિકારક શક્તિ વધે છે. મગજના ડિસઓર્ડર્સ પર પણ અસર જોવા મળે છે. આમ પ્રાણાયામથી વૈજ્ઞાનિક રીતે જોવા જઈએ તો આવા ઘણા બધા ફાયદાઓ થતા જોવા મળતા હોય છે. પ્રસ્તાવના છે યોગનો એક પ્રકાર પ્રાણાયામ પણ છે. યોગનો એક પ્રકાર સવાર સાંજ અડધી અડધી કલાક ચાલવા જવું તેમ પણ છે અને યોગનો એક પ્રકાર કસરત છે. ભક્તિની દ્રષ્ટિએ જોઈએ તો યોગ એટલે ભગવાન સાથે જોડાવો. આજે માણસ પાસે સમય નથી. ધન સંપત્તિ અને પૈસો માણસ પાસે છે પણ શાંતિ નથી. અને આ શાંતિ મેળવવા માટે જ આપણા ઋષિ મુનિઓ જંગલમાં જઈને શ્વાસને પોતાના ઈષ્ટની આરાધનામાં રોકીને હજારો વર્ષની તપસ્યા કરતા હતા. અને આ રીતે પ્રાણાયામ દ્વારા મંત્રોચ્ચાર સાથે શાંતમાંથી સાચા દિલથી ભગવાનની ભક્તિ કરીને લાંબુ આયુષ્ય, આરોગ્યમય આયુષ્ય અને ભગવાનનો સાક્ષાત્કાર પ્રાણાયામ દ્વારા જ કરી શકતા હતા. આ પ્રાણાયામનો રસ્તો આપણા ઋષિ મુનિઓએ જ આપણને બતાવ્યો છે. જો નિયમિત રીતે આપણા ઈષ્ટદેવના મંત્રોચ્ચાર સાથે જો આપણે પ્રાણાયામ કરીશું તો શ્વાસની ગતિ ધીમી થવાથી આપણા જીવનની દરેક ક્રિયાને આપણે સ્પષ્ટ રીતે જોઈ શકીએ. ધીમે ધીમે શ્વાસ લેવાથી આપણી આંતરિક બુદ્ધિ બળ મળે છે. જેથી જીવનની કઠિન પળોમાં પણ આપણે સાચા નિર્ણયો લઈ શકીએ છીએ. ધીરે ધીરે અને લાંબા શ્વાસ લેવાથી શરીરને પૂરતો ઓક્સિજન મળે છે. જેથી એક જાતની વિદ્યુત શક્તિ શરીરના તમામ કે સુધી પહોંચે છે, મતલબ બધા સુધી પહોંચે છે, જેથી શરીરના બધા કોષો શક્તિ સંપન્ન બને છે, જેથી આપણે તણાવ મુક્ત રહી શકીએ છીએ અને દરેક રોગમાંથી હંમેશા માટે મુક્ત થઈ શકીએ છીએ. ઊંડા અને મોટા શ્વાસ પ્રાણાયામ લેવાથી પ્રાણાયામ કરવાથી પેટ, હૃદય અને જીવનની ક્રિયા સારી રીતે કામ કરી શકે છે. ધીરે ધીરે શ્વાસ લેવાથી પ્રાણાયામ કરવાથી pineal ગ્રંથિ કે જેમાં આત્મા રહે છે તે પુષ્ટ થાય છે અને તેને બળ મળે છે. પ્રાણાયામ કરવાથી આપણે પ્રકાશ અને અંતરિક્ષથી પણ ઊંચા જઈ શકીએ છીએ. જેઓ પ્રાણાયામ દ્વારા શ્વાસ પર નિયંત્રણ રાખવાનું શીખી જાય છે તે ખુશ મિજાજ, શક્તિ સંપન્ન તથા ઉત્સાહથી પૂર્ણ રહે છે. પ્રાણાયામથી અનેક બીમારીઓમાંથી સદાકાળ માટે મુક્ત કરી શકાય છે. જો આપણા જીવનમાં આપણા જીવનમાં આપણે શ્વાસ લેવાની પ્રક્રિયા નીચે મુજબ કરીએ છીએ. જો 1 મિનિટમાં આપણે 15 શ્વાસ લેતા હોય તો આપણે એનો ટોટલ લગાવીએ તો 1 કલાકમાં 15 ગુણ્યા 60 સેકન્ડ તો ઇઝ ઇક્વલ ટુ 900 શ્વાસ આપણે લેતા હોઈએ છીએ. 900 શ્વાસ આપણે 1 કલાકમાં લેતા હોઈએ છીએ. એવી જ રીતે જો આપણે દિવસનું કાઉન્ટ કરીએ તો 24 કલાક ગુણ્યા 900 શ્વાસ એટલે 21,600 શ્વાસ આપણે દિવસમાં લેતા હોઈએ છીએ. પ્રાણાયામ દ્વારા બીમારી ધીરે ધીરે મટી શકે છે. નાના મોટા રોગોમાં ધીરે ધીરે રિકવરી મળે છે. ઉપરોક્ત હિસાબ લે કે તમે જુઓ તો એક દિવસમાં ફક્ત 15 શ્વાસ આપણે બચાવીએ તો રોજનું માણસનું 1 મિનિટનું આયુષ્ય વધી શકે છે. તો કેટલું આયુષ્ય આરોગ્ય સાથે આપણે વધારવું તે આપણા પોતાના હાથની વાત હોય છે. આ પ્રાણાયામમાં જેટલો ઉપકાર માનીએ તેટલો આપણે ઓછો છે. હવે છે પ્રાણાયામના વૈજ્ઞાનિક ફાયદાઓ. તો અહીંયા મેં 7 વૈજ્ઞાનિક ફાયદાઓ લીધેલા છે. એમાંનો પહેલો છે કાર્ડિયોવાસ્ક્યુલર અને રક્ત પરિભ્રમણ. પ્રાણાયામ પેરાસિમ્પેથિક નર્વસ સિસ્ટમ સક્રિય કરે છે, જે નોંધપાત્ર રીતે તેમના સિસ્ટોલિક અને ડાયસ્ટોલિક દબાણ ઘટાડે છે. આમ હૃદયના દરને ઘટાડે છે, પણ તે સ્નાયુઓને આરામ આપે છે, જે શાંત થવાથી આપણને હળવા અને શાંતિપૂર્ણ લાગે છે. નાઇટ્રિક ઓક્સાઇડ એ રક્તવાહિનીના ડાયલેટર છે. જ્યારે નાઇટ્રિક ઓક્સાઇડ નાક દ્વારા ઇન્હેલેશન પર હવાને અનુસરે છે, જેનો અર્થ એ થાય છે કે રક્તવાહિનીઓ દ્વારા વધુ પ્રમાણમાં લોહી પસાર થઈ શકે છે અને ઓક્સિડાઇઝ થઈ શકે છે. સેકન્ડ છે મગજ તરંગ સક્રિયતા. પ્રાણાયામની પ્રેક્ટિસ ધ્યાન જેવી મગજની તરંગ પ્રવૃત્તિઓને પ્રેરણા આપે છે. આમ તે શાંત સ્થિતિ, સ્પષ્ટતાને પ્રેરિત કરે છે અને આપણે આપણા પર્યાવરણ સાથે જોડાયેલ હોય તો અનુભવીએ છીએ. હકીકતમાં યોગ શ્વસન પુસ્તકો મનોરોગ ચિકિત્સામાં ઝડપથી ઉપયોગમાં લેવાય છે. થર્ડ છે ડાયાબિટીસ. ડાયાફ્રેમેટિક શ્વસન ઓક્સિડેટિવ તણાવને નોંધપાત્ર રીતે ઘટાડે છે. આ મહત્વપૂર્ણ છે કારણ કે ઓક્સિડેટિવ તણાવ હાઇપરગ્લાયસીમિયા સાથે સંકળાયેલું છે, જે ડાયાબિટીસ તરફ દોરી શકે છે. આમ ડાયાફ્રેમેટિક શ્વસન ડાયાબિટીસને ફાયદાકારક છે. ચોથું છે પેટના હોમિયોસ્ટેસિસ. યોગને પાચન સમસ્યાઓ જેમ કે એસિડ રિફ્લેક્સ, ગેસ, કબજિયાત વગેરે માટે ખૂબ અગ્રણી કારણ કે ઘણા આસન પ્રાણાયામ પેટના અંગોને લાભ આપે છે. તેથી સરળ આસન અને શ્વસન કસરતથી સુખી અને તંદુરસ્ત પેટનો અભ્યાસ કરવો જોઈએ. પાંચમું છે ફેફસાને મજબૂત કરે છે. પ્રાણાયામ ફેફસાનો પ્રતિકાર ઓછો કરીને હવાના ફ્લોને વધારવા માટે તમારી ઉચ્છ્વાસના પાવરને સુધારવાની તાલીમ આપે છે. ફક્ત પ્રાણાયામની પ્રેક્ટિસ એ માનવ શ્વસન તંત્ર માટે શ્રેષ્ઠ કસરત છે. પ્રાણાયામ તમને તમારા શ્વાસ પર સ્વેચ્છાએ પકડ રાખવા માટે તાલીમ આપે છે, જે બદલામાં શ્વસન સ્નાયુઓના આઇસોમેટ્રિક સંકોચનને જાળવી રાખે છે. છઠ્ઠું છે પ્રાણાયામ ડિટોક્સિફિકેશનમાં મદદ કરે છે. પ્રાણાયામ સાથે દૈહિક વ્યાયામો શરીરને તેમજ મનને શુદ્ધ કરે છે. શ્વાસ બહાર કાઢવાની પ્રક્રિયા માત્ર શ્વાસ બહાર કાઢવાની સાથે જ સંબંધિત નથી, પણ તે સાથે શરીરમાંથી કચરો, ઝેરને આપણા સિસ્ટમમાંથી બહાર કાઢવા અને શરીરને યોગ્ય રીતે અગત્યના પહોંચન કાર્ય
હેલો
માટે
મેડમ.
બનાવવાની.
હેલો મેડમ, આઈ એમ ઓડિબલ?
યસ સર.
તમે છે ને પ્રાણાયામના ડાયરેક્ટ વૈજ્ઞાનિક ફાયદાઓ જણાવો ને.
યસ સર, ડાયરેક્ટ તો ફાયદાઓ જણાવું છું. હવે બસ ઓલમોસ્ટ 2 જ બાકી છે મારા ફાયદાઓ.
હા એટલે ઓકે ઓકે.
સર વચ્ચે વચ્ચે અવાજ આવે છે બીજો એટલે
હા
કદાચ પ્રોબ્લેમ થતી હશે.
ના વાંધો નહીં, એટલે કી પોઈન્ટ્સ તમારા કહી દઉં એમ.
ઓકે સર. લાસ્ટ છે મગજના વિકારો માટે અસરકારક. પ્રાણાયામ ઝેરને માત્ર લોહીમાંથી મુક્ત કરવામાં મદદ કરે છે, પણ મગજની ફિલ્ટરિંગ ક્ષમતામાં પણ વધારો કરે છે. તે બ્લડ બ્રેન બેરિયર દ્વારા મગજમાં નેનો પાર્ટિકલ્સના પેસેજને વધારે છે અને તે અનિચ્છનીય ઝેરી પદાર્થોને પણ ફિલ્ટર કરે છે. જેને તમે વારંવાર પ્રદુષિત વાતાવરણમાં શ્વાસ લો છો તે ઝેરને પણ ફિલ્ટર કરે છે અને ધૂમ્રપાનને કારણે જો સંચિત થાય છે એને પણ બહાર કાઢે છે, તો ફિલ્ટર કરે છે. ઓકે, મારા કી પોઈન્ટ્સ છે પ્રાણાયામ, કાર્ડિયોવેસ્ક્યુલર સિસ્ટમ, ફેફસા, રોગપ્રતિકારક શક્તિ, ડિટોક્સિન્સ. ડન સર. સર અવાજ નથી આવતો આપનો.
Devta sir, please unmute yourself.
ઓકે, હેતવી મેડમ,
જી સર.
તમે જે વૈજ્ઞાનિક ફાયદાઓ છે એનું કોઈ પ્રૂફ છે તમારી પાસે?
સર આ બધા ફાયદાઓ મેં મારા પોતાના ઉપર ઇમ્પ્લિમેન્ટ કરેલા છે અને મેં જે અનુભવ્યું છે એ જ આમાં લખેલું છે. અને હા, સાથે સાથે મેં એવા પણ ફાયદા લીધા છે કે જે મેં મારા ક્લાયન્ટ ઉપર અનુભવેલા હોય તો એમને ફાયદો થયો હોય.
ઓકે, તમે યોગનું આ ક્લાયન્ટ પણ તમારા છે યોગના, એની પણ તમે રિસર્ચ કરો છો કે પછી તમારું?
નહીં સર, હું પોતે યોગના ક્લાસ કરાવું છું, તો એ લોકો મારી પાસે થેરાપેટિક યોગ કરવા માટે આવતા હોય અને એમના જે મારા પ્રાણાયામ પરથી એમને જે ફાયદો થયો હોય એ મેં અત્યારે લીધેલું છે.
ઓકે, એનું કોઈ સ્ટેટિસ્ટિકલ કોઈ એમનું તમે એનાલિસિસ કરેલું છે?
નો સર, સ્ટેટિસ્ટિકલ કોઈ એનાલિસિસ કરેલું નથી, કારણ કે સર આ આર્ટિકલ છે. જો પેપર હોય તો હું ઓબ્વિયસલી એમાં સ્ટેટિસ્ટિકલ એનાલિસિસ કરે સર.
ઓકે, જયમાં સાહેબ.
ના ઓકે, ખૂબ સરસ સુતરિયાબેન, સરસ, તમારું પ્રેઝન્ટેશન ખૂબ જ સરસ હતું.
થેન્ક યુ સર.
ખાલી પીપીટી પ્રેઝન્ટેશન હોય તો મજા આવે થોડી, એટલે નેક્સ્ટ ટાઈમ
સર
પ્રયત્ન કરજો. તમારું ખરેખર ફાઇન હતું.
થેન્ક યુ સર. સર પીપીટી હતું પણ હું સ્ક્રીન શેર કરતા ભૂલી ગઈ હતી.
ઓકે ઓકે, ના સરસ હતું તમારું પેપર.
થેન્ક યુ સર.
હેલો, થેન્ક યુ હેતવીબેન. હવે
થેન્ક યુ
આગળની
સર.
કાર્યવાહી માટે મેં ડોક્ટર ટન્યુબેનને વિનંતી કરીશ, અને તે પહેલા અન્ય ચેર અને કો ચેર દેવતા સાહેબ અને એમના નાયક સાહેબને વિનંતી કરીશ કે એનું ઉદ્બોધન બોલે. દેવતા સાહેબ.
આપણે આજે ટોટલ 8 પેપરો જોયા. એમાં પહેલું પેપર હતું નિલયનું, જેમાં 17 થી 22 વર્ષની બહેનોનો ટી ટેસ્ટ લીધેલો હતો. એના આપણે એમને જે પણ કીધું કે બહુ જ ઓછી મિનિટનું કરેલું ને એ બધું જે વાત થઈ છે એ વાત કરી છે એમાં. એટલે એમને જોવાનું છે. બીજું પેપર હતું પ્રાણાયામ અને વૈજ્ઞાનિક ફાયદાઓ. એમાં પણ આપણે એના વૈજ્ઞાનિક ફાયદાઓ એમને જણાવ્યા. ત્રીજું પેપર હતું મૌલિક પટેલનું, જેમણે 50 ભાઈઓ 17 થી 25 વર્ષના એટલે એમાં તફાવત જોવા મળ્યો ન હતો એમના પેપરમાં. વૈજ્ઞાનિક પ્રવાહ અને શારીરિક શિક્ષણના પ્રવાહનો તુલનાત્મક અભ્યાસમાં. ચોથું પેપર હતું મનોરંજક રમતો અને સૂર્ય નમસ્કારનું, બ્રિજેશ પ્રજાપતિનું હતું, 18 થી 25 વર્ષના બહેનોનું. એનામાં ઝડપ પર એમનું સેમ્પલિંગ એમણે લીધેલું હતું, એફ રેશિયો શોધ્યો હતો. આ સિવાય પાંચમું પેપર હતું અલ્પેશભાઈ જાનું, એમણે પણ પ્રેઝન્ટેશન કરેલું હતું અને ડોક્ટર યશવીર સિંહ અને ડોક્ટર મહેશ ભાર્ગવનું પ્રસ્તાવન લઈ અને એમને વ્યક્તિત્વ વિઘટનના માં ચડિયાતા હતા એવું એમને સાબિત કરી બતાવ્યું હતું. છઠ્ઠું પેપર હતું મનહરભાઈ રાઠવાનું, જે આદિવાસીના બહેનો પર એમણે સંપૂર્ણ તપાસ 12 અઠવાડિયાની ટ્રેનિંગ કરેલી હતી. અને છેલ્લું અંકિત સ્પોર્ટ્સ ફિટનેસનું અને સ્પોર્ટ્સ મેનેજમેન્ટનું કમલેશભાઈનું હતું. એવા 8 પેપરો એ લોકોએ રજૂઆત કરી હતી, 8 પેપરોની. અને એમાં ઘણા પેપરમાં જે કહેવાનું હતું દરેક પેપરમાં વાત કરેલી જ છે. અને ઘણા પેપરો સારા પણ હતા અને ઘણા પેપરની ઇમ્પ્રુવમેન્ટની પણ જરૂર હતી, જે અમે વારંવાર એ લોકોને એ પેપર પછી જણાવ્યું હતું. હું આ પ્રસંગે ખાસ તો I and Jaymal like to thanks organizing committee, especially thanks to Jignesh, Dr. Jignesh and his team. Dr. Amit sir, Dr. Tanvi, Dr. Pariksit, Dr. Janvi, and my colleagues, Dr. Jaimal. આ બધાનો હું આભાર માનું છું અને ખૂબ સારું આયોજન કર્યું ભેગા થઈને આખું યંગ ટીમે અને આવી રીતે કરતા રહો એવી આશા રાખું છું અને દરેક જે આ રિસર્ચ પેપર જેમાં રજૂ કર્યા એમનો પણ ખૂબ ખૂબ હું આભાર માનું છું છેલ્લે હસમુખ સર પણ છે તેઓ પણ છેક સુધી રહ્યા તેમનો પણ આભાર માની વિરમું છું જય હિન્દ જય ભારત જય ભારત
દેવતા સાહેબે બધું જ કહી દીધું છે પણ પ્રિન્સિપાલ મેડમ અને સાર્વજનિક એજ્યુકેશન સોસાયટી અને ખાસ કરીને જિગ્નેશ મંડલ અને એની પૂરી ટીમ ખૂબ જ મહેનત કરી છે એક દિવસનો વેબિનાર હોય છે પણ એના માટે એક મહિનાથી પણ વધારેની સખત મહેનત હોય છે તો આ તબક્કે સાર્વજનિક એજ્યુકેશન સોસાયટી કેપી કોમર્સ કોલેજ અને જિગ્નેશ મંડલ સાહેબ ખૂબ ખૂબ અભિનંદન પાઠવું છું થેન્ક યુ
Thank you, Devita sir. Thank you, Vimal sir. Thank you, Hasmukh sir. Thank you, all participants. Our message is Dr. Tanvir.
Thank you, Dr. Amit. Wow, what an event. It's really great that this national e-conference turned out to be very successful. I want to thank everybody who has worked hard to make this e-conference successful. I would like to call a man behind this successful e-conference to deliver vote of thanks to the people who made this event successful. I would like to take a minute and call Dr. Jignesh Nande to give a vote of thanks. Screen is yours, Dr. Jignesh Nande.
Thank you, Dr. Tanvi ma'am. A very good evening to all. On behalf of IQSCM Department of Physical Education of Sir KP College of Commerce, I, Dr. Jignesh Tandel, is here before you to present a vote of thanks. I offer my sincere gratitude to all the chairpersons of the session, Dr. R. Ram Mohan sir, Dr. Hasmukh Patel sir, and Dr. Bhavas Devta sir, and co-chairperson of the sessions, Dr. Janvi Chaparia, Dr. Vikas Prajapati, and Dr. Jamal Nayak of this conference. I would also like to thank all the presenters for sharing their views and insights of the knowledge. Also, I big thanks to all the moderation of the paper presentation track, Dr. Tanvi Kalpara, Dr. Himanshu Dave, and Dr. Amit Patel for effective handling of the entire session. I would also like to thank backbone of the conference, Dr. Janvi, Dr. Pariksit, and my dear students. I also thanks to all the technical staff of the college for technical support. Lastly, thanks you to all who have support in making this conference a great success. Thank you once again.
Thank you, Dr. Jignesh Nande. Now we are
Uh, One important announce for the regarding the feedback links. Due to some technical reason, your feedback link will be sent to your email ID tomorrow. Feedback link is active for 48 hours only, and registered participant get the certificate. And the certificate of paper preparation will be sent in within 2 days. Thank you once again. Over to Tanvi ma'am.
Thank you, Dr.
Thank you,
Jignesh
Dr.
and
Jignesh
entire
Nande.
team. Thank you
Now we
very
are
much.
officially conclude this national e-conference on advances in sports, exercise science, and pedagogy of physical education. Hope we will meet again like with this type of conference. Officially, I am ending this meeting. Thank you so much.
Thank you.
Thank you. End the meeting.